Hi, I'm Becker. I'm trying to learn medicine. Today, interventional cardiology. And after that, we're going to do standing yoga. And if you participate in the standing yoga, that's at your own risk. Interventional cardiology. Interventional cardiology is a branch of cardiology that deals specifically with a catheter-based treatment of structural heart diseases. Okay, first of all, it is a medicine, so it's partly of medicine, serious medicine. And it is a branch, it is a part of, or a specific area of cardiology, and that is of the heart. So far do I know. And that means interventional cardiology is a specific branch, a specific category of heart medicine. And this interventional cardiology deals specifically with a catheter-based treatment of structural heart diseases. Andreas Grünzig is considered the father of interventional cardiology after the development of angioplasty by interventional radiologist Charles Dotter. Who didn't know Andreas Grünzig or Charles Dotter? Andreas Grünzig is considered the father of interventional cardiology after the development of angioplasty by interventional radiologist Charles Dotter. Let's see first here with a picture on the side. Yes, I didn't say it. So we're talking about medicine, internal anatomy, and also diseases, especially heart disease. The next thing here, a coronary angiography and angioplasty in acute myocardial infarction. Okay, first the picture, then I read it again. Okay, what is that? That is coronary angiography and angioplasty in acute myocardial infarction. On the left is the right coronary artery, RCA, right coronary artery, closed, on the right, successfully dilated. Okay. That is an angiography, so that type seems to be an angiography. I haven't really got it all out, but that seems to be angiography, that type of imaging. This, to do this picture is called angiography. And I think now the picture itself is angioplasty and not the treatment which is done there. And that whole thing is pictured during acute myocardial infarction, so when the heart had a heart attack. When one part of the heart had an infarction. And it is to see the right coronary artery, the RCA. So maybe we're taking that as the most important part. RCA means right coronary artery. RCA. And that is closed here. And on the right side, it is successfully dilated. So I think that means opened again. Okay, we see here, during or shortly after the heart attack, on the left side, I think that one, the RCA, the right coronary artery, closed, and here it is dilated again. And this interventional cardiology is about catheter-based treatment of structural heart diseases. Many procedures can be performed on the heart by catheterization. Okay, there are many things which can be done on the heart with catheters. This most commonly involves the insertion of a sheath into the femoral artery, but in practice any large peripheral artery or vein, and cannulating the heart under X-ray visualization, most commonly fluoroscopy. Okay, there are many possible procedures which can be done with the heart if there are structural heart diseases, like closed. But I think that patent means closed, or patents mean open, or whatever. Now, if there are problems with the heart, with all these arteries of the heart, then there can be done catheter work. And these catheters most commonly involve the insertion of a sheath inserted into the femoral artery, bigger in the leg. And in these arteries, there is the sheath coming in, but in practice, any large peripheral artery or vein, but also other large veins can be used for arteries. And cannulating the heart under X-ray visualization, most commonly fluoroscopy. Maybe that thing is a fluoroscopy and the angiography is something else. The radial artery may also be used for cannulation. Here having the right coronary artery, not the radial artery. Can also used for cannulation. This approach offers several advantages, including the accessibility of the artery in most patients, the easy control of bleeding, even in anticoagulant patients, the enhancement of comfort because patients are capable of sitting up and walking immediately following the procedure, and in the absence of clinically significant sequelae in patients with a normal Allen test. Downsides of this approach include spasms of the artery and pain, inability to use larger catheter needed in some procedures, and more radiation exposure. But in recent times, the radial approach is getting popularity due to its patient comfort after procedure. The main advantages of using the interventional cardiology or radiology approach are the avoidance of the scars and pain and long post-operative recovery. Additionally, interventional cardiology procedure of primary angioplasty is now the gold standard of care for an acute myocardial infarction. It involves the extraction of clots from occluded coronary arteries and deployments of stents and balloons through a small hole made in the major artery, which has given its name, pinhole surgery, as opposed to keyhole surgery. Okay. Cardiology, interventional cardiology, is about bringing catheter, balloons, or stents through another artery, the femoral artery, and I think the radial arteries that we are in. And I don't really understand how it should help the heart now. Are they brought from there up to... And interventional cardiology works now to get the heart running again if the arteries have closed by a heart attack, for example, or if there are structural heart diseases that the bloodstream, the blood vessels are too close because of occluded, does it? Oh, yeah. Okay, we will continue for the next part. We're going to read this middle part here very carefully. I just read now, but because I want to. Now, in the next part, we will read it all again carefully. So, if you're here for interventional cardiology or medicine all over, you can go directly to the next video. We will do now the standing yoga. And if you participate in the standing yoga, sit here on this, breathing in and lift the arms up. Doing the easy swings. And breathe out the arms again down. Again, in the arms up. And out the arms down. Again, in the arms down. And out, open the arms to the side. In the arms up. And out, open the arms to the side. Again, in the arms up. Make an space between the toes. And we're doing the hide and seek playing palm tree. Open the arms to the side. Breathe the arms up. And out, we're sinking down into half chair. Again, in and up. And breathe out, open the arms to the side. Breathe again in and lift the arms up. And breathe out, sink again down. And we're breathing in and coming up. We're doing the mark core, close the feet again. And breathe out and open the chest to the sky, down over the arms down. Breathe in, reach up, over across the arms, intertwine the fingers, reach high. And reach in front, hold off the back and breathe out. Breathe in the arms up. Breathe out the arms down, open the chest to the sky. Breathe in, lift the arms up, over across the arms, reach high, breathe in. And breathe out, reach in front, hold off the back. Breathe in the arms again up. And out and down. Make an inch space between the toes. And we're leaning onto our knees. We're doing standing cat and cow. Breathe in. And out. We're making head of the back, the cat. Breathe in into the middle. And out. The belly of the back, the cow. Again, in into the middle. And out. And out. Breathe in into the middle. Out and last time into the cow, the belly of the back. in into the middle. And out with a sharp back up and at the top of backwards shoulder roll. Still the feet 1 inch space apart. Breathe in, lift the arms up. Halfway only. Come up onto tiptoes. And breathe out, lift the arms higher up. Now breathe in, reach high. And out and we're sinking down into the full chair. Still on tiptoes. Breathe in and up again. And out again, down into the chair. And again up. And we're doing the down diving dolphin. Heels down, arms over sides down, close the feet and we're down again. Now we're doing the marmot. Breathe in and bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Breathe in and change. And out and stretch the left leg. Breathe in and change. And out and stretch my leg. Breathe in. And out, both legs straight. We're doing the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathe in the arm back in. And out and down. Breathe in, open the left arm up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in the arm again down. And out and down. We're doing the pelican. Make a hand of space between the feet. Shift the weight to the heels. And breathe in and go down. And out and up again. Again in and down. And out and up. Again in and down. And out and up. We're doing the Chamberlain's counterweight. Take hold on the elbows and gently swing from side to side. Both hands again down, feet together. Breathe in, come halfway up with a straight back into monkey half lift. Out and down again. Again in halfway up. And out and down. Now breathe in the up diving swan, the arms out and up. We're coming up. And the arms down again. We're doing the stretch of Venus. Feet together. We're intertwining the fingers behind the back. Bring them over to one side. We're breathing in, tall up. And out, we're looking over to the side where the hands are. And we're bringing the chin down to the clavicle. Breathe again in. And out, with the arm a bit in and the shoulder down. Breathe again in, lift the gaze. And out, back into the middle. Now the arms to the other side. Breathe again in. Tall up. And out, look over to the hands. Or where the hands are to the side. And bring the chin down to the clavicle. Breathe in. And out, pull the arm a bit in and the shoulder down. Breathe again in, lift the gaze. And out into the middle. We're doing the crab in the morning, breathe in. And out, bring the arms down over the chest to the sky. Breathe again in, up with the arms. Out and down. Breathe in, bring the hands together. Out and lean back with the hands together, the thigh, the reed in the wind. Breathe again in into the middle. And again out and back. Breathe in into the middle. And the sky hugger, breathe out the arms long and out up to the sky. Breathe again in the arms up. And out the last time the sky hugger. Breathe in the arms up. And out and down. And we're doing a few eagle's wings. So breathing in, lifting the arms up. And breathe out the arms again down. Again in the arms up. And out the arms down. And the last time the eagle's wings, breathe in, lift the arms up. And out the arms down. Now breathe in and lift the arms up. Bring the hands to touch and then lower the hands slowly down to heart center. That was for standing yoga. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today, interventional cardiology. And after we've done it, we're going to do standing yoga. And if you participate in the standing yoga, that is at your own risk. Now this is part 2 already. And we had that interventional cardiology is a branch of cardiology, so something which deals with heart diseases. And it is specifically focused on catheter-based treatment of structural heart diseases. Now, in the next part that we intended to read now carefully. Many procedures can be performed on the heart by catheterization. This most commonly involves the insertion of a sheath into the femoral artery, but in practice, any large peripheral artery or vein, and cannulating the heart under X-ray visualization. Cannulating under X-ray visualization, most commonly fluoroscopy. So the X-ray is just used to see what is done by the cannulating. The radial artery may also be used for cannulation. Now we're talking now about the advantages. Now what is catheterization? We're going to come later to what it is. It's not written here. I don't really get how it helps the heart if there's something done at the femoral artery or at the radial artery, at the leg or in the arm. Is it pushed through from the femoral artery because we're using the large veins instead of to the heart? I'm just wondering about it for quite some time. The radial artery may also be used for cannulation. This approach offers several advantages, including the accessibility of the artery in most patients. I think the radial artery is here. I don't know exactly, but it's the one where you can feel the pulse. There are several advantages, including the accessibility of the artery in most patients, the easy control of bleeding, even in... Okay, we're talking about diseases, cardiovascular diseases, the blood system now. Okay, easy control of bleeding, even in anticoagulant patients. I think anticoagulant patients are people who take medicamentation to make the blood thinner. And yes, the bleeding is easy to control because the arm is closed, I think. And the enhancement of comfort because patients are capable of sitting up and walking immediately following the procedure. Okay, doing it at the arm, not at the leg. But the people can sit up immediately and walk after the procedure. And the near absence of clinically significant sequelae in patients with a normal Allen test. Whatever a sequelae is or the Allen test. Downsides to this approach includes spasm of the artery and pain. But isn't it logically that the same happens at the femoral artery? Spasms and pain, inability to use larger catheters needed in some procedures. So I think the radial artery is smaller than the femoral artery. So larger catheters don't work as good. And more radiation exposure. Why more? Because it is more difficult. The first idea is, and the one which I don't believe it is, because it is more difficult to work there and now it has to be done longer or whatever. And the second idea is because it's closer to the body. I would say so. And where does the radiation come from? From the X-ray visualization to see through the X-ray what is happening by the cannulating? Now what is the fluoroscopy? But in recent times, a radial approach is getting popularity due to its patient comfort after procedure. Is it just about patient comfort, or I would add in this part, if it is about the patients can more or less immediately afterwards sit up and walk, then it's not just about comfort. But it is very helpful for the cardiovascular system that the people can exercise or be active again. What I would add is this part that it is more than just about comfort. Because the downsides of spasms and pain also, that's also about comfort, inability to use larger catheters and radiation exposure, these are serious things. It's not about a little uncomfortness of not immediately able to walk and sit again. So we have to look at whether the information here is insufficient for proper medical outcomes. The main advantage of using the interventional cardiology or radiology approach are the avoidance of scars and pain. Now, why are scars and pain avoided? Maybe pain not from the operation, but afterwards. We're very at the beginning here. We're learning very at the beginning, so I think it's okay to speculate here that this is not a medical lecture. We are clearly learning here. And we're doing it very openly. Scars and pain. Now, if it would be done at the heart, then the scars would be bigger. But is there really no scar at all? There can't be. And pain, is it afterwards pain? That could also be. And long post-operative recovery. Okay, that makes sense. To do an approach to operate something, to make something function again at the heart, then the recovery is shorter if operation was done at the arm or the leg. Additionally, interventional cardiology procedure of primary angioplasty is now the gold standard of care for an acute myocardial infarction. Okay, interventional cardiology procedure of primary angioplasty. Okay, angioplasty, where we have a picture here. Here's a coronary angiography and angioplasty in acute myocardial infarction. Angioplasty is a procedure, not the method of making this picture. That could be the method of making this picture could be X-ray or fluoroscopy, or yes, X-ray or fluoroscopy. Angioplasty seems to be the procedure, and that is now the gold standard for care of an acute myocardial infarction, so of a heart attack. It involves the extraction of clots from occluded coronary arteries and deployment. So clots are removed from occluded coronary arteries. Now, how is through an approach of radial or the femoral artery the removing of clots from occluded coronary arteries possible? And deployment of stents and balloons through a small hole made in a major artery, which has given it the name pinhole surgery, as opposed to keyhole surgery. Okay, it is used to get clots out. These seem to be something blocking. And deployment of stents and balloons. Stents are placed in and they are then holding the vessel open. And I just don't understand how balloons work. Are we just opening it up again? Are they staying in there? I don't get it. And again, we are openly learning. This is not a lecture video or an information video. We're openly learning. Okay, that is better. We are through with the introduction of a Wikipedia article. This is just a little broad overview. We will learn very much on. Now, that was it for now. If you work here for medicine or interventional cardiology, we will read on there. There's a bit more to the procedure. If you're here for interventional cardiology, you can go directly to the next part. We're going to do now standing yoga. If you participate in standing yoga, that is at your own risk. We're bringing the feet stand together and we're doing vegan swings. So we're going to the arms up. Down the arms up. And again, in the arms up. And out the arms down. And again, in the arms up. And out the arms down. And in the arms up. And out the arms down. Now bring in the arms up. And out the arms to the side. And the arms up again. And out over to the other side. In the arms up. Back in space between the toes and out over to the other side again. In the arms up. And out we're sinking down, arms over the side, down we go, down into half chair. Breathing up again. And out on the one side. Breathing in. And out again down into half chair. And then up again. And out the arms down. We're leaning onto our knees. We're doing standing cat and cow. Breathe in. And out. Make a hill of the back. The cat. Again in into the middle. And out and making a round back. The cow. Again in. Out. The cat. Again in. And out of the cow. We've in into the middle. And out we're coming up with a round back, making it a backward shoulder roll and lifting the arms up. We're breathing in and we're coming up on the tiptoes. We're reaching high. And out and we're sinking down into the chair. Breathing in and come up. And out again down. Again in and up. And out we're doing the down diving dolphin, the arms down, feet together, and just down. And we're doing a moment. Breathe in and bend the right leg. And breathe out and stretch the left leg. Again in and change. And out and stretch the right leg. Again in and change. And out and stretch the left leg. Again in and change. And out and stretch the left leg. Again in and change. And out both legs straight just down. We're doing the penguin. Breathe in and lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Again in and the arm down. And out and down both legs straight. Breathe in and lift the left arm up to the sky. Breathe out, bend the right knee and look over the right left shoulder to the left hand. Breathe in and inhaling and down. And out and down. And we're doing the pelican. Make a hand of space between the toes. Shift the weight of the heels. And breathe in and come out. And out and up. Again in and out. And out and up. In and down. And out and up. Now we're doing the Haemorrhage counterpick. Take hold on the elbows and gently rock from side to side. And both hands again down. Close the feet, you're breathing in, coming halfway up into monkey half lift. And out and down again. Again in halfway up into monkey half lift. Out and down. And breathe in, we're doing the up diving swan. With the arms again up. And down. And we're doing the stretch of Venus. Make sure they're wide apart. Intertwine your fingers behind the back. Bring them over to one side. Tall up, breathe in. And out, look over to one side, to the side where the hands are. And out, bring the chin down to the clavicle. Now breathe in. And out, pull the shoulder down into the armpit. Breathe again in, lift the gaze. Out into the middle. Arms over. Breathe in. Hold up and look to the side. Bring your hands, bring the chin down to the clavicle. And breathe in. And out, pull the shoulder down and a bit in the arm. Again in, look up. Out into the middle. And now, feet are standing together. And we're doing the crab in the morning. Breathe in, arms up. And out, just to the sky. Breathing in, the arms up. And out again, the arms back and over, just to the sky. Breathing in, the arms up. Now across the arms, intertwine the fingers, reach to the front, hollow the back of the tray. Breathe in the arms again. Out with the sky hugger, long arms down, chest to the sky. Breathe out, up across the arms, intertwine the fingers, reach high, breathe in. Out the arms in front, hold the back, the breath. Again, in the arms up. And the sky hugger, open the arms wide and over chest to the sky. In the arms up and down. And a few eagle's wings, breathing and lifting the arms up. And out and the arms down. And the last time, breathe in the arms up. Bring the hands to touch and lower the hands slowly down to heart center. That was the standing yoga. I thank you very much and until the next time. Hi and welcome. I'm trying to learn medicine. Today, interventional cardiology. And afterward, we're going to do selected yoga exercises. And if you participate in the selected yoga exercises, that is at your own risk. Now we start already part 3. The main advantage of using and this is about internal anatomy, diseases, and the blood system. The main advantage of using the interventional cardiology or radiology approach are the avoidance of a scars and pain and long post-operative recovery. Okay, using interventional cardiology has advantages. It is a branch of cardiology, so of medicine of the heart, which uses catheters, stents, and balloons to treat occluded veins or other things. Additionally, interventional cardiology procedure of primary angioplasty is now the gold standard of care for an acute myocardial infarction. Additionally, interventional cardiology procedure of primary angioplasty. What is angioplasty? It's now the gold standard. So to do this interventional cardiology with catheter, stents, balloon is the main treatment of myocardial infarction. It involves the extraction of clots from occluded coronary arteries and deployment of stents and balloons through a small hole made in a major artery, which has given it the name pinhole surgery as opposed to keyhole surgery. So it would be keyhole going into the chest and okay, these clots which are occluding the coronary arteries, the arteries which are bringing the blood to the myocardium as the heart, the big muscle which is pumping. That is done through inserting these stents and balloons through the radial artery, I think it is here in the arm, or the femoral artery in the leg. Is it been completely... Why not? They are quite big and they are pretty directly going where they should. It's not so much, it's just a meter or half a meter. I don't know, they would say just so much, and it goes pretty straight forward to the heart. So they are then coming in at the leg of a radial artery, and they are then pushed through completely through the artery up to the heart. And then there's a stent brought in, and that stent is now going into the occluded artery, as far as I know, and opens it up, and it stays in there like a pipe. So it's a pipe inserted. And now the artery can't close anymore because there's no pipe. But that stent can also get dirty. I don't know what it's called now. So it's not the end of the whole story. But stents can be brought in balloons, and this is done through a pinhole, through a small hole, I guess, when just at the radial artery or the femoral artery. Instead of, I think the opposite would be we go directly to the heart. I don't know. Procedures. Angioplasty, where we have it. Angioplasty is an intervention to dilate either arteries or veins. Okay, angioplasty is the intervention. It is not the disease. It is the intervention. So people, the medicines, whatever you call it, the doctors, they are going there and they are performing the angioplasty. Now, what does the sentence mean? Additionally, interventional cardiology procedure of primary angioplasty. Yes, even as a method, it is the interventional cardiology procedure of angioplasty. And this angioplasty is the gold standard of care for an acute myocardial infarction or heart attack. Angioplasty is an intervention to dilate either arteries or veins. Percutaneous coronary intervention, PCI or coronary angioplasty. The use of angioplasty for the treatment of obstruction of coronary arteries. Now we have to find out the difference between occluded and obstruction. For use of the angioplasty for the treatment of obstruction of coronary arteries as a result of coronary artery disease. A deflated balloon catheter is advanced into the obstructed artery and inflated to relieve the narrowing. Certain devices such as coronary stents can be deployed to keep the blood vessel open. Various other procedures can also be performed at the same time. After a heart attack, it can be restricted to the culprit vessel, the one whose obstruction or thrombosis is suspected of causing the event, or complete revascularization. Complete revascularization is more efficacious in terms of major adverse cardiac events and all-cause mortality. PCI is also used in people after other forms of myocardial infarction or unstable angina, where there is a high risk of further events. The use of PCI in addition to anti-angina medication in stable angina may reduce the number of patients with angina attacks for up to 3 years following the therapy. But it does not reduce the risk of death, further myocardial infarction, or need for other interventions. We don't have the time and I don't have the voice to go through it now in detail. What means in the next part, we could actually do it as a separate part. There's so much. Just to, maybe we're going to split it actually up. The next part will be learning interventional cardiology. So interventional cardiology, PCI, percutaneous coronary intervention, or coronary angioplasty. We're going to call it long and the short one. Percutaneous coronary intervention, PCI. Okay, and the next part will be then, as I said, interventional cardiology, PCI, percutaneous coronary intervention. That means you have to search for that video. But whenever we will do the next video to medicine and that subject comes up, I'm going to tell what we did in the other video, providing with this video. Now, if you were here for medicine or interventional cardiology, you can go directly to the next video. You'll probably come back to interventional cardiology for the other things written on the page. But we're going to talk maybe so long about that. Why not have it in the title somewhere? You can go directly to the next video if you're here for that. We're going to do the selected yoga exercises now. If you participated in the selected yoga exercises, that is your own risk. And feet are standing together, breathing in with the arms up. And out the arms again down. The eagle's wings. Breathe in and lift the arms up. And breathe out, let the arms down. Again, in the arms up. And out the arms down. Again, in the arms up. And out the arms down. And doing the trap in the morning. Breathe in, lift the arms up. Breathe out, let the arms down, open the chest to the sky, lean back. Breathe again in, lift the arms up. And breathe out, lift the arms down, open the chest to the sky, draw the shoulder blades together. Again, in the arms up. And we're going over to the fern, the wind. The reed in the wind. Breathe in. And breathe out and lean back, the reed in the wind. Again, in into the middle. And out and back. Breathe in into the middle. Now we're doing the fern, the wind. Breathe out and lean to the side. Breathe in into the middle. And out over to the other side. Now we're doing the drill. Over cross the arms, intertwine the fingers and reach high. And out, reach to the front and hold over the back. Breathe again in, lift the arms up. And change the position of the arms and the intertwine fingers and reach again high. And out, reach again in front. And hold over the back. Breathe again in. And out the arms down. Now we're doing cat and cow, standing cat and cow. Make an inch space between the toes or the feet. Lean onto the knees and breathe in. And out and making a head with the back, the cat. Breathe in again into the middle. And out. Make a belly with the back, the cow. Again in into the middle. And out. Make a head with the back, the cat. Again in In and out. We come with a jump back up, making the shoulder become directly on with a chair. We're lifting the arms up, and we're breathing in, we're coming up onto the toes. And breathe out, and we're sinking slowly down. And breathe in and come up again, still onto the toes. And out again, down. And breathe in, come up again. And out, bring the arms down. We're doing the down diving dolphin. We're going down, both legs straight. Breathe in, bend the right knee. Breathe out, stretch only the left leg from marmot. Breathe in and change. And out and stretch only the right leg. Again in and change. And out and stretch left leg. Again and change. And out and stretch the right leg. Again in. And out, both legs straight. We're doing the penguin. Breathe in and lift the right arm up to the sky. Bend the left knee and look up over the shoulder to the right hand. Breathe out. Breathe again in, the hand in. And out and down. Breathe in, lift the left arm up to the sky. And breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe again in, the hand down. And out and down. We're doing the pelican. Make a hand with space between the toes. Shift the weight to the heels. And breathe in and go down. And out and up again. Again in and down. And out and up. Again in and down. And out and up. Now take hold on the elbows. And we're rocking gently from side to side. The trebuchet is counterweight. And both legs again down, close the feet. We're coming halfway up. Breathe in, straight back, monkey half lift. And breathe out again down. Breathe in again, halfway up, monkey half lift. And out and down. Breathe in, lifting the arms up. Bring the heels to the shoulder wide apart, the toes are pointing outwards, and we're sinking down, breathe out. Place the heels against the inside of the knees, the garland pose. Breathe in and straighten up the back. And out, come up with the crown of the head first upwards. The arms to the side and bring the arms again up, breathe in. And out, we sink again down. Elbows against the inside of the knees. Breathe in, straighten up the back. And out, straight line up again. Breathe again in, lift the arms up. And out, the last time down. Breathe in, straighten up. And out, straight up. And the arms down. Now we're doing the stretch of Venus. Intertwine the fingers behind the back. Bring them over to one side. Breathe in, tall up. And out, turn the head to the side where the hands are. And bring the chin down to the clavicle. Now breathe in. And out, pull the shoulder down and the arm in. Again, in, lift the gaze. And out, over to the outside. Slowly change the position of the arms. Tall up and look over to the side of the hands now are. And bring the chin down to the clavicle. Breathe again in. And out, pull the shoulder down and the arm in. Breathe again in, lift the gaze. And out into the middle. And we're doing the markhor. Breathe in, lift the arms up. Breathe out, bring the arms back, open the chest to the sky, draw the shoulder blades together. Breathe in, over cross again the arms. Intertwine the fingers, reach high, and reach again in front and hollow the back. Again in, up with the arms, and out and back. Draw the shoulder blades together, over the chest to the sky. Breathe in over, cross the arms, intertwine the fingers, reach high. And now reach in front, hold of the back. Again in. And the last exercise, open. The arms to the sky and open chest, again in and up. And out and back, a second, last time the sky, haka. Again, up. And out. And we're ending with the eagle's wings. Breathe in, lift the arms up. And breathe out the arms down. Again, in the arms up. And out and down. And the last time, breathe in, lift the arms up. Bring the hands to touch and slowly lower the hands down to heart center. It was for standing yoga. Oh no, it was for selected yoga exercises. It was very similar as we did it. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine, today interventional cardiology, and after we've done that, we're going to do medial plane training. And if you participate in the medial plane training, this is your own risk. Now first one thing, we had here 1 to 2 times the word dilation. Where did we have it? No, don't use the time to remember what word we're going to have explained, Dilation. It was not in the introduction. Okay, when it was here by PCI. Okay, we can't find it at all. Okay, we had 2 similar names, and one of them was vasodilation and the other one was vasoconstriction. Constriction, that's very important. We want to do it when it's important of a video. Now, we had in biology vasoconstriction and vasodilation. Now, in every human body, in thermoregulation did we have it, and if a human body wants to change the thermoregulation and it is too warm, higher than 37 degrees, then vasodilation is happening. And if a body is too warm, then the person gets redder, the capillaries close to the surface get more redder, and the person sweats, and the whole thing with the vascular system, with more blood pumping, and I didn't end this. This video is about internal anatomy, diseases, and also the blood system. And that whole thing is called vasodilation, was written with bringing more blood to the extremities, to the limbs, and also to the surface, and that makes the person more redder. And that was called vasodilation. The opposite, if the person is too cold and the person shivers, that is then vasoconstriction happening, and less blood is coming to the fingertips, to the lips, the hands get blue, the fingers get blue, and that is called vasoconstriction. Now, in vasoconstriction is pretty simple. The blood supply is constricted and they are getting smaller. And the opposite is now vasodilation. So dialing something means to make it larger. Where we have the first word here used here, to dilate an artery means to make it larger. Okay, in interventional cardiology, we had done the PCI part in 3 parts. And basically what that is this angioplasty, which is the dilating of arteries and veins. It makes sense. Yes, an angioplasty is an intervention to dilate either arteries or veins. It is not very too close. The problem is that there's something stuck or that we're close to for mostly through coronary artery diseases. And I was saying with that explanation, there's dirt in it. And I think it's called plaque. But how about we just call it dirt? If it's called plaque or dirt, it is like dirt. Okay, I think it's called plaque, but we haven't written it here, so I don't know really. No, and the PCI is I don't really get it what it means. It is the bringing in of a deflated balloon through a radial artery, femoral artery, and then to expanding it through the obstructed or occluded. I think obstructed, occluded is the same, just that one means obstructed means maybe there's something blocked through a thrombosis, or through a thrombo. And occluded means that it has closed, but it has the same result, basically. Maybe a different treatment, but it's basically the same. There's no blood flow. Yes, and then it's widened, and then a stent can be put in to keep it open. But I don't really get the difference between stenting and catheterization. Now, what is the difference between a catheter and a stent? And so that's basically PCI. And now the next thing, we had it already. It's from valve, so it's valvoplasty. And that is the dilation of narrowed cardiac valves, the mitral, the aortic, or pulmonary valves. I forgot on that side, the tricuspid and the mitral valves. I showed it in the interventional part. Okay, so it's the wrong place to say it. I don't remember whether the mitral and the tricuspid part on that side. But the human heart has multiple valves. It's I don't know the four main, but there was the eustachian valve, and if it's not closed, then there is this septal defect. Maybe we come to that in the next part. Yes, we have it in the next part. So basically, the valves, the blood should not just go out into the aorta, and there's now the aortic valve, and it closes. And the blood should not just come from the right atrium and the left atrium, and there's no one of the two valves in between, and they open it only if it is pressed out and then closing them again. They are like the thing of shit. So if something presses against it, if the heart contracts, then the blood comes out, and if the heart releases again, the myocardium, then it just closes again, and the blood does not flow back. That's all. And there are a couple of valves, and these valves are doing a lot of work, and they are pretty small, and it's just a piece of flesh, basically. No, there can be something wrong. That is it. My whole life hates such a little thing. I don't know, but to realize it just... We have these 5, 6, 7, 8 valves, and all have 2 of them on both sides. And I don't know how big they are, but they can't be much bigger than half a centimeter. And this little fleshy thing is keeping people from dying. Okay, the next thing, congenital heart defect correction. We're having it here, basically. Percutaneous approaches can be employed to correct arterial, septal, and ventricular septal defects, closure of a patent ductus arteriosus, and angioplasty of the great vessels. Okay, this percutaneous approach, this PCI approach, I don't really get what it is. That section is just way too long. I don't know what is it now. In one sentence, is it the injection of a deflated balloon and inflating and then keeping it open? Whatever. Now, the atrial septum, so the atrium has also a septum between it. Does it, or is that a problem if it has a septum? No, it has a septum. It is the atrial septum defect if it is a problem. Wherefore is it even used? Whatever, there's the heart is 4 chambers, the atriums at the top and the ventriculars at the bottom, and there's the atrial septum and the ventricular septum through them, the blood should go through them. Yes, the one brings to the body, the other to one comes from the body, then comes to the lungs, and then from the lungs and in the lungs, so there has to be also away from them. And they don't work properly, and that is when corrected in the congenital heart defect correction in the interventional cardiology, and with congenital, these are the ones which are from birth, and also closure of a patent ductus arteriosus. No, I don't know where it is. But the other word which we have to look for open eyes is patent. I think patent. Now, what means patent? I thought that was mean. But it's. I don't want to say the wrong terms. So we have to look for dilating. Dilating seems to make larger. Obstructed seems to mean something stuck, and occluded means closed. And we now have to look for patent. I think it means open. And for the other 2, 3 terms, then you're going to do a presentation about when I say it very clearly. Maybe you're going to do something which makes it impossible to confuse these 2. But I don't think it happens. It's actually pretty easy and so used. And angioplasty of the great vessels. Now my voice is giving up. This was the part of now medicine to interventional cardiology. In the next part, we will continue with learning about just what is interventional cardiology. We will do now. What are we doing? The medial plane training. If you here for medicine, interventional cardiology, go directly to the next part. We will do the median plane training. It's the median. It's the median for the body, not the median. It's the median. It's the median plane training. If you participate in the median plane training, that is the honors. We warming a little up. We're bringing the leg up, we're doing the gradient motion. We're bringing the foot up and down, down. And the other leg up, and we're bringing the foot up and down, up and down. I forgot to say, but it's obvious that we're just learning, not that you don't should take medical advice from that, or lecture material or information in any way form. Maybe in the WhatsApp form. That's all it's real risk. We're just learning, we don't know what it is, we don't understand it yet. The next exercise will be bringing one leg up. Yes, we're bringing it up. In the right angle, the flex foot, even the hips, taller than the back. We're breathing in. And we're breathing out, we're bringing the leg to the side. Breathe again in. And breathe out the leg back into the middle and down. That is spine pillar exercise. Leg up, breathe in. And breathe out the leg to the side. Breathe again in. Out into the middle. Down. Other leg up. Breathe in. Out to the side. Breathe again in. Out into the middle. And down. And the other leg up. Breathe in. Out to the side. Breathe again in. Out into the middle. And down. And it was not medial plane. Medial plane. It is medial plane training. Leg up, and we're pressing over the top against the knee. Lighting up with the leg, flex foot, even line hips, taller than the back, little bend in the elbow. Now we're pressing from the inside. Now the knee presses up and to the side, up to the side. A few more. And the other leg. The leg up. Letting the leg flex foot, even hips taller than the back, and we're pressing from the inside against the knee. And we're pressing on the top first. And now knee presses to the side. And last exercise, the heavy swing ball. Leg up, right angle of the leg, flex foot, even hips taller than the back, and we're pressing the outside against the knee with a little bend in the elbow, and we're opening slowly the leg. And we're closing again. And we're opening again. And the last time. And closing. And now the aortic up. And we're pressing from the outside against the knee. And we're opening slowly. And the last time. And down. And we're doing the last exercise, the breathing in and down. Out. In and up. Out. And we cross the legs. And out. That was the medial plane training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine today. Achalasia of the Cardia, and after we've done that, we're gonna do leg injury prevention training. And if you participate in the leg injury prevention training, then it's better to ask. Achalasia of the Cardia. That is, yes, and we're talking about diseases, and it's the disease of the esophagus. The achalasia of Cardia, that is a rare disease, and you probably get it already, I'm learning. I'm not teaching. A rare disease, I never heard of it a few seconds ago. A rare disease in which the muscles of the esophagus, got it, fail to work properly. Okay, the esophagus is here, that goes from the mouth to the... No, I'm actually not sure anymore. It is the thing here, one of the two things here. Yes, and it's the thing for food. Normally, when food is swallowed, these muscles automatically set up a wave-like movement to the esophagus that pushes the food down towards the stomach. Okay, normally the food comes from the esophagus down to the stomach, and there is muscle movement, and that does it. Peristalsis movement must be, but I'm not really sure. So normally, when food is swallowed, these muscles automatically set up a wave-like movement to the esophagus that pushes the food down towards the stomach. The sphincter, that is the muscle ring at the lower end of the esophagus, relaxes and lets the food through. Okay, at the end of the esophagus there is the sphincter. It relaxes and so the food can pass through. In Achalasia, that's the disease here, or the problem. In Achalasia, the esophageal muscles and sphincter do not respond to a swallow. Okay, and the food and saliva are retained in the esophagus, which becomes swollen. Okay, so the person swallows, the food comes into the top of the esophagus, but when the peristalsis movement is not started, the food is not pushed down, and also the sphincter at the end of the esophagus is not relaxing, and the food gets more or less stasis in the esophagus. And the food and the saliva, that is the water from the mouth. The saliva, I think, are retained in the esophagus, which becomes swollen, and then the esophagus swells. The symptoms are difficult in swallowing, both of liquids and of solids. Initially intermittent, later continuous. Okay, just the swallowing of foods and also of liquids of drinking is a problem there. First only from time to time, and then more often. Food is felt to stick behind the breastbone. No, don't know where the breastbone is. It must be. Okay, it feels like that the food is sticking somewhere here. But I don't know where the breastbone is. But I guess here. Chest pain does come, and that can range from mild to severe pain. Okay, the people who have Achalasia of the Cardia, they have problems to swallow food and liquids and drinking, and it feels like food gets stuck. And also do they have chest pain, which can be mild but also severe. Regurgitation of undigested food and salvia. Regurgitation. That sounds a bit like vomiting it, but I don't know what regurgitation is. So we're taking from it, but we have to know what regurgitation. I think it is vomiting it, but whether it is regurgitation of undigested food and saliva. And then also food and saliva may be breathed into the lungs, especially when the patient is lying in bed. This causes cawing, breathlessness, and chest infections. Okay, the food is more or less stuck in the esophagus, and if a person breathes it in, the food can come into the lungs, and that can cause cawing, breathlessness, or sort of problem of breathing, and also infections of the chest. The causes are not known. Achalasia of the Cardia, not known. Complications are pneumonia and bronchiectasis. Pneumonia is an infection of the lungs, and bronchiectasis, that is when a problem of the bronchs were inside of the lungs. So it's both lungs and bronchs problems. And also higher incidence than normal of esophageal cancer. That's the cancer that is the esophagus. Okay, the problem is that the food swallowed gets not that the swallowing does not make the reflex of... No, what is it? No. They do not respond to the swallowing. Okay, it is swallowed, but the peristalsis movement does not push the food through the esophagus down, and the sphincter at the end of the muscle ring, the sphincter at the end of the esophagus, doesn't relax and doesn't let the food through. It feels as if the food gets stuck behind the breastbone, mild to severe pain. It can cause regurgitation of the undigested food. It can be then breathed into the lungs and cause cawing, breathlessness, and chest infections. The cause of why it all happens is not known. Maybe it is, I don't know, for the book, maybe it's a big order. Not known. And now the complications are then pneumonia and bronchiectasis are problems at the lungs and at the bronchs, and also then a higher chance to get cancer at the esophagus. Treatment in home. Eat small meals sitting up. Okay, you eat only a little amount always, and that by sitting in a seated position. To take frequent drinks in small quantities, and always to drink just small amounts of water or whatever. When to consult the doctor? If any of the above symptoms persist for longer than a week. Okay, if these symptoms of breastfeeding, I think we should go over there, but if these symptoms listed here a moment ago, then you should consult a doctor if it takes longer than a week. But again, yeah, this is not medical advice. I'm just reading what it said here. What the doctor may do: check to exclude more serious causes of symptoms. Okay, the doctor is checking if you have something more serious. Send the patient to a consultant surgeon who may order tests including barium swallow X-ray and internal examination with an endoscope. I have to read it again. Send the patient to a consultant surgeon, so you get sent to someone else who knows it better, who may order tests including barium swallow X-rays. So I think that is it. You swallow the barium, and that, I don't know really, but I think that is the thing where you swallow something, the barium, and that causes then that the X-ray can see that the barium is on your body, and then they can see what happens in your esophagus. I don't know. They're doing X-rays and internal examination with an endoscope. So they're coming with a telescope, with a microscope, just inside of the body. But it's an instrument. Oh, wait, let me explain it. An instrument with a light which can be passed down the throat into the esophagus. Maybe you've seen the movie War of Worlds 2005 by Steven Spielberg. So basically, I don't know what it's spread now. So it's a thing. It is an instrument with light which can be passed down the throat into the esophagus. I don't know if it is less disturbing as what I wanted to tell. But it's also funny. Treatment may require an operation to cut or stretch the muscles at the lower esophagus sphincter, S-P-H-I-N-C-T-E-R, sphincter, in order to allow food to pass into the stomach. Okay, it is cut or stretch the muscles at the lower esophagus sphincter in order to allow food to pass into the stomach. Okay, surgery. Prevention, none is possible, but I think that has to do with we don't know what the cause of it is. If you find the cause, maybe we can do something to prevent it. The outlook, reasonable good with treatment. So if treatment happens, then the outlook is quite good. Now, before this part, we are done with the medical part. If you were here for medical part and the Achalasia of the Cardia, I don't know where we get the words from, Achalasia of the Cardia. I don't know where the Cardia is, and I don't know what Achalasia is. So Achalasia of the Cardia. If you were here for that, you can go directly to the next part where we will talk about something else. Maybe Achilles tendon rupture. If you stay here, we're going to do the leg injury prevention training, so that no one gets an Achilles tendon rupture. But if you participate, it's at your own risk. So if you get an Achilles tendon rupture, it's at your own risk. Now we're starting with a little warm up. We're bringing one leg up and we're pointing the foot down. And we're taking the leg at the ankle and we're making a straight back and we're pointing with the knee down to the floor. And we're taking the other leg, bringing the knee up, putting the foot down. And we'll take the leg at the ankle and we're making a straight back and we're pointing with the foot down, with the knee down to the floor. And now we're doing the next exercise. So we are bringing one leg up, to the right angle, even line hips, turn off the back, and the arms looking out. And we're turning them slowly to one side and try to keep the balance and try to keep standing. If it doesn't work out, just try it again. And now slowly over to the other side. Back into the middle and with the other leg. Leg up. And now try to do the same. And over to the other side. Our next exercise, one knee up, breathing in. Out the leg to the side. Breathe again in. Out into the middle and down. Again the leg up. Breathe in. Out to the side. Again in. Out into the middle and down. The other leg up. Breathe in. Out to the side. Breathe again in. Out into the middle. Down. And again the leg up. Out to the side. Breathe again in. Out into the middle and down. And now we're bringing the knee up and we're pressing the inside against the knee. Right angle of the leg, flex foot, even line hips, hold up with the back, little bend in the elbow. And the other knee up. Right angle with the leg, flex foot, even line hips, hold up with the back, and we're pressing from the inside against the knee. And the last exercise, knee up, and the knee presses up and to the side, up to the side. And the other knee. Now just ending, legs wide apart, breathing in. Out. Out. And the last one, breathe in. Out. Breathe in, close the legs. And out. That was the leg energy training. Thank you very much, and next. Hi and welcome. I'm trying to learn medicine. Today, Achilles tendon rupture, and after we've done it, we're gonna do shoulder impingement training. And if you participate in the shoulder impingement training, then it's better at your own risk. Achilles tendon rupture. The Achilles tendon is the tendon which attaches the calf muscles of the leg to the back of the ankle. The back of the ankle. Now we're meaning the calf is this muscle, and the back of the ankle must be here. So the Achilles tendon is from here to here, from that muscle to the here. When a rupture occurs, it is always complete. The tendon snaps in two. So we're saying a rupture is in two. There are also other types of injuries to the Achilles tendon or other tendons, but a rupture, do we say, is completely. The symptoms of an Achilles tendon rupture. A sudden, severe pain at the back of the ankle, often as if it has been struck by a blow. Okay, a sudden, severe pain. So suddenly pain at the Achilles tendon there. Okay, also you can actually feel it. And severe pain, sudden and severe. Tenderness at the site of a rupture. Now, I don't understand the word tender or tenderness. I came across it today with something else. I don't get the word tenderness. I just don't really understand the word. Also the fork tender test. Maybe I should look up properly. And another symptom is an inability to stand on tiptoe with the affected. Yes, of course not. An inability to stand on tiptoe. So there are many different tendons at the foot. And the Achilles tendon, for example, if you can't stand on tiptoe, then the Achilles tendon is ruptured. Walking is possible, but only with a limp, and the patient will not be able to run. We're telling that here so in detail because there can be other types of injuries to the tendons, to other tendons, and then many things are still possible. If you have one of the side tendons ruptured, you can maybe still walk in one line that's directly frontal. That's why I'm telling that. And we're talking about a rupture. If there's an injury, just a partial tear of Achilles tendon, then it can look maybe differently. So we're talking about a rupture. Now, walking is only with limping possible, and also running not. The duration. With treatment, a rupture will take from about 6 to 8 weeks to heal, so around 2 months. Causes. The rupture occurs most often in early middle age after some sudden activity. Sudden activity, that is interesting. Such as the first game of squash or tennis of the season. After some sudden activity, I don't think they mean after the football match or the tennis match. They're meaning after you had done the sprint. Or in the moment where you do it. Sudden activity, do we say, as causes? The Achilles tendon can rupture because of sudden activity. This is interesting. The treatment at home. None is advised. So to treat it at home is not advised. A rupture knot, a complete rupture knot is not advised. When to consult the doctor? Immediately if a condition is suspended or the symptoms occur. Immediately the condition is suspected or symptoms occur. So they say, I didn't tell that again, so at the beginning. I didn't tell you that at the beginning. So we were talking about injuries and the other thing is this is no medical advice here, I'm just reading what is in here. We're just learning. Now we're saying you should consult immediately a doctor when you suspect it or when these symptoms occur. So a sudden severe pain at the back of the ankle, a tenderness at the site of a rupture, an inability to stand on tiptoe, and also not ability to run, and you probably shouldn't even try it. And also walking is only with a limping possible. And also don't do that. None is advised. No treatment at home, and consult immediately with a doctor if it is suspected. Or symptoms occur. What the doctor may do. He will send the patient to the nearest hospital emergency department. So depending on what doctor you come to, you will get sent to a proper hospital. At the hospital, the lower leg may be x-rayed to make sure the symptoms are not the result of a fracture. So they're looking if the bone is properly and that it's actually the tendon which had ripped and not the bone. If a rupture is diagnosed early, the lower leg will be immobilized in plaster for 6 to 8 weeks, and a shoe with a raised heel or heel set into the plaster will need to be worn for further 2 to 6 weeks. Now, because I very recently heard about plaster, and there are also alternatives, I want to look at a moment. I can find from when this book is. It is from 1983. Okay, so this book's actually a little bit older, actually. I don't think this was so far a problem, but I already annotated that to the thing for the last thing I can find it because I can't remember the name. Achalasia of Cardia, where said that the causes are known. Now, and also prevention is possible to Achalasia of Cardia, so that the swallowing doesn't properly make the food going down through the esophagus, and that I wanted to go to that name also. The sphincter at the end of the esophagus is blocking and the food doesn't go properly into the stomach. That problem, here's written that the cause and prevention are unknown. This book's 40 years old, so maybe something has happened in the last 40 years. And to the other thing, I heard very recently that there are also alternative methods to plaster used, but they are also done in the hospital. They are maybe a little bit better. They're doing the fiber plastic or what it is, because they are lighter and they can be adjusted more precise. I think these were the main reasons. Okay, and now the completely lower leg is immobilized for 2 months, and also a shoe with a raised heel or heel set into the plaster will need to be worn for further 2 to 6 weeks. So for 2 months, the whole lower leg will be immobilized, so that nothing can be done. So that is why you should not run around and test around if your Achilles tendon is ruptured. You should not move it at all. And then also a raised heel can be worn. This is interesting. But I wanted to annotate again, this is 40 years old, and maybe there could be also done some research to this, because keeping the tendon for 2 months after these 2 months in immobilized position, the tendon shortened. I'm not sure if it's the best treatment for the Achilles to regain 100% strength. If diagnosis is delayed, treatment will depend on age. A young adult may have a snapped tendon sewn together when a plaster applied. Okay. I don't really, with a little bit too fast information. Whatever, the tendon is sewed together and then plaster applied. Prevention. It is advised to avoid sudden, strenuous activity after a long period of only moderate exercise. So they're saying if you have for a long time just played a bit of football, a bit of running, you should not suddenly make a big football match and run a lot. And now interesting would be, and I actually would add it, I would say it could then also happen not just through too much stress, through one football match on Sunday, but also through a sudden run, just one sudden run. I would add it, I don't know if it's true, but it sounds logically to me. So, sudden stress, if it's now a very sudden run, or weighttelling, suddenly after a longer period of moderate exercising, intensive training. Outlook. If a condition is not treated, the separate parts of the tendon will unite spontaneously, actually, but in doing so will make the tendon longer. I want to see it on an X-ray or something else. The tendon comes together again? Okay, but it will be longer. This can leave the patient either with a limp or without a spring in his or her step. I don't know what a spring is. Whatever, it makes big problems if it's not properly treated. And also, if treatment is carried out early, the foot will return to normal in about 10 weeks, so around I think they said another 2 months, so around 3 months. Then it should return to at least almost normal. I don't know if 100%, but almost normal. If treatment is delayed, recovery takes longer, and I would also say not completely. Okay, Achilles tendon rupture. A sudden pain after a sudden run or a bit something at the heel, and also inability to stand on tiptoe and to run and limping, but you should not drive it out. You should consult directly a doctor, and then that whole thing is sewed together, immobilized, and after 2-3 months, it should then be ready again. And as I said, we all know, this is 40 years old, there are more things tested out than just letting it sit for 3 months and then, hey, it works again. It's more like there's this rule, this idea. Let's look again. Do as much as you can with the foot and do as little as you can do. Something like that. No, what it means is, if the foot can walk again, you should walk it. You cannot just take it for 3 months without moving anything and then it walks again. On the other hand, you should not walk if it's not together. And what I basically want to say is, don't just have your foot for 3 months immobilized and expect that it then works again. And the newer therapies, treatments are saying more like, if after 8 weeks you can start with small exercises, you cannot just keep the foot for months immobilized. That is very unhealthy for the whole foot. Now, what I basically want to say is, this is a bit shortened and a bit outdated. Don't just have your foot for 3 months immobilized and then walk again. You probably cannot just walk again. Consult your doctor and talk about it. There are better therapies to start to move the foot a bit earlier with professional exercises a bit earlier. That makes the recovery way more likely. It is not healthy to have a whole foot for months immobilized. But you should also not move it if it's injured. So you have to find the middle way. And it is also at your own risk, and don't take us as a medical advice. Now to the short impingement training. If you participate, then it's at your own risk. If you're here for medical, whatever, you can go directly to the next part. We will do no short impingement training. If you participate, then it's at your own risk. Good and steady stand. And we're doing forward shoulder circuits. And another time. And now backwards. And our long arms, strong fists, and go as far back with the shoulders as you can. High up as possible. Front, down, and back. Up, and front, and down. And now the other way around. Up, back, down, front. Also, start as early as possible, but wait as long as necessary, but start as early as possible. Around that is the sentence. So if it's injured, you should not move it, but as soon as it is possible, you should move it. It's not good to have a foot paralyzed, immobilized for many months. Next exercise, and we don't have much time left. Next exercise, long and good arms, and we're going with the shoulders down, hand together, not only the arms to the inside. Now the arms to the outside, shoulders down, hand together. As short as possible, as long as necessary. Well, that is the sense of the idea. And again to the outside, shoulders down, down together. And one last exercise. No, not this one. Just the arms up, mid on the shrug. Lift the shoulders up. And down again. If this exercise causes pain, then don't do it. Again, the arms up. Shoulders up. And all down again. And again up. And down. And now stretching. One arm in front, the shoulders back, down. Pull the arm in, have flat fingers. Try to relax the arm, go it back with the shoulder, then the palm up to the sky. And the other. The shoulder is back, down. Pull the arm in, have flat fingers. Try to relax the arm, go it back with the shoulder, then the palm up to the sky. And that was the shoulder management thing. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine today. Acid regurgitation, and after we've done it, we're going to do backstretching. And if you participate in the backstretching, then it's at your own risk. And this is also not a medical advice, we're just reading it. And yes, we're going to talk about internal anatomy and so on, and in diseases and something else. In the last part to medical, we had Achilles tendon rupture, and we have a sentence here, and that can rip, and that's a problem. Now, if people are talking about muscle growth, if they're doing bodybuilding, if they're trying to get the biceps or triceps or the pectoralis or whatever muscles bigger, we are talking oftentimes a part of training and so on about of what food we eat. Now, and I noticed that I've never read to anything about a tendon or also a muscle tear or complete rupture, like the Achilles tendon rupture. I never heard that when if it's talk about that treatment where that anyone mentioned something about food. So I just noticed if people are talking about muscle growth, we're talking a lot about what we eat, but I never ever have ever read someone speaking about or written about what the food consumption might have an influence on the regrowth or together growth of a rib, tendon or muscle, maybe even bone or whatever. Okay, now acid regurgitation. And then the next thing is we didn't know what the word regurgitation means when we had Achalasia of the Cardia. That is where the foot gets stuck, or it feels like that the foot gets stuck, but it's not actually like a really stuck foot. And maybe we're going to find out now what regurgitation is. Acid regurgitation. That is a condition in which the contents of the stomach flow back into the esophagus and cause inflammation. Okay, the stomach is here, and normally the contents of the stomach, so the food, should be inside of the stomach. And if it should go into one direction, into the intestine. Now, but by acid regurgitation, contents of his stomach are going back into the esophagus and will cause vein inflammation. Okay, we had here one thing. At the end of the esophagus is the sphincter. S-P-H-I-N-C-T-E-R. I don't know if it has something to do with it, but just I want to remember that the thing is called sphincter at the end of the esophagus. So, sphincter is at the end of the esophagus, and at the end of the esophagus, by acid regurgitation at that place, just that geographic anatomical location, where stomach content comes into the esophagus and it shouldn't be there. Symptoms. A burning sensation behind the breastbone. Now, I still don't know where the breastbone is. We had it previously. I don't know where the breastbone is. But I think it's over here. A burning sensation behind the breastbone, which may spread up to the back of the mouth as wind is brought up. As wind is brought up? As wind is brought up. Giving a taste of acid and food. Okay, there is a sensation of burning fat at the breastbone, I think that is here. And it can spread up to the back of the mouth. And that can give a taste of acid and of food. Duration. The symptoms persist unless treated. Okay, if it's not treated, it persists, do we say. But I want to add at that place again that this book is around 40 years old. So I take it with a grain of salt that it is persistent if it's not treated. But it sounds so permanently so, really forever. And I'm not sure if it's really a thing which lasts over years. Whatever. Causes. Lax muscles at the lower end of the esophagus, food pipe, where it joins the stomach. They allow acid to flow back up from the stomach. Okay, the muscles at the end of the esophagus are too lax, and that allows the acid from the stomach to go into the esophagus. We know that in the esophagus there's a muscle ring called sphincter. Maybe that is the thing, which makes a problem. Overindulgence in food or drink. Overindulgence. Does it mean to eat too much? I don't really understand the word overindulgence. Whatever. Overindulgence in food or drink. Next thing. Wearing tight corsets and belts. That is interesting. And certainly also some sports like boxing, if you get this hit into, I don't really know if it is fair play to do it. Okay, we're saying wearing tight corsets and belts, but probably also seat belts. Okay, we're saying the clothing or whatever, just pressure from the outside can cause it also. Bending down or lying flat tends to force food from the stomach backwards into the esophagus with consequent aggravation of symptoms. Okay, to bend forward and also to lie flat on the floor can lead also that it comes. Okay, we're having four main causes. One is that the muscles at the esophagus are not strong enough. And next one is overindulgence, whatever it means, of food and drink. And then two basically forces from the outside, bending forward, lying flat, or a corset or a belt. And here I want to add there are probably more things. I don't think it is, no, the only biological thing here named is lax muscles at the end of the esophagus. I don't think that's the end of the story. There has to be something more, there have to be more biological reasons than just lax muscles at the end of the esophagus. Complications. Peptic or reflux oesophagitis. The lesion of the oesophagus is not suddenly the oesophagus. Did I read something wrong? Is it the whole time esophagus? No, oesophagus. Okay, it's the whole time oesophagus. So whenever I said esophagus, it was the oesophagus. Is it the same thing? Just another word? Okay, there is here written oesophagus, it's written with an O. But I'm pretty sure it is either the esophagus or it's pronounced esophagus. Whatever, I think we're talking more or less about the same thing. Okay, there's oesophagitis. That can be peptic and it can be reflux oesophagitis. The lignin of the esophagus becomes inflamed and then ulcerated by the action of stomach juices. Whatever. The acid of the stomach makes problem at the esophagus. It acids around there, and it can cause peptic or reflux oesophagitis, and that doesn't sound good, whatever it is. The next complication is stricture, narrowing. Okay, stricture means narrowing of the oesophagus may eventually result. Okay, the oesophagus can get narrower. What would be the complication of that? Okay, And the next thing is, here now we're talking a bit about blood, is another problem can be bleeding, usually a slow loss resulting in anemia. So anemia, whatever it is, it has something to do with blood. No, it can result in anemia. It could be something completely different. Anemia, it can result in anemia, with little loss of blood. Treatment in the home. Do not wear tight clothes or corsets and avoid bending forward. Try to bend only at the knees. That's interesting. Maybe you could actually think about it. Bend at the knees. Okay, bend at the knees is meant, not to bend forward. Maybe we can look into that and actually try to find, so I think keep your eyes and ears open to find if we can find some people telling how it actually can be done. Try to bend only at the knees and don't wear too tight clothes and corsets. I think the idea of a seatbelt interesting, because I think most people don't have an influence over. And it could be that many people don't think of it. Eat small, frequent meals. So that is meant with overdigestions and food and drink. Eat small, frequent meals. Frequent meals. That do I find interesting. I would also say eat just very seldom. But this was not a hypothetical idea. That was not an idea. Yes, eat small, frequent meals. But that is not a medical advice. Eat small, frequent meals and sit upright while eating so that your esophagus stays vertical. Okay? Avoid being overweight. Take milky drinks and antacids which coat the lower end of the esophagus. Antacids can be bought at the chemist. What the doctor may do, prescribe antacids. Why not antacids? Antacids. If symptoms persist, he or she will probably send you to hospital for a barium swallow X-ray to investigate the cause. So we're looking with the X-ray, what's going on there. And prevention. Avoid overeating, overdrinking, and being overweight. Do not wear tight clothes. Okay, we don't have time if we want to do backstretching. If you're here for medicine, you can go directly to the next part. We will come probably back to the acid regurgitation problems. So we made it out a bit fast. We will come back to it. If you were here for medicine, you can go directly to the next part. We will do another backstretching. If you participate in the backstretching, that is better the risk. Gut, jetzt der stand and lifting the outside. And breathe out, go over to one side. Breathe in and out, rib cage. And again out into the middle. Again in. And out over to the other side. Breathe again in and out, rib cage. And out into the middle, the arms down. Now we're doing the next exercise. No one sees the rupture. Breathe in. Out, one hand slides down the leg, and the upper shoulder stays down. Again in. And out, we're taking one arm over. Breathe in and out, rib cage. And again out into the middle. Breathe again in. Out, one hand slides down the leg, and the upper shoulder stays down. Breathe again in. And out, we're taking one arm over. Breathe in and out, rib cage. Out back into the middle. Next exercise, the aeronautic aerobatic aeroplane. The feet are standing together. The breathing and lifting the arms up. And breathe out, one hand down. Breathe in, reach. And again out. Again in. And out, one hand down. Breathe in and reach. And out, one hand up. And both hands down. Now we're doing the Markhor. Feet are standing together, breathing and lifting the arms up. And breathe out, bring the arms down and up the chest to the sky. Breathe in, lift the arms up. Or cross the arms, intertwine the fingers at each high. And breathe out, reach in front, hollow the back. Again in and out. And again up the chest to the sky. Draw the shoulder blades together. Again in and up. Or cross the arms, intertwine the fingers, reach high, and breathe out, reach in front, hold the back, again in and up, and out, we're doing the sky hugger, open the arms long, again in, and out, again in and up,
and out the arms down. That was the backstretching. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, acoustic neuroma, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And this is in no way a medical advice. We're just learning, we're just reading what is in here. And we're talking about internal anatomy and diseases. But before we go on with acoustic neuroma, I wanted to go back to what we did in the last part, that was acid regurgitation. Now, the first thing, I still don't really know what the word regurgitation means. But acid regurgitation is that there's the end of the esophagus doesn't close properly, and the acids of the stomach going partially into the esophagus. And that is not good. What was here? And we wanted to go now to the last things a little bit faster with it. Now, the duration, it is if treated the whole time, and the causes are legs, muscle at the lower end of the esophagus, and at the lower end there is the sphincter. Now, I wanted to go to first thing. Was there something of surgery? Causes? Did we have complications? Could be peptic or reflux esophagitis. The lining of the esophagus became inflamed, and narrowing of the esophagus and bleeding can result in anemia. Treatment at home: not to wear too tight clothes, no belts, eat smaller and frequent meals, sit upright when eating, avoid to be overweight, take milky drinks and antacids which coat the lower end of the esophagus, and what the doctor might do: prescribe antacids. If the symptoms persist, he will probably send you to hospital for barium swallow X-ray to investigate the cause. And prevention: about overeating, overdrinking, and overweightness. And do not wear tight clothes. Now, I was wondering here, they had written here to the food to drink milky drinks and antacids, but I would say there's probably more to it than that. There's certainly probably some foods that exaggerate with how more acidness or whatever, and there's certainly other types of foods which could help maybe. If it's cooked, there are oftentimes multiple things eaten, starting with whatever, and oftentimes ended with something sweet, something heavy in the middle or whatever. I think there's also something maybe possible. And the other thing is, I once heard that, I don't know what it was, but it was something at the trachea, that the trachea could be secured with a mesh around, so even metallic mesh could be, but I think it's not metallic, could be secured, so sewed at the outside of the trachea, and then that would make it open, hold the trachea open. And now the question is, what is the cause of acid regurgitation? They named 3 mechanical influences, like wearing a belt, a seat belt, being overweight, okay, but here, overindulgence, maybe, and bending forward. But it's the only really biological reason, anatomical reason, or disease reason that were named: legs, muscle at the lower end of the esophagus. I thought the problem would be way more complicated with acid regurgitation, and it would be something completely wrong with the hormones or whatever. Is it really just the only anatomical biological reason that the lower end is 2 legs? Is there then not some type of surgery possible to make it a bit more tighter, like with the trachea, to hold it open, or other things? This book is 40 years old, so maybe there are things possible. But if not, then a surgery form has to be developed. I don't know how serious the problem is, but it cannot be that the only treatment is to eat a little bit different or whatever. And it probably has not just serious consequences, but probably also milder or not so much noticed consequences. That is something which has to be addressed, and I'm pretty sure a surgery is possible here. And if it does not exist one which goes good and functions good with a good outcome, then one has to be developed. Now to the acoustic neuroma. That is a rare growth on the acoustic nerve of hearing and balance. Okay, people having an acoustic nerve of hearing and balance. I haven't heard it expressed that way, but I think that that's somewhere in the ear. The growth is not malignant, but it slowly grows inside the skull and causes pressure on the nerve and surrounding brain. It is this pressure that causes problems, so it's not a malignant growth, it's not a cancer growth or something, but it's still a bad growth. And this grows bigger and when it pressures against the brain. And that's a problem. So not that the thing is itself is a problem, but it's a problem that it grows bigger and when pressures against the brain. But I can't, well, no, but let's go to the symptoms. It probably makes also some problem with balance and acoustic symptoms. Slowly increasing deafness, often associated with singing in one ear. Okay, slowly increasing. Slowly, so at least over weeks, I would even guess over years, but I don't know. So slowly increasing deafness, so not to hear on one ear. It would be interesting if both ears are affected or always just one. And singing in one ear, I don't really know what I mean by that. Clumsiness and unsteadiness in walking. Okay, to not walk completely in a straight line, so that can lead them to alcohol control test problems. Clumsiness and unsteadiness in walking, so problems with walking in a straight line. Dizziness, which is not usually severe, so some feeling not completely clear in the brain, but balance in a balanced way. But not that severe as with dizziness. In more advanced cases, there may be pain on the side of the face, weakness and headache. Okay, if it grows bigger, then there can be pain on the side of the face. So overall weakness, I guess, and headache. Now, the pain on the side of the face would be interesting if it is just the growth which pressures onto a nerve, onto a facial nerve, or if it is causing that in the brain neurologically, if it's a nerve reason or neurological reason, that would be interesting. Duration. Symptoms may gradually increase over the period from 2 to 10 years, so over years, 2 to 10 years. Causes. It's not known what causes the growth on the nerve of hearing. And here I want to add again that book is 40 years old. So at that time when the book was printed, it was not known what the cause of it is. Complications. Removal of the growth always makes the affected ear deaf. It makes it always deaf. Why? It grows on the acoustic nerve. Is it not possible maybe to just smaller it, to make it a bit smaller, so if the acoustic nerve still works? But it's not that big that it pressures against the brain. So just to, like it happens sometimes with bones, if the bone is big. When to consult the doctor? If there is gradually increasing deafness in one ear, that's especially if there is clumsiness and unsteadiness in walking and dizziness. So we're saying if there's an increasing deafness in one ear, then consult the doctor, and also if there are problems with walking in one straight line. What the doctor might do? Examine the ear with an oroscope. That is an instrument with a magnifying lens and a light. The thing is an oroscope. Okay, it's a thing that has a lens on it, like whatever it's called, a lens, and also a light at the top. So basically like a smartphone. But in the video you can look into the ear. An aeroscope. That also, so by looking at the ear with an aeroscope, when testing the degree to which the patient's hearing is impaired with a tuning fork. By looking how good the ear can still hear. It's an instrument that has two things, and one hits against them and then they're making a sound because they're vibrating in the air, and then people can hear the sound. Examine the eyes for nystagmus. That is a horizontal flickering of the eyes. A horizontal flickering of the eyes does that happen if people have acoustic neuroma? So if they have a problem with the ear, the acoustic neuroma, do they have a nystagmus of the ear? Or is that if they have nystagmus of the ear, then they probably don't have the other thing? Arrange further examination and tests by an ear, nose and throat specialist or a neurologist who will be able to confirm the presence of the growth. Okay, further examination and tests of the ear, also of the nose and of the throat, and also a specialist for nose and throat, and also a neurologist, so someone for the brain, and they were looking, is there actually something growing? If the diagnosis is confirmed, the specialist will arrange for an operation to remove the growth. Now maybe that's a bit simplified or a bit outdated, but it would be interesting if there are other options than the surgical options. And as I already said, is there maybe a partial removal possible so that the hearing stays? Because it seems that the growth itself is not a problem, just the pressure of it. So smaller it would be enough. Prevention. It is not known how to prevent an acoustic neuroma from forming. It has probably something to do with we have no idea what the cause is. Outlook. Although hearing will not be restored in the affected ear, early removal of a tumor, okay, they are saying it is a tumor, I avoided to say it's a tumor, but it is a tumor. Removal of a tumor has good results and leaves few other symptoms. The danger of removal increases as the tumor slowly grows bigger. Okay, the longer people wait, the greater the surgery and the greater the risk is that the surgery makes a problem. Hearing can't be restored, at least not here, but overall it's pretty okay. Now that was the medicine part. If you were here for medicine, you can go directly to the next part. We will do now the shoulder impingement training. If you participate in the shoulder impingement training, then it's better at the high risk. Doing shoulder circles. From back, up, in the front, down. Why does it grow on the acoustic nerve? Are there other nerves on which something like that can grow? Is the transplantation of the acoustic nerve possible? Okay, and now we're doing advanced shoulder circuits. Long arms, strong wrists, and we're going as far back as we can. High up, and in front, and down, and again back, up, and front, and down, and again up, down, back, down, front, up, back, down. And now we are doing robot lift, good and steady stand, long arms, strong fists, and we're going back with shoulders and together, and now turn the arms to the inside. Shoulders down, head together, arms to the inside. And now the arms to the outside, shoulders down, head together. And the arms to the inside, shoulders down, head together. Step. Arms to the outside, shoulders down. Release. And as an exercise, arms at the outside, hands on the fists, the arms with in front. Turn the arms in front, shoulders down, together. Now the arms back, shoulders up and front. And the arms in front, shoulders down, together. And the last time the arms back, shoulders up and in front. And now shrug. That's the arms up, and shrug the shoulders. And lift it down again. If this exercise causes pain or any other one, then don't do it. Again, the arms up, shoulders up, and out. Again, the arms up, shoulders up, and down. And the last time. And now the physical, arms together, a bit down and to the side, and again a bit down and to the side. And the last time. Now sundial. Take a soccer t-shirt or tennis ball, whatever, with a long arm at the outside, and let it fall down. Let it catch the and on the other side. And the stretching. Take one arm, bring it in front, shoulders back and down. Pull the arm in and have flat fingers. Try to relax the arm, go it back with the shoulder, and turn the palm up to the sky. And we are in front, shoulder is back, down, pull the arm in, have flat fingers, try to relax the arm, go with back with the shoulder, and turn the palm up to the sky. And this was a short intention training. I thank you very much, and until next time. Hi, welcome. I'm trying to learn medicine. Today, Acrocyanosis, and after we've done what we're gonna do wrist training. And if you participate in the wrist training, then it's at your own risk, and we're talking about diseases. Now, Acrocyanosis, I think I heard reference to it oftentimes as just cyanosis, not acrocyanosis, but we're gonna do it like that now. And again, this is not any medical advice or anything, we're just reading what is in here. Acrocyanosis, that is a harmless but persistent deficiency in the circulation of the extremities. Hands, fingers, feet and toes. So the extremities I was saying is firstly hands, fingers, feet and toes. Of young women to be right. I heard the term cyanosis quite often. So not acrocyanosis but cyanosis. So it might be the same, just shortened, cyanosis. And cyanosis is something which other people apart from women also have. Okay, acrocyanosis, that is something which young women have, that is deficiency in blood circulation at the extremities. Symptoms. There is no pain, but the fingers and hands are always cold and blue. I wouldn't say always cold and blue, but okay, they are oftentimes cold and blue, the fingers and the hands. Regurgitation. A persistent complaint, but as the patient gets older, the symptoms abate. Okay, it is had by young women, but when we get older, it gets a bit better. Causes. The blood vessels of the hands and feet are unusually sensitive to cold. The reason for this is unknown. That is interesting. It is that they are too sensitive, the blood vessels. So the problem is completely where that is. Where it's part of the blood system, one could think it's way more complex. That is an interesting thought. Maybe I had never thought of it. If it's now a bit outdated or not, it's 40 years old, what is written here, but whether it's now outdated or not, the idea that the problem with cyanosis, or maybe acrocyanosis is a specific type of cyanosis, of not properly blood circulation in one part of the body, could be that there the sensors are wrong, not in the nervous system somewhere, not something in the brain with some, how to pilot all that, not something at the heart, or the whole blood vessels, just with the, and we're saying what are we saying? The blood vessels at the hand. So I'm saying the blood vessels, not the nerves. That's also interesting. What measures cold? Not the blood vessels themselves. Whatever, that is a very interesting thought. Treatment in the home. Keep the fingers and hands warm. When to consult a doctor. If a condition persists and worries you. So if there's worry about the cold and blue hands and feet, then to consult a doctor. And also if a condition stays over a longer time. What the doctor might do, make sure it is nothing more serious. So to make sure that it's nothing more serious, prevention. Protect hands from cold and probably also the feet, don't go barefoot out in the snow. So try to keep the hands warm. And the feet. Outlook, good, but the condition will persist for several years. Okay. We're going to read on with the next two parts. Maybe we're going to help us if maybe we could also go to science to find it out. I rather have the idea that we're different. Just the idea that there are different types of cyanosis, and not just people who have more or less cyanosis. But imagine the idea that there are actually completely different types of cyanosis, so of less blood circulation to one part of the body. A part of ischemia or other things. So Acromegaly is the next thing. A disease in which the skin thickens and the hands, also completely something else. Let's read it. A disease in which the skin thickens and the hands, feet and face, particularly the lower jaw, enlarge. It is the result of overproduction of growth hormone by the pituitary. That is acromegaly. Okay, I heard of it. It's the result of overproduction of growth hormone by the pituitary gland, which lies in the brain. Okay, the pituitary gland is in the brain. We wondered about it in biology. It was said that the pituitary glands are sending out antidiuretic hormone to the kidneys, and that makes the kidneys produce either more or less, we haven't understood it, urine. The pituitary glands are in the brain. A benign, non-cancerous tumor of a gland causes the excess production. Treatment consists of destroying the tumor by radiotherapy or by the removal of a gland. Acromegaly occurs after the age at which normal growth stops. Excessive production of growth hormone in children produces a different condition, gigantism. Now, I thought that it was just some surplus or some additional information to Acrocyanosis. Now, that is a completely different thing. And the chapter is actually very short. I heard quite a lot about acromegaly and also about gigantism. Maybe that's completely coincidental that I heard quite a lot about that one disease. But we're going to do acromegaly in detail in the next part. Now a little back to the acrocyanosis. We're not going to look up now if there is a cyanosis as a separate thing. But first what it is, so called extremities, young women do it have, and painless. I wouldn't call it in an absolute sense painless if I count that as a form of pain, especially if it is a year long. Okay, it's more or less, they mean medical sense painless. But maybe when there's a subcategory would be interesting, because cold hands is a form of pain. I'm not go out into this now and try it. No, it is not an advice that you go out and get cold hands. Duration. So because it's that the blood vessels are unusually sensitive, there has to be a little more to it. But it could be completely mechanically explained. It would be really interesting if it is really a problem just as the blood vessels, and just a basically mechanical reason, just wrong measuring of temperature, and that the blood vessels are doing that. And just to keep the hands warm. If it worries or persists, then consult a doctor. And the conditions take some years, but it gets better over time, and it's a good outlook. Now we're taking some ideas with us from that, a part of all the information. But it can be possible that a problem with the blood circulation can happen maybe just at the regional problem, and not at the whole blood circulation or the brain. And that there, at least the idea that there could be completely different types of cyanosis. One of them could be then acrocyanosis. Now, if you go here for medicine, then go directly to the next part. Maybe you get some answers to these questions over time. We will do now the Wristtraining. If you participate in the Wristtraining, then it's at your own risk. Good, and same stand, arms next to us, hands on the fists, and we're doing the spotlight. We're bringing the fists down and up. And again down and up, and then a couple of times. And now the flashlight fists, and then to the inside and then the outside. Maybe we're not going to do acromegaly here because I probably know what is it. I said we're going to do it. And now the next exercise. The magician, flat hands went to the inside and to the outside. And now flat hands and bring them up and down the pancake flipper. And now we're doing theoretically in the morning, flat hands out, and bring them down and down. And now with a T-Rex in the gym. If you want to do it without a tennis ball, or you do it without a tennis ball, then just make a strong fist. And release. And press again. Release. And press again. Release. And now switching. Press again. And release. Press again. Release. And press again. Release. Next exercise, a cautious big bend. Place your fingertips of one hand on top of the fingernails of the other hand. Press a bit and we're opening and closing. Now we're having 3 rules. The first rule is that we stop immediately as soon as there's pain. The second rule is that we go only as fast as we can go with a little bit of effort. We're changing. And the third rule is that we're not overdoing it. So if you want to take a break, then do it. We just want to strengthen, not to exhaust. And now, the crib anxious to a fever. Next to us, you can skip this exercise if you want to take a break. And press the fist, bring the fist into flexion, and press a bit against. Pull from the outside. And press a bit from the top. What? And over to the other side. Hands from the fist, into flexion, press against it. Pull from the outside. Press on top. Now with 50 days is new Cynthia's selector. Fists and open them and close them. And now bicycle bridge. Flat hands, bend them at the knuckles and open again. Bend again at the knuckles. Open the last time. Now the frog testing the water temperature. You can skip this exercise if you want to take a break. Hands down with flat fingers and up with strong fists. Again down, flat fingers. And up strong fists. And down, flat fingers. Up strong fists. Now the claw. Make flat hands and then make claws. And up again. Again, close, hold it, open, close, hold it. Next exercise. Take the arms in, strong fists into flexion, and then out the arms, wrists into extensions with flat fingers. Again, in, strong fists, flexion, out, extension, flat fingers. In, strong fists, flexion, out, extension, flat fingers. Again, in, strong fists, flexion, out, extension, flat fingers. And we're ending here. And now we ice flat hand, bend it at the knuckles, and press on all 4 fingers. Up again, on the other hand, bend it at the knuckles, and press on all 4 fingers. And last exercise, we unfold your rib boosters. Go to stable stance, long arms, strong fists, and bring these strong fists on the inside into flexion, and to the outside into extension, with flat fingers. Inside strong fist flexion, outside extension, flat fingers. Again to the inside strong fist flexion, and outside extended wrists, flat fingers. And we're ending again here. Now we're going with more pressure on the middle part of the lower. And on the other side. Now we do also Wristtraining. I thank you very much and until next time. Hi, I'm Rebecca. I'm trying to learn medicine. Today, Acromegaly. And after we've done it, we're going to do backstretching. If you participate in the backstretching, then it's at your own risk. And this is also no medical advice, so we're just reading what is written here. And this is about the disease. Acromegaly. That is a disease in which the skin thickens and the hands, feet and face, in particular the lower jaw, enlarge. Okay, that is a disease in the hands are getting more thick, the feet and also the lower jaw, the face, in particular the lower jaw getting bigger. It's the result of overproduction of growth hormone by the pituitary gland, which lies in the brain. So here we have it. In the brain there is a region or a gland, there's a place that is called pituitary gland. Pituitary gland. Pituitary gland. In the brain there is something called pituitary gland, and by acromegaly, it is producing too much growth hormone, the hormone in the function of doing growth, too much of it, and then the hands, the feet and the lower jaw enlarge too much. A benign, that is a non-cancerous, tumor of the gland causes the excess production. Okay, benign seems to mean more or less always non-cancerous. There's a benign tumor. So there's a tumor at the gland. It's not a cancer tumor, but it is a tumor. And at this gland, the pituitary gland in the brain, there's a tumor, and that causes it to produce too much of the growth hormone, which then lets the feet, hand, and lower jaw grow. Treatment consists of destroying the tumor by radiotherapy or by removal of the gland. Okay, either the radiotherapy, there is the tumor destroyed, or the whole gland removed to treat it. The acromegaly. Acromegaly occurs after the age at which normal growth stops. That's interesting. Okay, it destroys. It comes after the normal age has stopped. That really makes sense. Excessive production of growth hormone in children produces a different condition, gigantism. Okay, if the pituitary gland is producing too much growth hormone during the ages of growing, during childhood, then it gives gigantism. And if the pituitary gland produces too much growth hormone after the normal growing has ended in the teenage years, then it produces acromegaly, and that is an enlarging of feet, hand, and lower jaw. Now that is all what was it to acromegaly. If you were here for medicine, you can go directly to the next part. We will do now the backstretching. If you participate in the backstretching, then it's at your own risk. Go to stable stand, legs shoulder forward apart, we're breathing in and lifting the arms up. And breathe out, go over to one side. Breathe in and down the rib cage. And breathe again out. Again in. And out into the middle. Breathe again in. And out to the other side. Breathe again in. And out. Again in. Out back into the middle and the arms down. Next exercise, now once you are Rupture, according to stable stance, we're breathing in. And breathe out, and one hand slides down the neck, and the other shoulder stays down. And breathe again in. And out, and we're taking one arm over. And breathe in and out in the rib cage. And breathe again out. Again in. And out back into the middle. And breathe in. And out, one hand slides down the leg. The upper shoulder stays down. Breathe in. And out, we're taking one arm over. Breathe in and out in the rib cage. Breathe out back into the middle. And now the aerobatic aeroplane. The feet are standing here. We're breathing in and lifting the arms up. And breathe out, one hand comes down. Breathe in and reach. And out, hanging it up. Again in. And out, one hand down. Breathe in and reach. And out, the hand up. And another round, breathe in. And out, one hand down. Breathe in and reach. Again out. Again in. And out one hand down. Breathe in and reach. Again out. And the arms down. And now, feet are standing still together. Breathing in and bring the arms up. And breathe out, we're doing the crab in the morning. The ribs together. No, not the ribs together. The shoulder blades together. Ribs open. Breathe in and reach high. Up across your arms, intertwine the fingers. And breathe out, reach in front, hollow the back, the drill. Again, in the arms up. And breathe out the arms back, draw the shoulder blades together and out the chest and sky. Again, in. Up across the arms, intertwine the fingers, reach high. And out, reach in front, hollow the back. Breathe out. Again, in. And out, back, draw the shoulder blades together, out the chest and sky. Again, in. And now we're doing eagle swings and ending with them. We're breathing in and fling your arms up. And breathe out. Again in. And out. And the last time in. And out, lower the hands down. That was the backstretching. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today, Acroparesthesia, and after we've done it, we're gonna do. I forgot what we're gonna do. Morning stretching. And if you participate in the morning stretching, then it's at your own risk. And this is about the disease and internal anatomy, and this is in no way a medical. What is it even? Medical advice. Or what is it even not? A medical advice is it not? We're just learning. Acroparesthesia. That is an intense prickling or tingling sensation in the extremities of the body, the fingers or the toes. But they said it previously to us, that the extremities are the hands, fingers, feet and toes. What I'm wondering a bit is also arms and legs, or just the hands, fingers, feet and toes. But we're keeping that. It can be a little bit more or less at the beginning, but they're not going to tell us that all the times. So we're trying to learn overall medicine. And today it's about Acroparesthesia. So we're learning also that the extremities are feet, hand, fingers and toes. Okay, and acroparesthesia is when an intense prickling or tingling sensation in these extremities, in fingers or toes. The feeling may be caused by pressure on a nerve, as for example, when it is experienced after sleeping in an uncomfortable position. So telling us that some people sometimes experience after having slept in an uncomfortable position or too long on one side, whatever, that they can feel such a feeling, but it seems to be acroparesthesia. More or less differently, let's look what that would be. More rarely, it may be a signal of trapped nerve, as in carpal tunnel syndrome, a disease of the nervous system, or a disorder of a circulatory system such as Raynaud's syndrome. Acroparesthesia is more common in women than men and is thought to be associated with the chemical changes in the female body caused by menstruation. Okay, let's do it again. That is acroparesthesia, an intense prickling or tingling sensation in the hand and feet, fingers and toes. The feeling may be caused by pressure on a nerve. The feeling may be caused by pressure on a nerve, as for example when it is experienced after sleeping in an uncomfortable position. Or is it? No, we're saying that. The feeling may be caused by pressure on a nerve, as for example when it is experienced after sleeping in an uncomfortable position. More rarely, it may be a signal of a trapped nerve, as in carpal tunnel syndrome. That is a disease of the nervous system. Okay, carpal tunnel syndrome, we're going to have this probably later more detail, is a disease of the nervous system, and that has something to do with a trapped nerve and can lead to a prickling and tingling sensation in the extremities. Or it can also be, if it's rarely this acroparesthesia, I'm going to read the name in a moment better. Acroparesthesia. It can be also the reason of a disorder named Raynaud's syndrome. That is a disorder of the circulatory system. Okay, then there exists also the Raynaud's syndrome.
Acroparesthesia is more common in women than men and is thought to be associated with the chemical changes in the female body caused by menstruation. Okay, is now acroparesthesia a standalone disease? Or is it just a symptom which people can have? For example, if they have slept on an arm or not. I take it now, but it was second thing question. Okay, whatever. Acroparesthesia is an intense prickling in hands and fingers. It can be also a symptom of carpal tunnel syndrome or of Raynaud's syndrome, and it is more common in women, and that is because, or maybe because of chemical changes in the female body caused by menstruation. Now that was the medicine part. If you were here for medicine, you can go directly to the next part. We will do now the morning stretching. If you participate in the morning stretching, then it's at your own risk. Go and stand, a bit lower shoulder wide apart, and do shoulder shoulders. They go back, up, and front, and down. And up backwards. Front, up, back, and down. And the last time. And now we're breathing in the single shoulder. And breathe out and fall down. Again in the shoulder. And out and fall down. Again in the shoulder. And out and down. And the last time. And out the shoulders down. And now we're doing the other thugger. Breathe in and lift the arms up. And reach high and protect the leg and upper leg high and upper bunch. So a bit down. And into housed these others. And then one last time. And now we're doing a shifter. Arms to the outside, up to the T. And the legs wide apart, we're breathing in. And out, shifting over to one side, just with the upper part of the body. Breathing in. And out over to the other side. Breathing in. And out over to the other side. Breathing in. And out over to one side. Breathing in. And we're leaning down onto our knees, the buffalo fighting its hangover. And breathe in. And out, bring my shoulder in front. Breathing in, shoulder back. And out, the shoulder in front. Again, in the shoulder back. And the last time, shoulder in front. Again, shoulder back. And out the other shoulder in front. In shoulder back. And out and we're hanging down. And now breathe in. And out over to one leg. Breathe in. Out over to the other leg. Breathe in. Out in the middle. Breathe in. And now we're coming slowly the front back up. And we're getting the shoulder backwards. Shoulder up. Now we're doing the ground pose. So toes are pointing to the outside, having an online space between the heels, we're breathing in and lifting the arms up. And breathe out and we're singing down. Place the elbows against the inside of the knees. And breathe in and straighten up the back. And out and lift the back up. Breathing in. And out and again down. Breathing in, straighten the back up. And out again, up with the back. Breathing in. Out and again down. Breathing in, straight up the back. And out, coming slowly up in one straight line. There we go. And we're doing now the seahorse pose.
good standing leg, the other other foot with a heel on top of the knee of standing leg, breathing in. Do this only if you can do it without to injure yourself, and breathe out and we're going down. No. Where is it? The sphincter is the muscle ring at the end of the oesophagus, and we have to find out one day if it's the esophagus or oesophagus. But at the end is the sphincter. And the next interesting was the pituitary gland. The pituitary gland is inside of the brain. We're changing the leg. And then we had something else. Acoustic neuroma. We have to find out what a neuroma is. That could be also the same thing. What a neuroma is. And what we had just was acroparesthesia, 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 acroparesthesia. I would always say acroparesthesia. It sounds beautiful from that sound. And the last exercise, legs wide apart, we're breathing in. And out, and in, and out, and last one, breathe in, and out, breathing across the legs, and out. That was the morning stretching. Thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, Addison's disease, and after we've done it, we're gonna do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And we're talking about diseases and internal anatomy, and this is in no way medical advice, we're just learning. Addison's disease. It is a very rare disorder in which the body becomes incapable of reacting to physical stresses because the adrenal glands, the glands which control the metabolism of salts and sexual organs, cease to work. Okay, there is the adrenal gland somewhere, probably in the brain, and it is controlling the metabolism of the salts in our body and the sexual organs, and that adrenal gland doesn't work properly anymore by Addison's disease. Symptoms often come on gradually and may be difficult to recognize. But if early symptoms are neglected, the first apparent symptom may be sudden collapse. Okay, symptoms. Increasing weakness and tiredness leading to complete exhaustion. Okay, increasing weakness and tiredness and then exhaustion. Loss of appetite, nausea and abdominal pain. Fainting on standing caused by low blood pressure, darkening of the skin, accentuated by sunlight, dark patches inside the mouth, collapse after minor physical stress such as slight infections or injuries. Duration. The condition is permanent and drug treatment must continue indefinitely. Causes. Destruction of the outer layers of the adrenal glands by autoimmune processes, that is, the body's own defenses somehow react against the gland's tissue. Okay, the cause is an autoimmune process. The body attacks its own adrenal gland. And that causes the symptoms of increasing weakness and tiredness, loss of appetite, nausea, I don't know, is this vomiting? Nausea, and abdominal pain, fainting, and darkening of skin, dark patches in the mouth, collapse after minor physical stress or after slight infections or injuries. Addison's disease. The adrenal gland doesn't work properly anymore because the autoimmune system attacks itself. The immune system attacks itself, so autoimmune process. And rarely can it be because of a tuberculosis infection. Complications. Failure of a circulation from low blood pressure. Okay, the blood system doesn't work properly. I don't understand the sense. The blood system doesn't work properly anymore. And another complication is severe infections such as pneumonia, so infections of the lung. Treatment in the home. None is advisable until the condition has been diagnosed. Okay, let's be done. Once the condition has been diagnosed and stabilized, close collaboration between patient and doctor is required to manage the disorder. Sufferers must learn how to regulate the dosage of the drugs they take. So I want to say again, this book is 40 years old. What we're saying here, that the people have to take them, that there is permanent and drug treatment has to be done indefinitely, and the people have to work together with the doctors to get the dosage right. When to consult the doctor? As soon as any of the above symptoms occur. So increased weakness, tiredness, leading to complete exhaustion, loss of appetite, nausea, abdominal pain, fainting on standing caused by low blood pressure, darkening of the skin accentuated by sunlight, dark patches inside the mouth, collapse after minor physical stresses such as slight infections or injuries. And also consult the doctor once management of a condition has begun. The doctor should be consulted if there are any unusual symptoms or problems. So a close working together with a medical qualified person. What the doctor might do, arrange for blood tests to confirm diagnosis. So arrange blood tests to look whether it is Addison's disease. Refer the patient to a hospital specialist. The specialist will probably admit the patient to hospital for further tests to show the levels of salt and extent of steroid hormone deficiency. That is interesting. They said here, metabolism of salt, Addison's disease. There was another disease where the salt was differently, which I heard about. And so there's measured the level of salts and also other steroid hormone deficiencies. If Addison's disease is confirmed, special steroid tablets will be prescribed to replace the gland's own hormones. Okay, the people are taking then steroid tablets because the adrenal gland doesn't work anymore. Outlook. Addison's disease is readily controlled with tablets that replace the hormones produced by the adrenal glands, and with treatment the outlook is good. If undiagnosed and untreated, the condition can cause eventual circulatory collapse and death. Okay, the outlook is, this is 40 years old again, that it should be treated. If not, that can lead to collapse and death. If it is treated indefinitely with tablets, then the outlook is quite good. Okay, that was Addison's disease. That was the medicine part. If you were here for medicine, then you can go directly to the next part. We will do now short impingement training. If you participate in the short impingement training, there's that at the end of the screen. Put it instead, and we're doing shorter circuits. We go back, up, front, and down. And backwards. And now advanced short circuits, long arms, strong fists, and go as far back as you can. As high up as possible. Front, and down, and back. And down and up backwards, up and back, down, front, and down. Now the world lifter. Go to cell stance, long arms, strong fists, bring the shoulders down and together. Not only the arms to the inside. Shoulders down and together, arms to the inside. Now the arms to the outside, shoulders still down and together. And the arms to the inside, shoulders down and together. And change last time, arms to the outside, shoulders down and together. Next exercise. Arms to the side, hands onto fists. Arms a bit in front. Then the arms in front. Then shoulders down. Together. Now the arms back. Shoulders up and in front. And the arms in front. Shoulders down together. And the arms back, shoulders up and in front. And release. Now a shock. Lift the arms up. And shock, shoulders up. And release it all down. If this exercise causes pain, then don't do it. Again, the arms up. Shoulders up. And all down. Again, the arms up. Shoulders up. And all down. And now, the sundial. Press good. Sundial. With a long arm, something at the outside, a tennis ball or sock or t-shirt, and fall down, catch it again. And on the other arm. And now just stretching one arm in front, shoulder is back and down, pull the arm in, have flat fingers, try to relax the arm, go a bit back with the shoulder, turn the palm a bit up to the sky. And with your arm. The arm in front. Shoulder is back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go a bit back with the shoulder. Turn the palm up to the sky. And that was a short video training. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today, enlarged adenoid. And after we've done it, we're going to do backstretching. And if you participate in the backstretching, then it's at your own risk. And this is all no medical advice, we're just learning. And this is about internal anatomy and diseases. Now, before we go into the enlarged adenoid, in the last part we had the acoustic neuroma, and that is a non-cancerous tumor, was it, I think, growing on the acoustic nerve in the ears, or on the acoustic nerve. And it leads over time then to deafness and then more also death. The danger of removal increases as the tumor slowly grows bigger. So problems are if a tumor grows bigger, and the problem is that the tumor pressures onto the brain, which can cause dizziness and deafness, slowly onset of deafness, clumsiness and so on. But the tumor, or the non-cancerous tumor, can be removed. But hearing loss happens. So now the question is, do humans have one or two acoustic nerves? And we don't know where it is. It could be in the ear, then I would guess humans have two. But what if the acoustic nerve is in the brain? And I just want to point out this one thing. This idea to think about whether there's one or two. And how it would work. Now, probably this whole thing doesn't work for people who know it, but whether humans have one or two. But just the idea that humans have just one acoustic nerve which processes what both ears are sending. Or that there are two acoustic nerves which then have to combine it someplace to just the anatomical structure, just the whole setup of a structure, how it's built up, to think about it. I just think this idea is interesting. Now to the enlarged adenoid. The adenoid or adenoid or whatever is a single pad of lymphoid tissue. And lymphoid tissue, that is tissue that helps to protect the body from infection. Okay, that could happen, but that is mentioned a couple of times. Lymphoid tissue is tissue which protects the body from infections. Now this lymphoid tissue by adenoid, enlarged adenoid, lies at the back of the nose, close to the point where it joins the mouth cavity. Whatever, somewhere between nose and mouth. It is small at birth, but begins growing at about the age of 3. It would be interesting if it actually does not grow in the first 3 years. And what does it make it grow at the age of 3? And overall to the human growth, are there any other things which start to grow at a specific age? And it would be interesting then to see that we're all next to each other, all of the 100, 200 things. But then, is there something else starting at the age of 3? So, why the age of 3? What does make it? Because there are a lot of things with teenage years and when things start to get bigger and so on, that start to get more massive. Now the question is, or the interesting thing is, are there things which start then at another point during life to grow? At the age of 3, the adenoid. And now we basically can learn from what are the mechanisms of making that grow at the age of 3, between the mouth and the nose, and what when during the teenage years, the height growth, more sudden and so on. Now, and it reaches maximum size at about the age of 8, and by puberty no longer causes obstruction. Why does it cause obstruction? Okay, don't understand that part. Whatever, it grows from the age of 3 to 8. Enlargement of the adenoid may block the opening of the eustachian tube, the tube that connects the middle ear to the throat into the nose, resulting in otitis media. So, the eustachian tube goes from the middle ear to the nose. And now this adenoid between mouth and nose can be too big, and then it blocks the entrance to this eustachian tube, and then the middle part of the ear between the eardrum and the ear doesn't get cleared anymore, gets infected, and otitis media results. So middle ear infection isn't probably otitis media. The adenoid may also obstruct the flow of air from the nose to the throat. Obstruct the flow from the air from the nose to the throat, forcing the child to breathe through the mouth. So there can be some children who have to breathe through the mouth because their breathing through the nose is blocked through the enlarged adenoid. The flow of air through the mouth then causes the tonsils to become larger. The flow of air through the mouth. Now I don't know where the tonsils are, what the tonsils are. I would have thought these are the two openings at the nose, but why should they get bigger if the mouth is used? So, the symptoms. Breathing through the mouth, blocked nose, and snoring. And also nasal speech that sounds as though the nose is blocked. So not a completely clear voice, but a nasal speech. And also deafness and recurrent otitis media. Okay, the symptoms are breathing through the mouth, a blocked nose, snoring at night probably, and a nasal speech, and deafness also, and recurrent otitis media. It would be interesting if an enlarged adenoid causes then both ears to go more deaf, and blocks both eustachian tubes to clear the middle ear. Deafness and recurrent otitis media. Then duration. Mouth breathing and a blocked nose may last for months. Okay, for multiple months, blocked nose and mouth breathing. Recurrent ear infections or deafness may occur over a period of months or years. Okay, these ear infections can happen from time to time. And also the deafness comes over months or years. It would be interesting if the deafness is then permanent. So gradually increasing or recurring, like the ear infection. Causes. Recurring or long-standing infection of the adenoid. Now it is an infection. Now it would be really interesting. Is it really the only cause? Is there no genitals, so nothing with birth, nothing with the genes? Is it actually infection causing the adenoid to get larger? Whatever. Recurring or long-standing infection of the adenoid. Complications. Repeated ear infections and deafness. So the complications can be deafness and also ear infections. And then also deafness can lead to speech impairment and so on, so on problems. Treatment in the home. There is no home remedy for enlarged adenoid. Home remedy. I'm not really familiar with the word remedy. I heard it a couple of times, but I don't know what it means. There is no home remedy for enlarged adenoid. It is a normal process of childhood and is best ignored unless there are complications. Do we actually say that an enlarged adenoid is a normal process during childhood? Maybe if it is actually just during infections. Whatever. If it does not make complications, we advise to ignore it, but this book is 40 years old and this is not medical advice. When to consult the doctor. If a child has earache or deafness in one or both ears lasting more than 4 or 5 days. Okay, earache or what was the other thing? Ear deafness. No, what was it? Yes, ear deafness for more than 4 or 5 days. And also, if the nose is blocked for more than a month and the child is unable to breathe with the mouth closed. So if the child cannot breathe through the nose, I don't want to get offended advice, but I wouldn't even wait a month. We're saying if mouth breathing lasts for longer than a month and the nose is blocked for longer than a month. What the doctor might do, examine the ears and mouth, test to see how well the child can breathe through one nostril at a time, testing the hearing, send the child to an ear, nose and throat specialist. So basically it's testing how the nose is breathing and the ears and the mouth. Just because many things are connected. Because it's oftentimes called, I don't know what the proper name is, but nose, throat, ear doctor, whatever. Why is optics not included? Optics is a specific science, but just the idea, if nose, throat and ears are so connected, why not take a look at the eyes? Send the child to an ear, nose and throat specialist. The specialist may decide that an operation is necessary to remove the adenoid and possibly the tonsils at the same time. I don't know what the tonsils are, so it can't be the opening set for nose. Recovery is usually rapid. So the recovery is rapid, and maybe a removal of the adenoid is then done. But this is 40 years old. Again, maybe there's something new developed. And also the tonsils. Now to the adenoid. Does the adenoid have a function? It is a lymphoid thing, so does it make then the infection protection less if it is removed? Outlook, from the age of 8, the adenoid decreases in size above the risk of... Why does it decrease? What function does it have from the age of 3 to 8? Imagine the adenoid has actually the function from 3 to 8 to be supportive in defending against infections during childhood. Just the idea that there is an organ or lymphoid or whatever, which is specifically there just during childhood to protect. Whatever, I don't really think that is the reason why the adenoid... What is it even? Adenoid, is it a gland? The adenoid, a pet of the adenoid lymphoid tissue. I don't think that is the reason why it exists. It would be interesting to know what the function of it is, a part of the lymphoid system. Now, what is really, actually the one system? Why is it where? Why not somewhere else? There are other types of lymphoid tissue, probably. So from the age of age, the adenoid decreases in size and both the risk of complications and symptoms decrease. The specialist's decision to operate on it depends on reaching a balance between symptoms and age of the patients. Why? Because the operation has a part of the surgery itself complications, and it has some back effect. That would be interesting. Okay, there has to be found a balance, and again, this is 40 years old, this book, so maybe there's something better already found. And we're also advising to look to the respiratory system at page 42. That was 22 pages previously. We didn't do it. We're going to do it at some time in the future. Now, that was the enlarged adenoids, or a little overview of it. Adenoid. Now, we're going to do the backstretching. If you were here for medicine, then you can go directly to the next part. We will do now the backstretching. If you participate in the backstretching, then it's better to arm risk. Good and set it stands, and we lift the arms up. And breathe out, going over to one side. And breathe in and over the rib cage. And out back into the middle. Breathe again in. And out over to the other side. Breathe in and out the rib cage. And out into the middle and the other side. And now next exercise. Now on the actor, breathe in. And out with one hand slides down the leg, and the other shoulder stays down. Then breathe again in. And now taking one arm over. Breathe in and out the rib cage. And out back into the middle. Breathe again in.
And out. First breathe in. Sit down. Breathe in. Out, take one arm over. Breathe in on rib cage. Out back into the middle. And now we are having the feet standing together. We're doing the aerobatic aeroplane. We're breathing and lifting the arms up. And breathe out, one hand down. Breathe in and reach. And out again. Take it in. And out, one hand down. Breathe in and reach. Out, one hand up. And again in. And out, one hand down. Breathe in and reach. Out. Again in. And out, one hand down. Breathe in and reach. And out. And hands down. And now our legs wide apart, and we're doing the marker. Now we're going to fit into the breathing left the arms up. And breathe out, lean back, draw the shoulder blades together and up the chest to sky. Again in. Our cross the arms and touch my fingers, reach high. And breathe out, I reach in front, hollow the back. Again in. Out, leaning again back, draw the shoulder blades together. Again in. Our cross the arms and touch my fingers, reach high. Breathe out, reach in front, hollow the back. Again in, the arms up. And out, the arms down. And we're doing the sky cutter. Breathe in, the arms up. Breathe out, the arms back, up, chest to the sky. Again in, the arms up. And out, the arms back. Again in, the arms up. And out, the arms down. And we're ending with cactus collecting its stings at the end of the evening. Breathing in, lifting the arms up. Bring the hands together and breathing out and bringing the hands down towards it. That was the backstretching. Now, I don't think that the answer to the existence of the adenoid lymphoid tissue is that it is there to protect the child during the childhood from 3 to 8 against infections. Because why then not keep it longer? And not just to decrease it, and maybe it gets more affected and can be decreased. Whatever. Why then not keep it during the whole time? But it is kept during the whole time, whatever. So I don't think the answer is that simple, why it exists. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, Angina Pectoris. And after we've done it, we're going to do stretching. And if you participate in the stretching, then it's better at your own risk. And we're talking here about a disease or a medical condition, and it's also a psychological medical condition. And to talk about it can be maybe a bit uncomfortable. So, Angina Pectoris. And this is no medical advice or anything, we're just reading what it is. We're just trying to learn. Angina Pectoris, that are attacks of choking or throttling pain across the upper part of the chest due to reduction of the blood flow through the coronary arteries which supply the heart muscle. And I haven't really thought about when I want to say it, but at some parts I'm maybe going to say that this is not really intended for people who have it or think who have. This is no medical advice, this is just for learning about it. So we're talking a bit little differently about it also. Now, because I want to say it, throttling pain. What is throttling pain? I don't really understand the word throttling. I know it from motorcycles. And I think it's interesting that blood flows can cause throttling pain. Now, pain, why pain if just blood is not coming? So we're talking differently about it than as medical advice. And also the same thing with heart attacks. I don't really understand how heart attacks. I thought it was something way more complicated, but it seems to be just that the myocardium doesn't get blood at the heart. Does that cause the pain? Why does that cause pain? Maybe it has something to do with cramps, but why does the body at all have nerves to feel the pain? Why does blood loss causes pain? Or what if, hereby now, angina pectoris, the pain is caused for something else? So, whatever. I'm just wondering about why blood loss causes pain. So, angina pectoris can attacks of choking or throttling pain across the upper part of the chest due to reduction of the blood flow through the coronary arteries, which supply the heart muscle. Yes, this is actually the same as Aortic. I think. I'm not completely sure. It occurs in spasm and is usually brought on by exertion and relieved by rest, but this is not a heart attack, as far as I understand it. Apheroma of the coronary arteries in the most common cause. Apheroma of the coronary arteries is the most common cause. Other diseases such as anemia may produce the same type of pain. Okay, anemia can do it also. Anemia, we're going to do it at one point, that is too little hemoglobin in the blood. And other diseases can be also. It occurs in spasm and is relieved by exertion, brought on by exertion and relieved by rest. Symptoms. The pain usually begins across the upper part of the front of the chest, and can spread to the jaw and down the left arm, and sometimes the right also. The pain can be described as a tight, heavy, constricting or crushing, and sometimes numbing or burning. It is never throbbing or knife-like. I think that is the difference between a heart attack, but I just think that I don't know it. It is never throbbing or knife-like. It is described as tight, heavy, constricting, crushing, numbing, burning. The pain usually lasts a few minutes and is precipitated by exertion or a meal and passes off with rest by a meal. Okay. Precipitation can cause it, and also eating can cause it. Duration. Once angina develops, the attacks usually recur. With treatment, the frequency of attacks can be reduced and may cease completely. Okay, once a person has angina pectoris, and again, this book is 40 years old, once a person has angina pectoris, I think it's also only called angina. I already confused it a bit. Developed angina, the attacks occur regularly, but there is treatment which makes them hopefully cease completely. Occasionally, despite treatment, attacks become increasingly frequent, so it can then also stop, even with treatment. Causes: exertion, such as walking, especially against the wind or up and incline, so physical exhaustion. Cold weather. Just cold weather, or cold weather having a direct effect onto the upper part of the body or whatever. Emotion, which can be brought on by an argument, shock, violence, or excitement on television. So what I mean is strong emotions. And also heavy meals. Complications. A clot may form and block the coronary artery and cause coronary thrombosis. Why could a clot form? I'm trying to understand it. I'm just a bit overthinking. Why could that make a clot form? Reduction of blood flow through the coronary arteries. I don't really understand why it should cause a coronary thrombosis. Treatment in the home. Sit down and rest. If you're walking in the street, stand still. The pain should be relieved within a few minutes. Reduce emotional stress if possible. Attacks brought on by emotion are sometimes difficult to relieve. Take sedative if one is available. If not, an alcoholic drink can be useful alternatively. But is a medication a sedative? Do not continue exercise or activity. Angina is not likely to work off without rest. Further activity during an attack may be harmful. So rest, do I say. But again, this is not medical advice. When to consult the doctor. If the pain is not relieved within 10 to 15 minutes, or if you have never had angina before. What the doctor might, and I think also what we maybe should add here, that it's, if it is throbbing or knife-like, then it is, I guess, a heart attack, then you should consult the doctor. What the doctor might do. The doctor will need to find out the cause, but there are also more silent heart attacks. What the doctor might do. The doctor will need to find out the cause of the angina and to assert its severity. If it is mild, no treatment will be needed. But if it is serious, then various medical treatments are available. If not responding to medical treatment, the diseased artery can be surgically removed and replaced with a vein graft or opened up by inflating a tiny balloon in the artery. Angioplasty. That means angioplasty is at least 40 years old. Prevention. Avoid conditions which produce the pain, for instance exertion, especially after heavy meals in cold or windy weather. Your doctor may prescribe tablets which you can safely take before exertion to prevent the onset of the pain. What are the medication doing? Just curiosity. Nothing else. For long-term prevention, do not smoke. Keep your weight down to an ideal level. Increase physical activity, but avoid precipitating an attack of angina by using your tablets if necessary. Physical conditioning by exercise often reduces the severity of angina, but be guided by your doctor. I am just noticing that most of the times, maybe even always, when there is advice with exercises, that they're saying the doctor, they mean the medical doctor, and not a specific doctor for sport or sports things. I'm not completely sure if sport, to the extent of understanding sport, is usually part of a training of doctors. What if that is from time to time maybe a little problem? That the people working together then with people who are not really specialized in sport itself. Yes, the medical things behind it, yes, but not itself sport. And I just noticed that there's always written the doctor, they mean the medical doctor, and I don't think it is part of a regular training to learn about sport and sport medicine and so on. And okay, maybe we're talking just about, not about athletes, but just about normal activities. But I just noticed that, and I wanted to utter that maybe that is a little problem. I don't want to degrade anyone, but maybe these people have not all received during their training to the perfect amount, whatever that would be, of learning about sports medicine and sport. Because I don't think that is part of the training. Outlook. The outlook for angina sufferers depends on the underlying cause. Even when the coronary arteries are diseased, reduction of weight and stopping smoking may relieve the angina completely, and may also improve the conditions of the arteries. That would be interesting how many people without smoking or overweight have angina. Okay, that was angina pectoris, but that's always referred just as angina. Now, just the medical part. If you want to go to the next part, you can go directly to the next part of medicine. We're going to do now the stretching. If you participate in the stretching, then it's at your own risk. We're doing shoulder circuits, forward, big and back, up and front, down. And the last time. And backwards. And the last time. And out. We're breathing in and lifting the shoulders up. And breathe out, let the shoulders fall down. Again, in the shoulders up. And out the shoulders down. Again, in the shoulders up. And out the shoulders down. Again, in the shoulders up. And out the shoulders down. Now we're doing the upper back. Breathe in with the arms up. And reach with one arm at a time high up. Pretend to take an apple hanging high on an apple branch. Turn it a bit around and step back. And the last two. And now the arms at the side, and we're doing a shift up, breathe in. Legs wide apart and breathe out, go over to one side, just to the upper part of the body. Breathing in into the middle, and out over to the other side. Breathing in into the middle, and out again over to one side. Breathing in, and out over to one side. Again in. And out, we're leaning onto our knees. We're doing the buffalo fighting its hangover. So breathe in. And out, we're bringing one shoulder in front. Again, in the shoulder back. And out, the shoulder in front. Again, in the shoulder back. And out, the first shoulder in front. Breathe again in. Out, the shoulder in front. Okay. And out, and we're hanging down. And breathe in. And out, go over to one leg. Breathe again in. And out, over to the other leg. Breathe again in. Out into the middle. Breathe again in. And out again. Slowly the front leg up and making it top and backwards. Shock. Out in the garden pose. The toes are pointing to the outside. And we're breathing and lifting the arms up. And we're breathing out, we're going down and placing the elbows against the inside of the knees. And breathe in and straight up the back. And out, and we're coming with the back up. And again in. And out. Again down into the front pose. Breathe in straight up the back. And breathe out again with the back up. Breathe again in. And out again down. Breathe in, straighten up the back. And breathe out, come up in one straight line. Let's do this seahorse pose. Good standing leg, the other leg with the heel on top of the knee of standing leg. Breathe in, do this only if you can do it without injuring itself. Breathe in. And out, and we are sinking down. I'm just wondering right now about condition training. Does condition training target the lung and the heart, and we're changing the leg, to make lung and heart better to deliver the whole blood with oxygen, the whole body with oxygen? Or is conditioning targeting on training the muscles so that they can do more things without needing so much oxygen? Or it goes hand in hand, it doesn't work? What would be interesting if it doesn't work, because every time the muscles are trained, it causes that the lungs and the heart have to do more. So what is condition training? What exactly is condition training? And are there options to train the specific parts of condition training? We're breathing down. And out. Get in. Out. The last time, breathe in. And out the arms down. No, that was the stretching. I thank you very much, and next time. Hi and welcome. I'm trying to learn medicine today. Ankylosing spondylitis. And after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's better your own risk. And this is in no way a medical advice. We're just learning. And this is about a disease, a genetic disease, I think. So, ankylosing spondylitis. It is a disease of the joints affecting mainly young men in their 20s and 30s. It usually affects the spine, causing joints to fuse at an unusual process of bone formation. Okay, the joints of the spine are fusing because they have an unusual process. Okay, normally they are quite loose, they're connected of course, and somehow they seem to get stiff to one side. Symptoms. Onset of symptoms is gradual over a period of months or years. Repeated attacks of backache in a healthy, fit person. I never heard the term backache. Repeated attacks of backache in a healthy, fit person. Early morning back pain and stiffness. This can radiate down one or both legs. Back pain and back stiffness can radiate down one leg. That's interesting. Increasing stiffness over the whole spine, which may be revealed if a sufferer tries to back down and touch his toes.
Okay, stiffness of the whole spine. We're having here an unusual effect of the spine causing joints to fuse by an unusual process of bone formation. So the back seems to be stiffer. Tenderness over the hip joints. Chest expansion may be limited. Spinal joints are the main ones involved, but in some cases the shoulder, hips and knees may be affected. That means ankylosing spondylitis can also affect the hips and knees and shoulders, but it seems to be mainly the spine. Duration, slowly progressive for many years. Causes, no definite cause has been isolated, but the condition sometimes runs in families. And I want to add again, this book is around 40 years old, so maybe something has changed. Causes, no definite causes has been, but maybe it runs in families. Complications. In the long term, regional ilitis, ulcerative colitis, and certain heart defects may develop. So a bunch of problems. Iritis, inflammation of the eye, can occur in 25% of cases. Why? Because the nerves are somehow connected? It is an interesting question. Long-term disease can cause the spine to become rigid, and this in turn leads to kyphosis, curvature of the spine. That was what I meant with the spine deforms differently. Kyphosis, curvature of the spine, which with neck distortion can result in a crippling handicap. Treatment in the heart, none possible, except under medical direction. When to consult the doctor? Immediately the disease is suspected. What the doctor might do? He or she may x-ray the lower part of the back and carry out a blood test to confirm the diagnosis. If the diagnosis is confirmed, the referral to hospital is usual. Referral to hospital is usual. I like the word linguistically, referral. Referral to hospital is usual. Painkillers and anti-inflammatory drugs will be prescribed to relieve the symptoms and slow down the progress of the disease. That's interesting. I would like to know how the drugs make the progress of this disease slower. How can a medicament have influence on a bony process that it doesn't get together? It would be interesting if other diseases like calcification of the arteries or other things also simultaneously oftentimes have a higher chance to have another disease of this kind, or if it's completely not connected to any other disease. Because it's the causes, there's nothing written. Just maybe genetically, but there's nothing written. But it's 40 years old, maybe something was done. And then also therapy will also be arranged to strengthen the spinal muscles and mobilize the joints. If the pain persists despite treatment with drugs and the condition is getting worse, then radiotherapy may be tried. In early cases, the results are excellent, with the disease process being apparently arrested. More advanced cases with fixed deformity can also benefit from radiotherapy. Radiotherapy, what does radiotherapy do? If it can be partly treated with radiotherapy, that should give us some indicator of what might be the cause of it. Not all specialists favor radiotherapy because it involves the risk of leukemia in about 3 cases in 1,000. Prevention. Where there is a family history of a disease, tests can assist in early diagnosis, allowing early active treatment. Outlook. For cases which are treated by anti-inflammatory drugs and radiotherapy in the early stages, the outlook is good. For cases in the more advanced stages, a combination of these measures can often restore the patient to a reasonable level of activity. Now that was the medical part. If you were here for medicine, we're looking directly to the next part. We will do now short intervention training. If you participate in short intervention training, then it's at your own risk. Good, as said, and we're doing forward doing that. We're doing forward shoulder circles. Going back, up, front, and down. And listen. And now more advanced shoulder circuits. Long arms, strong fists. And go as far back as you can with the shoulders. Bring high up and then front. And down and back. Up and front and down and now backwards. Up, back, down and front. Down. Now we do a left. Go to side stance. Long arms, strong fists, and bring the shoulders down. Together. Now turn the arms to the inside. Now the arms to the outside. The shoulders are staying down. Just together. And change the arms to the inside. Shoulders down. Just together. And the arms to the outside the last time, shoulders down, together. And release. The arms to the side, hands on the fists, the arms with in front, turn the arms now in front, and bring the shoulders down, together. Arms in front, shoulders down, together. And now change the arms back, shoulders up and in front. Release. No, not release the arms in front, shoulders back and together. And change again, arms back, shoulders up and in front. And now a shrug. Just lift the arms up and then shrug the shoulders up. If this exercise causes pain, then don't do it. Get the arms up. And down. And again, the arms up. Shoulders up. And down. And the last time. Arms up. Shoulders up. And down. And now the principal. Arms together, bring them a bit down and to the outside. More or less just to relax a bit, but also to see how the scapulars are working. And last time. Now the sandal. You can also use a tennis ball or a t-shirt. Have the long arms beside. And then just fall down. And try to catch it. And bring it up. Now stretching one arm in front. The shoulder is back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go a bit back with the shoulder. Turn the palm up to the sky. And the other arm shoulder. Shoulders back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go back with the shoulder and turn the palm up to the sky. And that was my shoulder bending. I thank you very much and next time. Hi and welcome. I'm trying to learn medicine. Today Anoxia, and after we've done it, we're gonna do backstretching. And if you participate in the backstretching, then it's at your own risk. And this is about disease. I will talk also about internal anatomy, and this is in no way a medical advice. And this is more intended for people who want to learn just about diseases and not actually look if they or someone we know has it. Now the first thing, anoxia, it is not anorexia. Anorexia, that is the eating disorder. This is anoxia. Anoxia. That is an insufficient supply of oxygen to the tissues of the body. Anoxia Anoxia. That is insufficient supply of oxygen to the body. In anemic anoxia, the reduction in the supply of oxygen to the tissues is caused by deficiencies in the constituents of blood. There may be a shortage of red oxygen-carrying blood cells or fault in the chemical makeup of hemoglobin. Okay, the red oxygen-carrying blood cells, they are maybe too little of them, and there can be a fault in the building process of the hemoglobin. I think the hemoglobin are these red oxygen-carrying blood cells. Sometimes anoxia is said to be stagnant, in which case it is the result of general or localized slowing, stagnation of circulating blood. Okay, in the case that anoxia is stagnant, then it is the result of localized slowing of circulating blood. Stagnant anoxia may be caused by problems such as heart failure, shock, a blockage of a blood vessel and thrombosis, or spasm of the muscular wall of the blood vessel. Okay, anoxia seems to be not by itself a disease, but something which can happen alongside or through other things, like heart failure, heart shock, or blockage of a blood vessel thrombosis, or spasm of the muscular wall of a blood vessel. Deficiencies in the respiratory system may also cause anoxia, and in this case the condition is known as anoxic anoxia. Okay, anoxic anoxia, that is when it's caused through the respiratory system, the insufficient supply of oxygen to the tissues of the body, anoxia. And it can be also stagnant when it is a result of general localized slowing of circulating blood. Don't really know how it plays out. Sufferers from chronic bronchitis, for example, often have a degree of anoxia because the amount of lung tissue available for the exchange of oxygen and carbon dioxide during breathing is reduced. That is interesting. Okay. The amount of lung tissue available for the exchange of oxygen and carbon dioxide during breathing is reduced by people with bronchitis. Logically, people who are sick must have less oxygen supply. Does it have any secondary causes onto the body that the oxygen supply, if I concluded now correctly, is reduced when people have bronchitis or another infection of the lungs? Do any other types of diseases which have to do with blood circulation and oxygen supply a worsening during the state in which the person has an infection? And not just that the infection is a problem for the body or whatever, just that the amount of oxygen produced and the oxygen carbon dioxide exchange in the areas of the lung is reduced. Has this any direct consequences? Do people have any types of symptoms like getting earlier blue toes or whatever, less blood supply to the feet and hand, even if they have now a second disease? I just think that's very interesting that the amount of lung tissue available for the exchange of oxygen and carbon dioxide during breathing is reduced if people have something like lung or bronchitis. So, now also the question, the mechanical reason, why is it reduced? In what form are they disabled? Or, yes, in what form are they disabled to do their job of oxygen and carbon dioxide exchange? Anoxic anoxia may also be caused by an asthmatic attack where the airways are constricted, or by weakness or disease of muscles that are used in breathing. Okay, anoxic anoxia, that is when the lungs is playing a part in this. Anoxic anoxia. Anoxia is the general thing. By an asthmatic attack where the airways are constricted, or by weakness or disease of the muscles that are used in breathing. More rarely, the condition may be a result of a reduced oxygen content of the air that is breathed as at high altitudes. Okay. Anoxia can also come if there's just not enough.
air in. So it's a completely mechanical thing. If there's not enough oxygen in the air, as people have might when they climb on high mountains. Okay, anoxia, that is insufficient oxygen supply, anoxia, insufficient oxygen supply to the whole body. And it can be stagnant, that means it is a result of general or localized slowing of circulating blood. I don't really get the part. And it can be anoxic anoxia when it's because of a lung. It can be because of a bronchitis, or if people are climbing high on a mountain, or if they're having an asthmatic attack or another or in a weakness at the muscles which are involved in the breathing. And the main thing we want to take from that is the amount of lung tissue available for the exchange of oxygen and carbon dioxide during breathing is reduced. Now, what was the medical part? If you medicine, when you're going directly to the next part, we will do now backstretching. If you participate in the backstretching, then it's better to be honest. Legs above shoulder wide apart, we're bringing the finger upside. And breathe out, we're going over to one side. Breathing in open rib cage. And breathe out back into the middle. Breathe again in. And breathe out over to the other side. Again in, open the rib cage. Breathe out back into the middle and the arms down. Next exercise, now one sees the Rupture, breathe in. And out with one hand slides down the leg, and the other shoulder stays down. Breathe again in. And out in between one arm over. Breathe in and open rib cage. And breathe out back into the middle. Breathe again in. And out one hand slides down the leg, the other arm stays down. Breathe again in. And out, we're taking one arm over. Breathe in and open rib cage. And out back into the middle. Now the feet stand together. The aeronautic aerobatic aeroplane, breathe in with the outside. And breathe out, one hand down. Breathe in and reach. And breathe out. Again in. And out, one hand down. Breathe in and reach. And breathe out, one hand up. And another time, breathe in. And out, one hand down. Breathe in and reach. And breathe out, one hand up. Again in. And out, one hand down. Breathe in and reach. Out one hand up and the hands down. And now we're doing crabble warning. Breathe in the arms up. And breathe out, bring the hands down, draw the shoulder blades together and open chest to the sky. Breathe in the arms up. And breathe out again, the crabble warning. Breathe in. Over cross the arms, touch by the fingers and reach high. And breathe out, reach in front, hold over back for tray. Again in the arms up. Breathe out, open the arms wide, the sky hugger, lean back. Breathe again in. Over cross the arms and touch by the fingers and reach high. And breathe out, reach in front, hold over back. Breathe again in the arms up. And out, lean again back, the sky hugger, open the chest to the sky. Again in. Out the arms down, and now the eagle's wings, the feet are standing together, the breathing and lifting the arms up. And breathe out the arms down, and the arms up. And breathe out the arms down, and we're ending with the cactus connecting its stings. Breathe in, lift the arms up. Bring the hands to touch and lower them down to heart center. That was the backstretching. I thank you very much, and next time. Hi and welcome. I'm trying to learn medicine today, Antepartum Haemorrhage, and after we've done it, we're going to do Neckstretching. And if you participate in the Neckstretching, then it's at your own risk. And we're talking about the blood system and bleeding disease. And also this is more a bit about pregnancy and a bit about mature things or explicit. So this is not properly family, what is it even called, family friendly. Now, antepartum hemorrhage, that is any bleeding from the vagina that occurs during pregnancy. It may well be symptomatic of a condition that is serious for mother and baby, and the doctor should be summoned right away. Okay, it may well be symptomatic, I don't know what symptomatic means, of a condition that is serious for mom and baby, and the doctor should be summoned right away. What it's telling us, the doctor should be summoned right away. Symptoms. Any blood loss during pregnancy. The loss may be heavy and contain clots. Okay, blood loss during pregnancy. Duration. How long the bleeding lasts will vary from case to case. Causes. If a hemorrhage occurs during the first 3 months of pregnancy, it is usually due to a threatened miscarriage, which is common, or a complete miscarriage. Okay, in the first 3 months it has something to do with miscarriage. And also the next thing is, otherwise it is usually due to placenta previa or detachment of afterbirth. Placenta previa, that seems to be a noun condition. Placenta previa or detachment of afterbirth. It sounds serious. Okay, what we're telling is that the placenta has a problem. So the placenta has a problem. The placenta has ripped off. I don't know. And again, this is no medical advice anyway. We're just learning about disease. This is no medical advice, and we're not really here to. So this is not intended for people who look if they have a condition or they know some of this condition. We're just learning about hundreds of diseases, without in particular this one. And detachment of the afterbirth from the wall of the uterus due to toxemia of pregnancy. Okay, it is. There can be something of the afterbirth. I don't know. Is the afterbirth the placenta? No, the afterbirth is. But it's a thing that comes out after the baby. But is it now the uterus or the placenta? Whatever. Something is wrong. So consult the doctor, I say. Treatment in the home. Rest in bed until doctor arrives, I say. Keep any blood clots that have been passed so that the doctor can examine them. Yeah, to examine if it is the afterbirth or what it is. So we're saying two things. Rest until the doctor arrives, and keep the samples you have, keep the blood clots. When to consult the doctor? Summon the doctor as soon as any bleeding occurs. What the doctor might do? Treatment depends on the cause and severity of the bleeding. Often the mother is immediately admitted to hospital. In some cases, bed rest is all that is needed. Okay, it has to do what it is, what the reason is, and how severe the bleeding is, and what the cause of it is. And treatment, so oftentimes the mother is coming to hospital, but oftentimes bed rest is sufficient. Prevention. All unnecessary strenuous activity should be avoided during pregnancy. If a woman is in doubt about any activity, she should discuss it with a doctor or midwife. Okay, with a doctor and something else, or midwife. Sexual intercourse can safely be continued during pregnancy unless the woman has a history of miscarriage or antepartum haemorrhage, in which case she should discuss the matter with her doctor. So any form of physical activity should be discussed with a doctor, I basically say. Outlook. The outlook for mother and baby depends on the cause, but is usually good provided the doctor is consulted immediately any bleeding occurs. Okay, I'm not going to go too much into it now. Occasionally, antepartum hemorrhage ends in premature labor or stillbirth. Yes. So it can be a problem for the growing baby, and so a doctor should be consulted. Now, basically, antepartum hemorrhage, that is any type of bleeding from the vagina, and if it happens during pregnancy, then a doctor should be consulted immediately. That was antepartum hemorrhage. If you were here for medicine, you can go directly to the next part of medicine. We will do now the Neckstretching. If you participate in the Neckstretching, then that is at your own risk. We are having the Neckstretching. Yes, Jean Charles before the part, and we're doing the hydro tower. We're breathing in and lifting the arms up, and we're stretching with the fingers as far away as we can, and high up, and again down, stretch, or try to reach as far as you can with the fingers, and again.
And stretch as far as you can with the fingers. Stretch high up with the fingers, the fingertips. And down. Now we're doing the police episode. The legs are standing together. And breathe in, lift the arms up. And breathe out, open the arms to the side. Again in. And out, open the arms to the other side. Again in the arms up. And out the arms down. And now. Normally, I'm going to try to fight the plan. Breathe in, follow, and breathe out, bring the head over to one side. Breathe again in. And breathe out, bring the head down to the clavicle. Breathe again in. And out, lift the gaze and turn it over to the other side. Breathe again in. And out, bring the head down to the clavicle. Breathe again in. Out, lift the gaze and bring the head over to the other side. And the chin down to the clavicle. Breathe again in. Now breathe halfway out. And roll the head over to the other side. And breathe again in. And out, roll the head over to the other side. And begin with, now do the head pause. And now we are doing the grip in the morning. The feet are standing together, breathing in as the arms up. And breathe out. Down shoulder blades together, upper chest and sky. Breathe in, lift the arms up. And breathe out, shoulder blades together, upper chest and sky. Breathe in, lift the arms up. Take your hands together and breathe out. Lean back, breathe in the wind. Breathe again in into the middle. And breathe out and lean again back. Breathe again in into the middle. And breathe out and lean over to one side. Breathe in into the middle. And out over to one side. Again in into the middle. And reach high, over cross the arms and the fingers. And breathe out, reach in front and hold the back. The drill. Breathing in, the arms up. And out, lean back, open the arms wide. Again in. Cross the arms and turn the fingers, reach high. Breathe out, reach in front, hold the back. Breathe in, up. And out and the arms down. And now we're doing the cashew. Leg shoulder width wide apart, intertwine the fingers behind the back. Soul up, breathe in. And out, turn the gaze over to one side. And the chin down to the clavicle. Now breathe in. And out, reach with the hands down to the floor. Breathe again in, release. Lift the gaze to the head over to the other side. Soul up. And breathe out again, the chin down to the clavicle. Breathe again in. And out and reach with the hands down to the floor. Breathe again in, lift the gaze. And out, turn the head back into the body. And now the stretch of Venus. Intertwine the fingers, hand behind back. Bring them over to one side, tall up, breathe in. And out, turn the head over to one side. Send the chin again down to the clavicle. Breathe in. And out, pull the arm in and the shoulder down. Breathe again in, lift the gaze, turn the head over to the other side. And breathe out and bring the chin down to the clavicle. The hands have also changed to the other side. The head is looking to the side with the hands up. Breathe in. And out, pull the arm in and the shoulder down. Breathe again, lift the gaze, turn the head back. Now we're doing vegan swings. The feet are standing together, breathe in, lift the arms up. And breathe out the arms down. Again in the arms up. And out the arms down. Again in the arms up. Close the hands and breathe out and bring the hands down. That was the Neckstretching. I thank you very much and next time. Hi and welcome. I'm trying to learn medicine. Today, aortic incompetence, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's been at your own risk. And this is about the blood system and a disease. And this is in no way a medical advice, we're just learning about it. Aortic incompetence. The aortic valve lies at the exit of the main pumping chamber, ventricle, and should close after each heartbeat, preventing the backflow of blood into the heart. Okay, they're talking about the left ventricle? Yes, out of the left ventricle there comes the aorta out. And that aorta has a valve, and normally after the heart has pumped the blood into the aorta, the ventricle closes and now blood can flow back. The blood is then in the aorta and comes into the body, and it doesn't flow back. Now, if there's a problem with this valve, with this closing thing of the aorta, then the blood can flow back, and it is not so good given into the body. When diseased with aortic valve, the valve becomes thickened and doesn't close adequately. Blood leaks backwards and causes pressure in the heart. Causes pressure. As well as being incompetent, the valve may be narrowed, that is when stenosis. We have it as the next thing. So it can be narrowed when it is stenosis, and it doesn't close properly, but it can become also thickened and doesn't close also properly. Whatever. Symptoms. In mild cases, there are no symptoms and the condition goes undetected. Certainly, at least a little bit diminishing in the ability to do physical activities. So in mild cases, there are no symptoms and goes undetected. And then, I think I understood it now, the symptoms are listed in severity, I think. Maybe in this book. The next thing is shortness of breath. Occurs when there's a large blood leakage. Causes. Rheumatic fever as a child. That is interesting. There are a lot of diseases and problems in the human body which happen because there was previously an infection. Who knows how many things there are in the human body as diseases and problems, but we don't know yet that there is some type of infection previously responsible for it. We already know about so many things. For example, about the aortic incompetence. Do we know that rheumatic fever as a child can cause it? And also, sclerosis or hardening of a valve can be a cause. So sclerosis, I'm not sure of what type of sclerosis, but it could be that they all are the same, that they are all about the nervous system. Lateral sclerosis, that would be that the muscles stop working over a few months and years. Multiple sclerosis is also of the nervous system, and I don't really know how that works. But there's the survival of it is longer, and there's better treatment. Sclerosis or hardening of a valve. And infections can be also a cause, and congenital abnormalities of the heart, so inborn things. Treatment in the home. Avoid exertion causing shortness of breath. The treatment in the home, do they mean not how to treat it, but basically how to live with it in this case. Avoid exertion causing shortness of breath. When to consult the doctor. If undue breathlessness occurs, and again, this is no medical advice, we're just learning. When to consult the doctor if undue breathlessness occurs, so if there's breathlessness. What the doctor might do, try to treat the breathlessness with drugs. The diseased valve may be surgically replaced depending upon the patient's age and general health. Okay, now first of all, looking what the causes of a breathlessness, and when there seem to be some drugs to help, some medicamentations, and when there are also surgical options. Prevention, non-domestic. But if it is caused through rheumatic fever, what is rheumatic fever? Maybe we're gonna come to it. Maybe that is not an infectious disease, but they say no prevention, but who knows? Maybe we're going to find out more. Outlook. A slight blood leakage makes little difference in the quality and length of life of a sufferer. A larger leak may lead to heart failure, but this may be controlled by drugs. Surgical replacement of a diseased valve improves the outlook considerably, but the operation is not without risk. Okay, as I said, if it's just a little problem, a little blood backflow, then that's more or less no problem. If it is more, then it can cause heart failure, but there are drugs making that more unlikely. And if a valve is surgically replaced, then it's all over better, but the surgery is a bit... What is the word of it? Demanding. But doesn't work for in that case. It's not without risk. Now that was the aortic impedance. I don't understand the word incompetence. If it would be incomplete, I don't understand the word incompetence, and I think it's just a normal English word just to do not understand it. Incompetence, aortic incompetence. Now that was the medical part. If you were here for medicine, anything already to the next part, we will do now short impingement training. If you participate in the short impingement training, then it's better. Let's go. Go to step stance, and we're doing forward shoulder circuits. Go back, up, front. And again back, up, front, and down, and now backwards. And now, long arms, strong fists, and go as far back as you can with the shoulders. Go high up, either front, down, again, back, up, and front, and down, and again, up, and back, down, front, up, and back, and down. And now, the world lifter. Long arms, strong fists, and go shoulders down, and together, and turn the arms to the inside. Now the arms to the outside, shoulders down, and together. And change. Arms to the inside, shoulders all the time down. And now arms to the outside, shoulders down, and together. And release. No. Arms to the side, hands from the fists, mid in front. Turn the arms again in front, shoulders down, hands together. And change. Arms back, shoulders up, and in front. Change. Arms in front, shoulders down. And the arms back. Last time, shoulders up and in front. And release. Now we shrug. Just lift the arms up. And shoulders up. And release it all down. Again, the arms up. Shrug with shoulders. And all down. And the last time, arms up. Shoulders up. And all down. Now, press the curl to loosen all up and to observe what the scapulars are doing. To the outside with fists and again together. Down and to the outside. Maybe it's already the last time. Now we're doing the sun dive. You can also use a tennis ball or whatever. Have a little long arm at the outside. Let it fall down. Try to catch it again. Then wander slowly in front. And on the other side. And now stretching. One arm in front. The shoulder is back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go a bit back with the shoulder. And turn the palm up to the sky a bit. Now we are arm. Take the arm in. Shoulders back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go a bit back with the shoulder. Turn the palm a bit up to the sky. And it was the shoulder bit training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, aortic valve stenosis. And after we've done it, we call it the martial arts basic training. And if you participate in the martial arts basic training, then it's better to have risk. And we're talking about diseases and the blood system. And this is no medical advice, we're just learning. If you basically, because you think you have aortic valve stenosis, you're not right here. We're just learning about diseases and also all types of diseases. So this is intended for people who just want to learn about it, not for people who have it. Aortic valve stenosis. That is a disease of the heart valves. The aortic valve, which consists of 3 cusps, valve flaps, normally opens with each heartbeat to let the blood flow forward to the body. Let's see it again. The aortic valve, which consists of 3 cusps. The tricuspid valve, where's that now? Maybe that has nothing to do with it. Maybe it is the one between the atrium and the left ventricle. Yes, the left atrium and the left ventricle. Whatever. The aortic valve has 3 cusps. These are valve flaps. And normally opens with each heartbeat to let the blood flow forward to the body, into the aorta. When diseased, the cusps become thick, hard and often fused. That is interesting, fused. How does that happen? Biologically asked. How can something grow together? Because that's a big problem in the whole medical aspect. The opening is stenosed, which means narrowed, and obstructs the forward flow of blood. Okay, stenosed means narrowed. And obstructs the forward flow of blood, especially to the brain and coronary arteries. Okay, I don't know who's supplying to the coronary arteries actually. But yes, to the brain because it comes to the arc of the aorta, and when it goes there to the arms, the rest of the body downwards also, but also to the head. As well as being narrowed, the valve may be incomplete. See aortic incompetence. We had it previously. I don't get the difference between the two. It's probably the same thing. It does not close properly because it is thickened. Here it is narrowed. It closes all of it. Okay, it's the opposite. Yes, that would be nice to know what the word incompetence means. Aortic incompetence. Maybe the word incompetence says what it is, like aortic valve stenosis. Some people are born with a stenosis. It may follow infections in young people, or it may develop as a result of hardening of arteries. Okay, it can be born in. It can come through infections. and it can result also as a result of hardening of arteries. Symptoms: angina pectoris, that is pain across the upper part of the chest related to exertion. Angina pectoris. We had angina pectoris, that is the pain in the breast, choking and throttling pain across the upper part of the chest. But angina pectoris, they said that is more because of physical exercises, and I said already, yeah? I think. And it can be also through things like this here, aortic stenosis. Okay, that can cause pain in the upper part of the breast, angina pectoris. Also shortness of breath. Shortness of breath, dizziness, especially when standing up from a sitting or lying position, fainting on exertion. Duration: symptoms persist unless the condition can be treated. Causes: acute rheumatitis, rheumatic fever in early life, which sometimes go unrecognized. The valves are inflamed and the three cusps become fused and rigid as years go by. Now we have to find out in some place what rheumatic fever is. I just don't want to fast forward. Now, what is rheumatic fever? No, rheumatic fever can't do it. What is it doing? It can go unrecognized from early age, and when the valves are inflamed and over years, they fuse and get rigid. That means there can be infections which over years cause continuously problems. We have to know what rheumatic fever is. Sclerosis, hardening of the valves which occurs in older people, so sclerosis. The cause of congenital aortic stenosis is not known. This book is 40 years old, maybe something has been done. Treatment in the home: avoid too much exertion and take care when standing suddenly from sitting or lying position. Avoid becoming overweight, smoking and drinking. And they're using always the term treatment in the home. They mean more just how to live with it. Not that is if you want to treat it, how it is the treatment. This is when to live with it. Then after you've got the advice from the doctor. When to consult a doctor: if you get angina, so pain in the wrist, shortness of breath, dizziness, or fainting. If you know that you have aortic stenosis and there's a change in your symptoms, for example, worsening of angina or increasing shortness of breath, then you should also consult a doctor. What the doctor might do is send you for X-rays and ECG and other tests to assess the severity of a stenosis. Okay, it makes a lot of tests. Surgery may be necessary, but if a strain on the heart is not great, then a regular check-up may be all that is required. Is there any form of treatment against rheumatic fever? If it has cost, it's devilish work over years, diabolic work over years. Suggest that you take antibiotics if you have teeth extracted. What? Are you on the right page? What the doctor might do, suggest that you take antibiotics if you have teeth extracted to combat infection and prevent further damage to the valve. Teeth? Why should people have teeth extracted in the first place so often? Suggest that you take antibiotics if you have teeth extracted to combat infection and prevent further damage to the valve. Why do the valves at the aorta get a problem if you get the teeth pulled out? Whatever, prevention. See rheumatic fever. Outlook. Stenosis discovered by chance and causing few symptoms may change very little over the years. Severe stenosis may lead to heart failure and shortened life expectancy. Surgery involving valve replacement or splitting the valve in the young may improve the outlook. This is 40 years old. I'm pretty sure that there's, in the meantime, a lot which have been done. Now I want to know a bit more about the actual things of what causes it. Is it just a mechanical problem, basically? If by a car just at
once a pipe there's a problem with the closing, that's something which can be fixed pretty easily with a 100% positive outcome, basically. Now it sounds to me as if it would be just that. Now, if not, all the problems with surgery and so on would be not necessary to consider, because we are so good. If that would be it, then it should be something which should be able to heal completely. Now we're going to read on. At one time we will come in a couple of hundred pages to rheumatic fever. If you hear from Addison, you can go directly to the next one. We will do now the martial arts basic training. If you participate in the martial arts basic training, that is at the arms, we bring one leg up and we do a regurgitating mushroom. Bring the foot up and down, up and down. Now we have a leg up and bring the foot up and down. Take the foot at the ankle, make it straight back, and point with the knee down to the floor. So just stretching the core muscles. Take the other foot at the ankle, make it straight back, point with the knee down to the floor, so just stretching the core muscles. Now we're doing the angenommen. Heel onto the ground and pull the toes in. Move now the leg from left to right. We are heel to the ground and pull the toes in. Move the leg from left to right. Now we're going to the one more exercise up in the... No. We're doing directly the chain. Stop. The toes are pointing forward and stretching the inner side of the leg. Over to the other side. Toes are pointing forward and stretching the inner side of the leg. Now we're doing the mantis from side to side. Now we're doing lunges. Fall in front. Now back again. And a few more times. And the last two. Now we're doing the shovel snowplow. One knee up and bring it back. Knee up and back. 3 steps in the middle. 1, 2, 3. Knee up and back. And the last time. Now we're doing stretch kicks. Arm out, kick against it. Other arm out, kick against it. You can do again 3 steps in the middle. And last two. And now the frog. Knee up, back and up, and other. Knee up and back, up and in. And last two. Now Crescent kicks. Leg up and back, up and in, up and back and in. Last two. Now swing kicks. Swing the leg in front, swing it up, step back, 2, 3, the other one.
And the last two. And the last exercise, 10 push-ups. Hands underneath the elbows, and the elbows close to the rib cage. The first one, and the second one, the third one, and the fourth one, and also the fifth one, and the sixth one, and the number 7, and the 8th one, 9th, and the 10th. Not just the stretching. Here onto the ground, we're doing the hiker sit-up stretch. Pull the toes in, put to the left and pull the toes in. To the right and pull the toes in. Into the middle, pull the toes in, move the leg from left to right. The other heel into the ground and pull the toes in. Put to the right and pull the toes in. Put to the left and pull the toes in. The middle and pull the toes and move the leg from left to right. And we're ending with a trunking right out. Legs at the outside, you're breathing in, going down. And out. Again in. And out. Again in. Out, and the last time we close the legs. And out. That was some martial arts basically. Thank you very much. And it's next time. Hi, welcome. I'm trying to learn medicine. Today, appendicitis, and after we've done it, we're gonna do backstretching. And if you participate in the backstretching, then it's well at your own risk. And this is about diseases and internal anatomy. And this is no medical advice, we're just learning. Now, in one of the previous parts, we talked about the tricuspid valve. And I said the position wrong. The tricuspid valve is on the right side from the heart scene, between the right atrium and the right ventricle. The mitral valve is on the left, between the left atrium and the left ventricle. And the atrial septum and the ventricular septum, maybe I said it also not right, they are just here between the right atrium and the left atrium, the atrial septum, and the ventricular septum between the right ventricle and the left ventricle. And they are closed. They should be closed, otherwise it's a septal defect. So the tricuspid valve is on the right side. Tricuspid between the right atrium and the right ventricle. Tricuspid. Mitral on the other. Now, appendicitis. That is an inflammation of the appendix. Of the appendix, long, blind tube arising from the beginning of the large intestine. No, from the stomach comes the small intestine and the large intestine, and at the beginning of the large intestine, there's this little thing. You see it? 3 to 4 inch, 7 to 10 centimeters long blind tube, do we think? It's actually that long. Okay, from the stomach there goes the small intestine and then the large intestine. At the beginning of the large intestine, there is this appendix. There are two kinds of appendicitis. Acute, which strikes suddenly and usually requires immediate hospital admission for an operation to remove the appendix, and chronic, which may continue for months before an operation is necessary. Okay, acute appendicitis. Symptoms. These may develop over 4 to 48 hours, so over few hours, just 3, 4, 5, 6 hours, but up to 2 days. The first sign is usually pain that comes and goes. At first it may be felt near the navel or sometimes only in the lower right side of the abdomen. I think the navel is the belly button and the lower right side in here. After a few hours there is severe constant aching in the lower right side of the abdomen, which is tender to pressure. The pain is worse on moving and may interfere with sleep. Okay, the symptoms develop over a couple of hours, 4, 5, 10, 20, 40 hours. And there's pain coming and going, usually at the beginning, and when it is felt near the navel and more on the right side of the abdomen. Then after a few hours it gets severe and constant aching. The patient feels sick and may vomit. There's often constipation, but sometimes the bowels may be loose or normal. I don't know what constipation is. but sometimes the bowels may be loose or normal. Food and drink are usually refused. It may hurt to walk around or to pass urine. Okay, here was already moving. The pain is worse on moving and may interfere with sleep. It may hurt to walk and also to pass urine. There may have been a previous similar attack of pain that subsided. I want to know the cause. Why in that case it subsided. The breath may be foul or foul smelling, so foul smelling breath. Maybe. The temperature usually rises moderately up to 39 degrees Celsius. In children, high temperatures may be noted. Duration. An immediate operation is usually needed, after which patients are discharged from hospital within 1 or 2 weeks and can go back to work after 3 weeks. Okay, an immediate operation is necessary, and then 1 or 2 weeks in the hospital. Sometimes the pain will stop after a few hours, but patients should never delay seeking medical help if appendicitis is suspected. Okay, if there is pain coming and going, and after developing of a few hours, 4, 10, 20, 1 or 2 days, after a few hours, just 4 to 48 hours, then a severe constant pain on the right side of the abdomen to the navel. Causes. The open end of the appendix becomes blocked by kinking, swelling inside the walls, or by a hard mass of fecal material, and infection flares up into an abscess. I don't know what kinking is, blocked by kinking, but is swelling inside the walls, or by a hard mass of fecal material, and infection flares up into an abscess. Complications. The abscess may burst, spreading the inflammation all over the abdominal cavity and causing peritonitis. Sometimes the appendix bursts and the spread of inflammation is localized to the appendix area. This is an appendix abscess. So again, sometimes the appendix bursts and the spread of inflammation is localized to the appendix area. This is an appendix abscess. Whatever, an appendix abscess. Treatment in the home. Let the patient lie still with a hot water bottle to ease the comfort. To the hot water bottle to the abdominal pain, not to drink out. Do not give food or drinks. Do not give food or drinks. The mouth can be rinsed out with sips of water only. So not eat. Because already food and drink are usually refused, and do not give any food. Let the patient lie still. Do not give any pain-killing tablets, laxatives, or any other medicines. So not give medicamentation, but if appendicitis is suspected, ban. What's it? Whatever I said, you should call a doctor. Never delay seeking medical help if appendicitis is suspected. When to consult the doctor? If pain has persisted for more than 4 hours. But call the doctor earlier if the pain gets worse, becomes continuous, or keeps the patient awake. Diagnosis of acute appendicitis is always difficult because the symptoms are so variable, so an immediate medical opinion is essential, especially in children and the elderly. Okay, by saying after 4 hours of pain in the right abdominal side or to the navel, you should seek the doctor, but also earlier if the pain gets worse or is continuous. And by children, even maybe a bit earlier, because it's a bit problematic to assess it, and it has to be immediately operated. What the doctor might do: send the patient to hospital immediately for observation or surgery if acute appendicitis is suspected. Okay, if the appendicitis is suspected, then it comes into the hospital because a surgery is necessary. Occasionally, if the diagnosis is in doubt or the pain has cleared, the doctor may decide to observe the patient at home. If it was not appendicitis, I would like to know if what more profound possible things exist to check if it is an appendicitis from the outside. Prevention, none. Outlook: with early observation leading to early diagnosis and treatment, the outlook is excellent, I say. So early observe it if there's for few hours, just 2, 3, 4 hours pain, and then directly we to the doctor and to the hospital in the operation, then the outlook is excellent. Recurrent attacks of acute appendicitis arise if the appendix is not removed. Yes, what happens if it's not removed? But it seems pretty serious. Okay, whatever. Chronic appendicitis. A condition in which the patient feels bouts of vague discomfort in the right lower abdomen. What are bouts? B-O-U-T-S. Often for some months, although acute appendicitis rarely develops. Okay, there is the rarely developing chronic appendicitis, and there are bouts of vague comfort in the right lower abdomen felt. Often an operation is performed to see if there are other reasons for the discomfort. Now I want to know, are there any possibilities to see from the outside if the appendix is inflamed? But rarely are any found. The appendix is usually removed, and in most cases the symptoms disappear. Okay, in short, if there is over 2, 3, 4 hours pain in the right side of the abdomen or to the navel, I'll see a doctor. I think anyway, if that's for 2, 3 hours. And it can be if appendicitis is suspected, then seek immediately the doctor. And that is if there's pain for 2, 3 hours in the abdomen. And then further steps are taken. And if it is appendicitis, then it is removed. Now, that was the medical part. If you were here for medicine, then you can go directly to the next part. I will do the backstretching. If you participate in the backstretching, then it's at your own risk. The legs are standing on the shoulder before the part, that we're breathing in and losing the outside. And breathe out over to one side. Breathe again into the middle. And out over to the other side. Breathe again in. And out into the middle. Breathe again in. Out over to the other side. Breathe again in. Out into the middle. Again in. Out of the first side. Breathe again in. Out into the middle and the arms down. Next exercise, no one sees the Rupture. Breathe in. And out, one hand slides down the leg and the other shoulder stays down. Breathe again in. And out, and we're taking one arm over. Breathe in and out, middle cage. Breathe out, back into the middle. Breathe again in. Out, one hand slides down the leg and the other shoulder stays down. Breathe again in. And out into taking one arm over. Breathe in and out, middle cage. Out into the middle. Now, aortic airplane, the feet are sitting together. Breathe in, lift the arms up. And breathe out, one hand comes down. Breathe in and reach in both directions. And breathe out, one hand comes up. Breathe again in. And out, and one hand comes down. Breathe in and reach. And breathe out, one hand up. And out, one hand down. And now we're doing the clap in the morning. The legs wide apart, our shoulders apart, and breathing in and the arms up. And breathe out, draw our shoulder blades together. And up, chest to the sky. Breathe again in, lift the hands. Breathe out and again back. Again in and up. Now over cross your arms, intertwine the fingers and reach high. Breathe in with screw. Breathe out, release. Change the position of the arms, intertwine again the fingers. And breathe in and reach high. And breathe out and release. Now change the position again, over cross. Breathe in, reach high. And breathe out and reach in front, the drill. Hollow back. Again in the arms up. And out again, the clap in the morning. Drop the shoulder blades together on the chest to the sky. Breathe in, over cross your arms, intertwine the fingers, reach high. And breathe out, reach in front. Again in. And out the arms up and down. And we're ending with the sky hugger. Feet are standing together, we're bringing in the arms up. And breathe out, lean back, open the arms to the sky. Breathe and lift the arms. Breathe out, leaning them back. Breathe and lift the arms. Out and bring them down. And we're ending with a cactus collecting its stings. Breathe and lift the arms up. Close my hands and lower the hands down. That was backstretching. Thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, Adenitis. And after we've done that, we're going to do Neckstretching, and if you participate in the Neckstretching, and it's at your own risk. And we're talking here a bit about anatomy and diseases. And this is in no way medical advice, which is learning. Adenitis. That's inflammation of any glands. Now, I still don't really know what glands are. We have the pituitary glands. They are in the brain, do we know. That was here Acromegaly, where the skin thickens of the hand, feet, and face because the pituitary gland is overproducing growth hormone. And there is a benign, that means non-cancerous, tumor of the gland caused by excess production. Treatment consists of destroying the tumor. And this acromegaly occurs after the age of normal growth. If it happens during childhood, then it is gigantism, which happens. So acromegaly, skin thickens of the hand, feet, face, and the lower jaw. There, the pituitary gland, which is in the brain, produces too much growth hormone. Now, and we're having now adenitis, that is inflammation of any glands. Acromegaly, that was a tumor, a non-benign, benign, a non-cancerous, a benign tumor. And of the acromegaly, of the pituitary gland, which causes an acromegaly. Now we're having adenitis, that is inflammation of any glands. The term usually refers to lymph glands. Okay, there are subcategories of glands. We had here by enlarged adenoid, that's the adenoid lying between the mouth and the pharynx or whatever, and the mouth. In the mouth cavity, that is a lymphoid tissue, the adenoid. Now, adenitis, that is inflammation of any glands, and the term usually refers to lymph glands, especially those in the neck. Now, that could be the adenoid, I don't know. Armpit. So we're saying there are glands in the armpit. Why? And in the groin. How do we come there? There's suddenly an organ in the foot or whatever. Why is a gland there? What is a gland? Which are the most commonly affected? Okay, glands in neck, armpit, and groin are most affected. I'm not completely sure where the groin is, but that's the leg. I'm not completely sure it's completely inner side, but there's somewhere at the leg. Okay, inflammation of any glands. Now, let's try to do that as a little video. Can we say that very shortly what is adenitis? Adenitis. Adenitis is the inflammation of any glands, and most of the times it are the lymphoid glands, then especially and most of the times the lymphoid glands of the neck, the armpits, and the groin. Or the way, the lymphoid glands of the neck, armpit, and groin are commonly affected. Let's make that video. We're going to say that is from the book, An A to Z Guide to Everyday Ailments, Their Symptoms, Causes, and Treatment. Readers Digest, Family Medical Advisor. Now, can we name an author? Was designed by the Reader's Digest Association Limited, London. First edition, 1983. Reprinted, 1986. It's still 1983. No, we don't know who has written it. Editor, Keith Hodgkin. Revised editor, Dr. James Cox. Editorial contributors. There are now around 20 named.
artists, advisors, are also 20 more. So it seems to be Keith Hodgkin. Okay, then we could say, based on Keith Hodgkin and A to Z Guide to Everyday Ailments, Symptoms, Cause and Treatment, we could do that, or we could do Reader's Digest Family Medical Advisor, or we could do Family Medical Advisor. According to Keith Hodgkin's Family Medical Advisor, or we could say, to make it a bit more clear, that it is a bit broad, an A to Z Guide to Everyday Ailments, Symptoms, Causes and Treatment. I want to do another Family Medical Advisor thing. Maybe we're going to do it next time, definitely. But it's according to Keith Hodgkin's Family Medical Advisor. It's also clear that it is not completely scientific material, also not really a complete list what now Adenitis is, but just a little overview. Adenitis. Keith Hodgkin. Keith Hodgkin, Family Medical Advisor. Okay, I have a second camera. I'm going to start it now. And I try to say now shortly what adenitis is. Just that we have a little video which we can watch in 10 seconds. Wherever it is shortly said. But it's inflammation of any gland, and most commonly affected are the one in armpit, neck, and groin. Keith Hodgkin. I don't know how it's pronounced, but I think it's Hodgkin disease. So, it must be Hodgkin. Adenitis is inflammation of any gland. Most commonly it are the glands in, we say the glands or lymphoid glands directly to it. Let's say the lymph glands to it. Lymph glands. Lymph glands, where's the difference? Lymphoid tissue, lymph glands? Lymph glands. Adenitis is inflammation of any gland. Most commonly it are the lymph glands of the armpits, the neck and the groin. That is according to Keith Hodgkin's Family Medical Advisor, page 63. No, that was the medical part. I'm going to stop for a second, camera. And if you were here for medicine, or medical, whatever, you can go directly to the next part. We will do now the Neckstretching. You can participate in the Neckstretching when it's ready. And we're starting with a hydro trouble. Legs shoulder wide apart, we're breathing in the arms up. Reach high with fingertips and out again. Breathing in and reach high with the fingertips and out again down. Now doing the next exercise. Reach high in front of the fingertips, reach high up, reach all the time. And reach not only to the side but also backwards, reach far away. Reach down with the fingertips, reach in front, again up. And reach back with the fingertips, the arms also back, and reach down. And now I just want to do it once for both sides. The feet are standing together, arms up to a T, and we're doing some types of aids again, but it's for both sides. Now we have done it once, and now we're going to do it for police officer. Feet are standing together, we're breathing in and out to the arms up. And breathe out, open the arms to the side. Breathing in the arms up. And out, open the arms to the other side. Breathing in the arms up. And out and down. Next exercise. Legs shoulder before apart. Breathe in. Fall up. And breathe out and look to one side. Breathe in. And out, bring the chin down to the clavicle. Breathing in. And out, lift the gaze and the head over to the other side. Breathing in. And out, bring the chin down to the clavicle. Breathing in. And out, lift the gaze and turn it again over to one side. Now breathe in.
And breathe halfway out, and then make a circle over to the other side. Breathe again in. And breathe halfway out, and make a circle back to the other side. Bring the head back in. Now we're doing the casio. The feet are sitting together. We intertwine the fingers behind the back. We're breathing in. We're tall up with the shoulders bit back. Breathe in. And breathe out, bring the head over to one side. And the chin down to the clavicle. Now breathe again in. And out and reach with the hands down to the floor. Breathe again and lift the gaze. And out and turn the head over to the other side. Breathe again in. Out, bring the chin down to the clavicle. And pull the hands down to the ground. Breathe again in, lift the gaze. And back into the middle. And now stretch your Venus. The hands are short of the wide part. Intertwine the fingers behind. Back again. Bring them over to one side. Tall up, shoulders a bit back. Breathe in. And out, turn the head over to the side where the hands are. And the chin down to the clavicle. Breathe again in. And out, pull the arm in and the shoulder down. Breathe again and lift the gaze. And turn the head over to the other side. Turn also the hands over to the other side. Bring the chin down to the clavicle. Breathe again in. And out, pull the arm in and the shoulder down. Breathe and lift the gaze. And turn the head back into the middle. And we're doing the sky hugger. The feet are standing together. Breathe and lift the arms up. And breathe out, lean back. Up the chest to the sky. Breathe again and lift the arms. And breathe out and lean back. And legs up. And out and down. And we're ending with the cactus connecting its stings. Breathe and lift the arms up. Close the hands and lower the hands down to heart center. That was the Neckstretching. I thank you very much and next time. Hi and welcome. I'm trying to learn medicine. Today, arterial thrombosis. And after we've done that, we're gonna do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And we're talking about medicine and internal anatomy and the blood system. And this is no medical advice, we're just learning. Arterial thrombosis, that is clotting of blood, clotting of blood in a short segment of an artery which completely obstructs the normal flow of the blood. Heart, brain and leg arteries are the most commonly affected, but any artery can be involved. See coronary thrombosis. Now I have a little question to it. Or is it just that by the leg, leg, heart and brain, that it becomes obvious that an artery is obstructed? Because wouldn't it be strange if these few arteries would be the ones mostly affected? I would just want to say there's a correlance between these three regions named and the three regions which are the most severe if it happens, and the easiest one to see that it happens. So arterial thrombosis, that is clotting of blood in a segment of an artery, and oftentimes or commonly it is heart, brain and leg arteries. So brachial artery, femoral artery, and I have to get the other one. The coronary thrombosis can be also looked at. So for arterial thrombosis of a leg, see intermittent claudication. That is the pain in the calves, and that comes after exercises. Symptoms of arterial thrombosis: sudden onset of pain, usually in a limb when at rest. So arterial thrombosis has usually starting of pain in a limb when resting. The affected limb is colder and paler than the other. Causes: usual apheroma. This is a degenerative condition which begins in early adult life and causes increasing symptoms with age. We didn't have apheroma before now, so I don't know what it is. Okay, the symptoms are pain in a limb when resting, And the causes is oftentimes or usually ephesioma, which is a degenerative condition, so it gets more and more basically. The things are getting worse basically, and it starts in early adult life. Treatment in the home, none. Consult the doctor at once. So we're saying if there's pain in a limb, then resting, and if the limb is colder and paler, then consult the doctor. What the doctor might do: arrange urgent admission to a surgical unit which can investigate the possibility of arterial grafting. Arterial grafting. I don't know what it is. Arterial grafting. Prevention. Do not smoke. Do not overeat and avoid being overweight. We have to pay a little attention if they always, when they talking about prevention, if they only name the things which make it worse, or if they also sometimes name the things which would make it better. Because if it is about overweight and eating and smoking, very often these things can be beneficiary to do exercise or something like that. So oftentimes, if the causes of, if it can be prevented or made less severe through not smoking, not overeating, not being overweight, then there are oftentimes also things which can improve it. Outlook. Atrial grafting. Now, is it now atrial thrombosis or atrial grafting? Atrial grafting has considerably improved the outlook for localized atrial thrombosis. Okay, atrial grafting, that seems to be the treatment done in the hospital. And this atrial grafting has considerably improved the outlook for a localized atrial thrombosis. But if the whole artery is narrowed and diseased, surgery may be impossible or of limited value. The life of the limb will be in danger and amputation may then be necessary. Okay, I want to add again that the book is 40 years old and I haven't heard of that recently. Whatever, it's serious and it's not good. Okay, what did I say? Atrial grafting has considerably improved the outlook for localized atrial thrombosis. But if the whole artery is narrowed and diseased, surgery may be impossible or of limited value. The life of a limb will be in danger and amputation may then be necessary. Okay, it is pain in the limb when it's resting, and that limb is then also oftentimes colder and paler. Consult a doctor, and they are looking if maybe artificial arterial grafting is possible or something like that. And maybe that can help, but if it's completely closed, then maybe even amputation is necessary. But again, I don't know. In the last 40 years, many things have improved in treatment. And it is clotting of blood in the segment of an artery. And when it gets obstructed and blood cannot flow anymore, and to prevent it, they advise not to smoke and not to eat too much and not to be overweight. That was the medical part. If you're here for medicine, you can go directly to the next video. We will do now the short impingement training. If you participate in the short impingement training, that's at your own risk. Go to stable stand, and we're doing forward shoulder circuits with our back, up, and front, and down. And backwards. And now, long arms, strong fists, and go as far back as you can with the shoulders. Higher, and front, and down, and back, up, front, and down, and not backwards. Up, back, down, front, up, and down. Now we'll lift up. Go to stable stance, long arms, bring the shoulders back, and together, and now turn the arms to the inside. Now the arms to the outside, shoulders still down. And now the arms again to the inside, shoulders down and together. And the arms to the outside, shoulders down, together. And release. It's jugular vein. That is with leading blood away. Okay, next exercise, we're having the arms at the side. Bring them a bit to the front. And now, the arms in front. And the shoulders down and together. Now the arms back. Shoulders up and the front. And the arms in front. Shoulders down and together. And again the arms back, shoulders up. And release. Now lift the arms up. And shoulders up. And release it all down. Again the arms up. Shoulders up. And all down. Again the arms up. Shoulders up, and go down. Now we press the core, arms together, bring them down to the outside, just to relax a bit, and also to observe what the scapula are doing. If they are moving properly and forming a perfect circuit for the humerus. And the arms together. And now, the sundial. Long amount, and let the sock or the ball or whatever fall down and try to catch it again. And now on the other side. And just stretching. One arm in front, the shoulder is back, it's down. Pull the arm in, have flat fingers, try to relax the arm. Go it back with the shoulder. Turn the palm to the sky. Change. The other arm in front. Shoulder is back. Down. Pull the arm in. Have flat fingers. Try to relax the arm. Go it back with the shoulder. Turn the palm up to the sky. But also shoulder bench training. I think I have much energy next time. Hi and welcome. I'm trying to learn medicine today. Arthritis. And after we've done it, we go to wrist training. And if you participated in wrist training, then it's at your own risk. And we're talking about disease and also internal anatomy and the blood system. And this is no medical advice. We're just learning. And okay, and now it's arthritis, not arthritis. Arthritis is the next thing here listed. That is inflammation of the joints. We're having here now arthritis. Arthritis, A-R-T-E-R-I-T-I-S. Arthritis. That is an uncommon illness in which an artery or arteries is inflamed. Okay, but arthritis where an artery is inflamed. By arthritis, a general term for inflammation of a joint. So arthritis, inflammation of joint. Arthritis, inflammation of an artery. Arthritis may occur in small arteries, such as in the fingers, or larger arteries, such as the temporal artery on the side of the head. The temporal artery on the side of the head. Symptoms: pain in the region of the artery. An artery near the surface of the body will be tender. Duration: the symptoms are usually relieved quickly with proper treatment, but treatment may need to be continued for months or even longer to maintain relief. It is a pain in the region of the artery, and the artery can be felt from the surface as tender. And with treatment, the symptoms go away quite quick, quite fast, but it can be necessary to do the treatment over a longer time. Causes, usually it is unknown what caused it, and sometimes arthritis is associated with other diseases, for example, rheumatoid arthritis. Okay, there's a difference between arthritis and rheumatoid arthritis. We're going to come to that later. Complications, if untreated, the artery may become thrombosed. Why? Because it is inflamed. An uncommon illness in which an artery is inflamed, arthritis. It is inflamed, and then it can make a thrombose, and then it's thrombosed. When to consult the doctor, if there is pain with tenderness in a particular area that persists for longer than 12 hours and has no obvious cause. Okay, if there's any pain for longer than 12 hours, you should consult the doctor. And what the doctor might do, look for underlying cause of inflammation and treat with anti-inflammatory drugs. Okay, we're going to look what might cause inflammation, and then there are drugs which can help against the inflammation. Outlook, with treatment, the outlook for arthritis is good. Okay, that was arthritis. Arthritis seems to be not so common. That is an inflation of an artery. It can be at the fingers or also at the head with larger arteries. And it is pain with tenderness at this region. And the symptoms are under treatment quite fast away, but it can be necessary to make the treatment a bit longer. The causes are unknown, but it can be through rheumatoid arthritis. If it's untreated, it can result in thrombosis, which is seriously. And the doctors would be consulted if there's pain somewhere and tenderness for a few hours. And there are drugs against it, and if it is treated, the outlook is good. Now that was the medical part. If you are here for medicine, you can go directly to the next part. Now, if you're here for wrist training, then you can stay and you can participate in this wrist training, but if you participate in wrist training, then it's at your own risk. Go to step stance, arms next to us, and we're doing the spotlight, fists down and up. Again down and up. And now, flashlight, fists, and then to the inside and to the outside. And we're doing 3 rules. The first one is that we are stopping immediately as soon as there's pain. The second rule is that we're going only as far as we can go with a little bit of effort. And the third rule is that we're not overdoing it. We just want to strengthen, not to exhaust. We want to take a break, do it at any moment. Next exercise, the magician. Flat hands, bring them to the inside and to the outside. We have quite a lot of exercises. If you like to skip one, you can do it. And the next exercise, the pancake flipper. Flat hands and bring them up. Close again. And now the quadrangular cast. No, first the T-Rex in the morning. Flat hands out and bring them up and down. And up. And now we're doing the curve in the morning. If you like to skip this exercise, you can do it. Fist next to us, we bring your fist down into flexion and press a bit against it. Pull a bit from the outside. Press a bit from the top. From the bottom. And now to the other side. Hand from the fist, bring it down into flexion. Press a bit against it. It's arthritis because arthritis because it's arthritis. Arthritis. Why is this arthritis? The inflammation of the joint. So we have to find it out. Because it can be quite helpful to not just, maybe it's in everybody. Next exercise we're doing version with a castle. I take both hands out of the fist and bring them to the inside. And up to the outside. And down. And the other way around, down. To the outside. Up. And the next exercise, let's do the T-Rex in picture. If you do it without a tennis ball, then just make a strong fist. With a tennis ball, press with moderate force on the tennis ball and release. And press again. Release. And press again. And switch. And press. And release. Press. Release. Press again. And release. And now we're going to do a cautious big bend. Place the fingertips of one hand on top of the fingernails of the other hand. Press it and up slowly. Close again slowly. Switch. And now we're doing the frog testing the water temperature. You can skip this exercise again. Hands next to us and we're bringing them down with flat fingers. And then again up with strong fists. Again down, flat fingers. And again up, strong fists. Again down, flat fingers. And up, strong fists. And last time, down. And now, the field days is no symphysis director. Fists, and open, and close. And now, the basket bridge. Flat hands and bend the middle knuckles. Hold it and open again. Again, bend the middle knuckles. And up again. And last time. Next exercise. Take both arms in, strong fists into flexion. Now out, extension, flat fingers. Again in, strong fists, flexion. Out, extension, flat fingers. Again in, strong fists, flexion. And out, extension, flat fingers. Again in. And the last time out. Now the ice X. Flat hand. Bend it into knuckles and press on all four fingers. And release. And the other hand. Bend it and press on all four fingers. Now we claw. Flat hands, and make claws. Hold it, and release. And again, claws, and open. Again, claws, open, and last time claws, and open. And last exercise, the unfolded rocket boosters. Long arms with strong fists, and bring these fists into flexion. Now into extension with flat fingers. Again to the inside, flexion, strong fist, and out, extension, flat fingers. Again inside, strong fists, flexion, and outside, extension, flat fingers. And the last round, inside, strong fists, flexion, and outside, flex. extension, and an ending flexion. And now we're going with moderate force of the middle part of the lower arm. To relax the extensor digitorum muscle of the clavicle. On the outside. And that was the Wristtraining. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, adhesion. After we've done that, we're gonna do selected yoga exercises. And if you participate in the selected yoga exercises, then it's better with your arms. And we're talking about diseases here. And this is now medical advice. We're just going. Adhesion. That is fibrous tissue that joins together two normally unconnected surfaces within the body. Okay, it's just tissue out of fibers, so it's fibrous tissue. And it joins when two tissues together, two things in the human body, which shouldn't be connected, and they are not together. It can be caused by inflammation of the affected area or by abnormal healing of a wound, ulcer or surgical cut. Okay, by abnormal healing of a bone can it happen? It can happen by an ulcer, so a wound which does not heal, and after a surgical cut. Okay, we had here the aortic incompetence, was it, I think? That is, the aortic valve lies at the exit of the main pumping chamber and should close after each heartbeat, preventing the black flow of blood into the heart. When diseased, the valve becomes thickened and does not close adequately. Blood leaks backwards and causes pressure in the heart. As well as being incompetent, the valve may be narrowed, stenosis. Okay. Disease of the heart valve. The aortic valve, which consists of three cusps, normally opens with each heartbeat to let the blood flow forward to the body. When diseased, the cusps become thick, hard, and often fused. The opening is stenosed and obstructs the forward flow of blood, especially to the brain and coronary arteries. As well as being narrowed, the valve may be incompetent. Now, I don't know if now by this aortic incompetence or by the other thing, and aortic stenosis, that happens adhesion, but I just wanted to note that there's something similar. So adhesion, that is the two tissues which shouldn't be together, or two things together, get connected through an inflammation, an ulcer, and a normal healing wound, a surgical cut. Two unconnected surfaces, two normally unconnected surfaces. I get things connected together through fibrous tissue, which is then called adhesion. Now, if you're here for medical medicine, when you're going directly to the next part, we will do another selected yoga exercise. If you participate in selected yoga exercises, then it's with we're breathing in the arms up, we're doing vegan swings. And we hold the arms down. Again, in the arms up. Hold the arms down. Breathe in the arms up. And hold the arms down. And now the police officer. Breathe in the arms up. And breathe out and open the arms to the side. Breathe in the arms up. And breathe out and open the arms to the other side. Breathe in the arms up. Make an inch space between the feet. And breathe out and open the arms to one side. Breathe in the arms up. And breathe out and sink down into half chair. The hide and seek playing palm tree. Breathe in again up. And out open to the other side. Again into the middle. Out and down into half chair. Again in and up. And out the arms down. Now we're going to do the crab in the morning. Legs shoulder wide apart. Breathe in the arms up. Breathe out the arms down. Draw the shoulder blades together. Look up. Again in the arms up. And out, draw the shoulder blades together, open the chest and the sky, lean back. Again in the arms up. And out and down. And we're doing the fern wind, reed and wind. Feet are sitting together, breathe in the arms up. And breathe out, lean back with crossed hands for fern wind. Again into the middle. And breathe out, lean again back. Breathe in into the middle. And out, we're going over to the fern wind. Now we're leaning to the side. Breathe in into the middle. And out, lean over to the other side. Breathe in into the middle. And we're doing the mark. Breathe out and lean back and draw the shoulder blades together. Breathe in, now cross the arms and just point the fingers and reach high. And breathe out and reach in front. Breathe in, lift the arms up. And breathe out the arms back, draw the shoulder blades together. Breathe in, now cross the arms again, reach high, breathe in. Breathe out, reach in front all the way. Again, in the arms up. And out the arms down. Now we're doing the standing cat and cow. Have an inch space between the toes, between the feet. Lean onto the knees, breathe in. And out, make a belly with the back of the cat. Breathe in into the middle. And breathe out, make a belly with the back of the cow. Breathe in into the middle. And out, heel with the back of the cat. Again in. And out, last time the cow. Breathe in into the middle. And out again, up again, load back, making yourself a liquid shoulder. And now we're doing the screw just fast. Feet are standing together, we're breathing and lifting the arms up, we are crossing the arms, and we're breathing in and we're reaching high. Now relax, and now we cross the arms the other way around, and that's why the fingers, and reach high. And breathe out the arms again down. Now we're doing the warrior. The toes point to the outside, breathe in, lift the arms up. And breathe out, bend the front leg. And lean over to the front leg and look up to the hand. Breathe again in into the middle. And breathe out and lean back. Breathe in, straighten the front leg. And breathe out, sink again down. Back into the warrior. And exit. Now to the other side. Again, the toes point to the outside. Arms up to the T. Breathe in. And out, bend the front knee. Lean over and look up to the hand. Breathe again in. Out, back into the warrior. And lean back. Look up. Breathe again in. Straighten the front leg. And breathe out. Bend again down. Up into the warrior. And exit. Next exercise. Now we're doing the chair. Not yet. One in the middle. An inch space between the toes. Breathe in, lift the arms up. And breathe out, open the arms to one side. Again in, the arms up. And now out, the arms over the sides down. We're going into the chair. Breathe in, come halfway up. Higher up. And out again up. Breathe in, reach high. Breathe out, open the arms to the side. Breathe in, lift the arms up. And out the arms over the sides down into the chair. Breathe in, come halfway up. High up and out and up. And the hands down. Now we're doing the triangle. Feet like that. We're breathing in, lifting the arms up to a T. And breathe out and shift just with the upper part of the body over to one side. And go down. Breathe it in. And breathe out, if you like, you can do the reverse triangle. Breathe in, back into the normal triangle. Breathe out into the middle. Change the position of the feet. And go over to one side. And bend over. Look up. Breathe again in. If you like, you can do the reverse triangle. Breathe in, again down. Up, whatever. And back into the middle. And end. Now the chair. The feet are standing almost together, have an inch space between the toes, breathe in, lift the arms up. And come up on the toes and breathe out. And sink down into the full chair. Breathe in, come up again. And breathe out, come down again. Breathe in, come up again. And out the arms down and the heels down. Now the feet standing together and we're doing the down diving dolphin. Breathe in, let the arms up. And out, the arms over sides down and head down. Now the moment. Breathe in and bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Breathe in and change. Out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Breathe in, both legs straight. And out, just hang down. Breathe in, lift the right hand up to the sky, bend the left knee, look over the right shoulder to the right hand, hang wave. Breathe in, bring the hand again down. And breathe out and the hand down, leg straight. Breathe in, lift the left hand up to the sky. And breathe out, bend the right knee, look over the left shoulder to the left hand. Breathe in, the hand again down. And breathe out, both hands down and hang down, both legs straight. You're doing the pelican. Make a hand of space between the feet, shift the weight to the heels, and breathe in and go down. And out and come up again. Again, in and down. And out and up. And the last time in and down. And out and up. Now we're doing the Haemorrhage counterweight. Take out on the elbows and gently rock from side to side. And then close both feet again. Breathe in, come halfway up, straight back into monkey half lift. Breathe out again down. Again halfway up. And out and down. And breathe in, we're doing the up diving swan, arms up. And again down. Now we're doing the sun god, legs wide apart. Breathe in, lift the arms up. Lift out and go down. Come with one foot to the tiptoe. And with the other one. And now pretend to push something heavy up. And breathe out again down. And breathe in, pretend to push something heavy up. And out and down. And again in and up. And out and down. Now we're doing modified garden pose. We toss up to the outside, have an alternate space between the heels. Breathe in, lift the arms up. And breathe out, and we're sinking down and placing the elbows against the inside of the knees. Breathe in, straighten up. And breathe in, come with the crown of the head first up, tuck the pelvis in and come up in one straight line. Breathe out, and breathe again in, the arms up. And out, we're sinking again down. Elbows against the inside of the knees. Breathe in, straighten up. And breathe out, tuck the pelvis in and come with the crown of the head first up. One more round, breathe in, and out and down, elbows against the inside of the knees, breathe in, straighten up. And out, come up in one straight line with the crown of the head first, and again down with your arms. Now we're going to do the cashew. Have the feet standing together, and twine the fingers behind the back, breathe in, straighten up, roll the shoulders back. And breathe out, bring the head over to one side, tall up, and the chin onto the clavicle. Breathe again in. And out, pull the hands down to the floor. Breathe and lift the gaze. And turn the head over to the other side. And the chin onto the clavicle. Breathe again in. And out and pull the chin down to the floor. The hands down to the floor. Breathe and lift the gaze. Turn the head back into the middle. Now we're doing the dive, which one can go onto the back, legs wide apart, and breathe in, the arms up to the side. And breathe out, bend forward with a straight back. Now make the round back. And this can go onto the back, come with the crown of the head first up again. And the arms again. And another time the arms up. And bend forward. Make a round back, hang down. Now come with the crown of the head first up. And down. Now we're going to do stalk. Leg up, take the knee from the outside, make one hand back, and look back to this hand. If you like, you can do the ambitious stalk, take the outside of the foot, straighten the front leg, one hand back, try to look back, and bring the leg again in, gently to the other side. Knee up, take the knee from the outside, one hand back and look back. If you like, you can take the outside of the foot, straighten the leg, one hand back, and try to look back. And down. And we're doing the stretch, not the stretch of fingers now. Feet are standing together, breathe in, lift the arms up. And breathe out the sky, hug open the arms wide to the sky. Again in the arms up. And out, again open the arms wide to the sky. in and out down with the arms. Now with the legs standing shoulder wide apart, we're doing a stretch of Venus, intertwine the fingers behind the back, bring them out to one side, breathe in, turn up. And breathe out, head over to one side, and the chin down to the clavicle. Breathe in. And out, pull the arm in, the shoulder down. Breathe in, lift the gaze. And out, turn head over to the other side, also the hands now over to the side where the head is looking. Bring the chin down to the clavicle, breathe again in. And out, pull the arm in and the shoulder down. Breathe and lift the gaze. Turn it back into the middle. And we are ending with the cactus connecting its things in the evening. Bring in, lift the arms up. Bring the hands to touch and lower the hands down to heart center. A bit rapid end, but that was the yoga exercise. I think you very much ended the next time. Hi and welcome. I'm trying to learn medicine. Today asthma, and after we've done it, we're going to do stretching. And if you participate in the stretching, then it's at your own risk. And this is no medical advice, we're just learning about it. And this is about internal anatomy and also an illness. Asthma. Asthma is a word which often conjures up a frightening picture of patients fighting desperately to get their breath. So it is understandable that many parents may be apprehensive when we hear the child wheeze. Okay, wheeze seems to be a sound, I don't know exactly. But wheezy breathing is common in young children and usually does not indicate that true asthma is present or will develop later. Asthma occurs when the small bronchial passages in the lungs become swollen with inflammation, partially obstructed by phlegm, or narrowed when the muscles surrounding the air tubes become tight, bronchospasm. Okay, and that causes the characteristic wheezing sound. Okay, let's do it again. Okay, the small bronchial passages. And the lungs, there seems to be a place where the air passes through, and these seem to be the bronchial passages. And they are becoming swollen because they are inflamed, or because they are obstructed by phlegm, so substance in between them, or they became narrowed because the muscles are doing spasms, bronchospasm. Okay, they are either swollen through inflammation, obstructed through a substance, phlegm, or narrowed because the muscles are tightening around them. And that causes the wheezing sound. And that is when asthma. Some babies go through their first year of life with noisy, sometimes wheezy, breathing which is normal for them. As they grow, the small air tubes enlarge and the wheezy breathing disappears. So again, take this not as a medical advice, but they're saying here that some babies can have it in the first year. I would add here now, see a doctor if you're unsure. Asthma tends to run in families, and again here this book is 40 years old, so maybe things are outdated. Asthma tends to run in families, and in one form it is associated with the inflammation of the skin, eczema. Okay, first of all, there's some type of inflammation of the skin, eczema because we're learning medical about all diseases, eczema, and that might have also something to do with asthma. Asthma may appear for the first time in childhood or in adolescence. I still don't really know what adolescence means. People use it, but they don't say what it is. Certainly don't really define it. Adolescence, I think it's a teenage years more or less, but it's if you don't look it up, you don't find it out. And I'm not going to look it up. Adolescence, often as an extension of hay fever. Okay, it can come through the childhood, that can happen the first time, and then also during adolescence as an extension of hay fever. It can also appear out of the blue later in life, the so-called late onset asthma, which can be much more disabling than other forms and is often associated with recurring chest infections. People can develop late on asthma, or at least can they appear. It is then associated with, oftentimes with chest infections. Does that mean that there can come a chest infection? Does sound to me like a virus or whatever. Does that mean that a virus can cause later on asthma? Or is it chest infection something else or something else? A true asthma is a respiratory problem, but the symptoms may be confused with cardiac asthma, which occurs at night in older patients with serious heart disease. Okay, or some people, most of the times older people, they can have heart diseases,
And these symptoms of these heart diseases can then be a little like asthma. Asthmatic bronchitis, sometimes called chronic obstructive airway disease, COAD, may develop after recurrent attacks of bronchitis. Okay, asthma bronchitis exists, or asthmatic bronchitis. It's also sometimes called chronic obstructive airway disease, COAD, chronic obstructive airway disease. Asthmatic bronchitis or asthma bronchitis, and that can develop after recurrent attacks of bronchitis. But bronchitis is something which can come after infections, I think. That means infections can cause it. Symptoms: cawing, wheezing, and difficulty in breathing. The main difficulty, okay, that is a bit too much, but we're going to read the next time on. So we're making two parts here. That was no asthma. We had now basically that it can be inflammation when the airways are swollen. They can be obstructed by phlegm, or they can be narrowed. That is bronchospasm. Some babies in the first year can have a similar wheezing sound, which is then not asthma sometimes. And it can also set later on in life. It can be confused with other serious heart diseases, or it can be developed after recurrent bronchitis. No, bronchitis. And it has maybe also something to do with eczema, and it runs a bit in the family. Now, in the next part, we will continue with asthma, the symptoms, and so on. If you were here for medicine and asthma, go directly to the next part of the video. Next part, we will do now the stretching. If you participate in the stretching, then it's better than risk. We are bringing one leg up, and we're doing the mushroom, just point the foot down. And take the other leg up, and point the foot down. Now the legs wide apart, and breathing in again slowly down, and out and up, and breathe out. Breathe again in, out, in, out, again in, and out. Now breathe in and cross the legs, and out. Now legs a bit more than shoulder width wide apart. Breathe in, lift the arms up. And breathe out, we're going over to one side. Breathe in and out, rib cage. And breathe out back into the middle. Breathe in. And out and go out to the other side. Breathe in and out, rib cage. And breathe out into the middle, let the arms down. Next exercise, now one sees your arc-optra. You're breathing in. And breathe out, and one hand slides down the leg, and the upper shoulder stays down. And breathe again in. And out, and we're taking one arm over. Now breathe in and out, rib cage. And breathe out back into the middle. Breathe again in. Out, one hand slides on the leg, breathing in. Out, we're taking one arm over. Breathe in and out, rib cage. And breathe out back into the middle. Now the legs are standing together. No, legs standing together. You're breathing in, lifting the arms up, the aortic aortic airplane. And breathe out, lift one hand down. And breathe in and stretch to both directions. And breathe out. Again in. And out, the other arm comes down. Breathe in and reach. And breathe out, one hand up. And out and hands down. Now we're doing the Niagara Falls. Legs are standing wide apart, breathing in. And we're breathing out and we're hanging down. We only have to come deeper down by breathing deep in through the chest into the nose. And we're breathing out through the mouth. Again in. And out.
And again in. And out we go over to one leg. Relief again in. And out. And again in. And out we go over to the other leg. Relief again in. And out. And again in. Out into the middle. And we're closing the feet. We're doing the salto angelo. Just keep hanging down. Breathe again in. And out. And again in. And out. Again in. And out we're coming slowly the round back up and making it top a bit. Shoulder roll. Now we're doing more shoulder rolls. Go to stay within. And we're doing backward shoulder rolls. Back, down, shoulders, front, up, back, and down, and again. And the last time. And now, forward, back, up, front, down. One last time. Now we're moving in the three shoulders up. And breathe out, let your foot down. Again in. And out, let your shoulders fall down. And in the arms up. Shoulders. Out, let your foot down. And we're doing the other plucker. Breathe in, lift the arms up. And reach always with one arm high. Pretend to take an apple. Hanging high on an apple branch. To turn it a bit around and then to harvest it. And the last two. And now we're doing the shifter. Arms up to a T and breathe in. And out, going over to one side. Breathe again in. And out over to the other side. Breathe again in. Out again over to the first side. Again in. And out over to the first side, second side. Again in. And out, we are leaning onto the knees. And now in. And out. Bring one shoulder in front, the buffalo fighting its hangover. Breathe in the shoulder back. And out, shoulder in front. Breathe in the shoulder back. Out the shoulder in front. Breathe in the shoulder back. And out the last time the shoulder in front. Breathe in. And out, and we're hanging again down. And this time we're breathing just in. And out, and you're coming slowly upwards, round back, making at the top again, and shoulder roll backwards. Now the garden pose. The torso pointing to the outside, having an unenhanced space between the heels. We're breathing in, lifting the arms up. And breathe out, and we're sinking down, and we're placing the elbows against the inside of the knees. Now breathe in, straighten up the back. And breathe out, and we're coming with the back up. Breathe it in. And out, we're coming down again. Breathe in, straighten the back up. And out another time with the back up. Breathe again. And out, we're going down. Breathe in, straight back up. And breathe out, we're coming slowly up in one straight line. And bring the arms down. And we're ending the legs wide apart. We're breathing in. And slowly down. We're breathing out. Again in. Out. And again in. Last round. Out. Again in. Out. Now we're in. Close the legs.
and again out. And that was the stretching. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today asthma, and afterwards I'm going to do a bit standing yoga. And if you participate in the standing yoga, then it's at your own risk. And this is part 2 already of asthma here. And this is no medical advice. We're just learning about a lot of diseases. And we're talking a bit about internal anatomy and an illness. Now, what we already had, that asthma is, now it can be in the first year this wheezing sound because of now a bad reason or another reason by young children in the first year, and it doesn't have to be asthma. Asthma can come also as late onset. By older people, that can be confused with other chronic heart disease or with other heart diseases, and it can also come after infections after multiple bronchitis. Most of the times, it seems to come during adolescence. Some also didn't, I think. Or in asthma may appear first in the first time in childhood or in adolescence, often after an extension of hay fever. And it runs also a little bit in the family, and it has maybe also something to do or associated with an inflammation of the skin, eczema. And I think those were the most things which we had. Now, but that book is 40 years old, so maybe something's a bit outdated. Now, symptoms. Cawing, wheezing, and difficulty in breathing. The main difficulty in wheeze is related to breathing out and not in. Okay, the main wheeze is hearable when the people breathe out and not when they breathe in. And wheezing is some sort of sound. I don't know exactly, but I think it's a bit like paper. I don't know it. I don't know. Cawing. Okay, next thing. In children, persistent cawing at night may be the only symptom. I think that's interesting. Why is it cawing, especially at night, as the only symptom? Is it not about breathing difficulties? Why does it result when cawing at night? Okay, fast pulse, more than 90 beats per minute, and drawing in of the lower ribs on breathing in. This is especially obvious in babies and young children. Drawing in of the lower ribs on breathing in. Okay, and the lower ribs are drawn in by breathing in. Okay, the symptoms. Cawing, wheezing when breathing out, and also difficulty in breathing. Higher pulse with 90 than usual. Cawing at night by children, and drawing in of the lower ribs when breathing. Why? Because that opens the airways bigger, and that helps to, because of the 3 causes here, the main cause inflammation. When they are swollen because of inflammation, they are narrowed because of, something said? They are narrowed because the muscles can spasm, bronchospasm, or they can be obstructed by phlegm. Is it just helping, or this is I'm a bit wondering, is it just helping to open the chest more and breathe more into the chest, or has it something to do with was it the diaphragm? What was the name of it? Whatever, the diaphragm, I think was it? That it can work better? Is it because it's just working there, just with the pulse of 90? I think that's interesting. But the most interesting thing is the cawing at night. Why cawing at night? By asthma. Must it not technically be within the littlest? The least? Because there's resting. Why should there be a problem with breathing? Why cawing then? Now, you notice maybe we are not just here. We're not just here for asthma, learning about asthma. We're learning broadly about all types of diseases and medicine, and also biology and all. Why cawing? What if some things work not so good at night? There are people who have maybe it's other people. There have people that they stop a little bit breathing, and then they wake up again because they have stopped a little bit. But it seems to be something different here. I think it's very interesting. Maybe it's just because I don't know the reason, but causes. Respiratory infection may cause inflammation of the tubes. Allergy to certain substances ranging from the house dust, mite to animal, fur or feathers and pollens or foods. Now I want to say at that point, I think I heard that there are different types of asthma. Now they say that also the surrounding things can have a cause. So asthma, they say a bit runs it in the family, that would be genetic. But they also say already that there can be infections, multiple bronchitis, and allergies against the dust or animals or food or pollen. Maybe we should take a closer look at asthma. If asthma is caused by so diverse different things, from genetic to just a pet, then we should go there and take that more, we should split it up, the disease. I think I heard that there are different types of asthma, but it can't be that we have the same disease, people saying they have it, and they have causes ranging from genetic to a pet. It can't be. Nocturnal attacks in children are often associated with house dust mites, down pillows, whatever, some pillows, or pets sleeping in a child's bedroom. Okay, children can have nocturnal attacks of asthma, and they can have something to do with mites, house dust, pillows, pets, and pets. Anxiety or excitement seems to precipitate me. Precipitate. Who did came up with that word, and why do people use that word? Seem to precipitate attacks in some people. That's such a complex word to spell it, to write it. It is long, it is difficult to speak. There are so many easier words. Precipitate attacks in some people. And I don't think people use it all the time, actually. There are so much better words. Let's stop having linguistics and come back to medicine. Anxiety or excitement seems to precipitate attacks in some people. Treatment in the home. Both a child with asthma and the family must learn to adjust to the long-term problems of recurrent asthma. What it is, the pet, the pollen, the house dust, or food allergy. Okay, both a child with asthma. Yeah, that's what I mean. If there are so different causes of asthma, we cannot say that is the treatment or that is how to live with it. If there are completely different causes of it. Both a child with asthma and the family must learn to adjust to the long-term problems of recurrent asthma. A child must be encouraged to lead as full and normal a life as possible, yet at the same time be helped and supported to do this by parents and doctors who understand how modern drugs can be used to prevent and control attacks. Now, by saying here that there are drugs, that there are medication, and also should the child be helped and supported that it can live a life as normal as possible with asthma. When to consult the doctor. Mild and transient wheezy breathing occur for the first time in a child should be reported to the doctor. Yes, if there's wheezing sound heard, then consult the doctor. If the wheezing causes distress, if there is cyanosis, we didn't have that yet, but that is if they're talking mostly about a child if there's not enough air supply. So when the fingers get blue, the hands, I don't know to what extent now, but if there's cyanosis, that is not enough oxygen delivery to the whole body. But basically a lot of parts get blue, fingers and lips and ears. So if there's cyanosis, because that means that there is not enough oxygen delivered to the body, then some parts get blue, the outer extremities, and so that is serious. If there is indrawing of the chest on breathing in, then consult the doctor. Also, if the pulse rate is fast, more than 90 beats per minute. If the wheezing continues for several days, in adults, the doctor should be consulted if any of the above symptoms cause distress or anxiety, or in the event of a sudden severe attack. What the doctor might do: prescribe medicines that can cut short, prevent, or modify sudden attacks and control more prolonged bouts. What it is just the pet, or it's not that easy, but if it is the pet, but if it is a pollen thing, or a pillow thing, or a food allergy? Prescribed medications can be possible, medicines that can cut short, prevent, or modify sudden attacks, control more prolonged bouts. Control any respiratory infection by the use of antibiotics if the cause is bacterial. Okay, that would be bacterial. Okay, whatever. Bacteria. If the doctor suspects that an allergy is responsible, he or she may attempt to identify the substances causing the reaction. If the doctor suspects it. How is it possible? Yes, they can ask, so you have a pet, does it happen then and then? Did it maybe happen if you visited your grandparents, but it happens only there or something like that? But that would be actually interesting. To intentionally go into a hotel for a few days and look at the disappears. Or change completely everything, or whatever, I don't know what's going on.
Now, if a doctor suspects that an allergy is responsible, he or she may attempt to identify the substances causing the reaction. It is sometimes possible in adults to reduce the patient's sensitivity to the substance by a course of injections. Children may develop more than one allergy at a time, and it may be necessary to reduce contact with more than one potential cause. Yes, people can have multiple allergies. And then just to take one thing away might not be the thing, because the second thing causing it. Prevention. Asthma cannot be prevented, but the likelihood of an attack can be reduced by taking certain precautions. Do not smoke. I think we mean now in this place also secondhand smoke. Keep out of dusty, smoky surroundings. Seek prompt attention for coughs and colds. And I want to add here again at the end that this book is 40 years old. Maybe there are in the meantime other things found which can cause it. Now that was the medicine part. If you're here for medicine, then go on to the next part where we will talk only about medicine. We will do now the standing yoga. If you participate in standing yoga, then it's better to on the screen. We're breathing in and lifting the arms up. We're doing eagle swings. And breathe out, lift the arms down. Again, in the arms up. And out the arms down. Again in. And out the arms down. And lift the arms up. And open to the side. Breathe again in the arms up. And out, open to the side. Again, lift the arms up. And out, and lift them down. Now make an in space between the toes. And breathe in, lift the arms up. And breathe out, open to the side. Breathe again into the middle. And breathe out and sink down into half chair. And come up again. And breathe out, open the arms to the side. Breathe again in the arms up. And breathe out and down. Breathe in and up. And out of the arms down. Now the legs together. We're doing Brigitte in the wind. Breathe in, lift the arms up. And breathe out and lean back. Breathe again in into the middle. Breathe out, lean to the side for fur in the wind. Breathe in into the middle. Breathe out over to the other side. Breathe in into the middle. And we're doing the Markor. Breathe out. With your hands down. Draw the shoulder blades together. Breathe in, lift the arms up. I will cross the arms, intertwine the fingers. Reach high, breathe in. And breathe out, reach in front of the back. Breathe in, lift the arms up. And breathe out the arms down. Draw the shoulder blades together up, chest to the sky. Breathe in, about cross the arms. Intertwine the fingers, reach high. And breathe out, reach in front of the back. Breathe in, lift the arms up. And breathe out, we're doing the down hanging dolphin, but they're going down. Now breathe in, let's bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And breathe out and stretch the right leg. Breathe in and change. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. And breathe in. And out and both legs straight. Now we're doing the penguin. Breathe in and lift the right hand up to the sky. Breathe out and bend the left knee and look over the right shoulder to the right hand. And breathe out, the arm and down. Breathe in and lift the left hand up to the sky. And breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in, the arm again down. And out and down. And we're doing the pelican. Make a hand for space between the feet. Shift the weight to the heels. And breathe in and go down. And breathe out, up again. Breathe in again, down. And out and up. Again, in. And out and up. And we don't retrieve this counterweight. Take out of the elbows and gently swing from side to side. And again down and close the feet. And now breathe in, come halfway up. Straight back on the half lift. Breathe out again down. Breathe in halfway up on the half lift. And out and down. Now breathe in, come up. Close the hands and bring the hands down.
And doing the sky hugger, legs shoulder wide apart, breathe in, lift the arms up, breathe out, long arms up to the sky, breathe again in into the middle, breathe out, lift again back, breathe in into the middle, and put the arms down, close the feet, and breathe in, lift the arms up, doing the cactus, connecting the stings. Bring the hands to touch, allow the hands down to heart center. That was Zen Yoga. I thank you very much, and next time. Hi and welcome. I'm trying to learn medicine. Today a Neuroma, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, that is better at your own risk. And we're talking about diseases and internal anatomy and the blood system. And this is no medical advice, so we're just learning. A Neuroma. That is a degeneration of the walls of the arteries. The condition is also known as atherosclerosis and arteriosclerosis. Okay, atheroma. The walls of the arteries are degenerating. I don't know what it really means, but it's not good if they degenerate. Fatty deposits develop on the artery walls, which then harden, producing a condition known as sclerosis. Okay, at the walls of the arteries, their fat seems to be stored or lying around, and that condition is known as sclerosis. Now, once we were talking about sclerosis, maybe sclerosis is something completely different than multiple sclerosis or lateral sclerosis or something else. The other thing, we had the word precipitation somewhere. Anxiety or excitement seems to precipitate attacks in some people to asthma. Now, precipitation is also used, did I remember, in the weather and meteorology to say that is when the snow and the rainfall all combine. The other words, I don't know what it means. Precipitate. Okay, sclerosis. The deposits enlarge into plaques, raised circular areas, which together with the sclerosis lead to narrowing of the artery. Okay, atheroma, the pipe gets smaller because there's a lot of dirt lying around, fatty deposits, and then over time, do they get larger as raised circular areas and they are in plaque. Atrial thrombosis, clotting of the blood, may occur at any site where plaque occurs. Okay, at the places where plaque had occurred, where arterial thrombosis can happen. And that is when a clotting of the blood gets sticky. It gets to one part, it doesn't flow anymore. Atheroma begins in early adult life and increases with age. It affects almost everybody in the West to some degree, and with thrombosis, its chief complication. It is the main cause of heart diseases and strokes. What was known as stroke? The stroke was the thing in the brain. I think. It affects almost everybody, so almost everybody has it to some degree and gets stronger over time. Atheroma causes no symptoms until it reaches the stage when the narrowing of an artery interferes with the circulation of the blood. Okay, there are no symptoms, so people don't notice it, they don't get an early warning, and then it happens. But it interferes with the circulation of the blood. Then any of the following symptoms may occur depending on the part of the body that is affected. Symptoms caused by narrowing of the artery when the heart is affected are chest pain on exertion, which is relieved by rest. That is when angina. So angina can be caused through atheroma, but also for other things. It can also be when the brain is affected, temporal disturbances of balance, vision, speech, and use of arms and legs. And atheroma can disturb the head, but just through the blood supply, not for anything else, I think. No, that's my guess, my open thinking guess. Open forward guess. See transient ischemic attacks and intermittent claudication. And when the legs are affected, then this pain in the calves when walking, which is relieved by rest.
C. Intermittent claudication. Okay, when the heart is affected by the ephysiomas, so fatty deposits at the walls of the heart, and when at these places plaque can form and it gets more and more narrowed, and at these places where the plaque is, when blood clots can form, thrombosis, and the whole thing gets narrower and it doesn't work anymore, and that's a problem. I think what we mean is, let's speculate a little bit. It is not that at some time it's completely closed, but it is that it gets closer and there are no places. Basically, the blood can't flow properly through it, and it gets stuck, and there happens a traffic jam. And always the blood is standing there around, and because it's not moving anymore, it gets firm, it grows roots, and the blood then gets sticky because it doesn't travel anymore. And then one day this sticky mass gets firmer, and then suddenly maybe it rips off, and then that's a thrombus, and that can get stuck. So what I want to say with is that I think so far that ephysioma is not that the artery gets completely closed, but that it gets more and more slower at the place, like a needle. Just I don't know if that saying exists in English. It gets closer and closer, and then, but whatever. It's not so important right now. I think there exist maybe even both versions. Maybe I explained now differently. Okay, but the first one is that if the heart is affected, then there can be angina, chest pain on exertion, which get better by resting. When the brain is affected, then there can be balance, vision, speech, use of arms and legs, problematic. And also when the legs are affected, yes, so that would mean something else. If the legs are affected with intermittent claudication and there gets pain in the calves when walking, then it would be not that there would be a thromb going suddenly on and gets stuck and completely closes something. Then it would be just that actually less blood travels to the legs, because this intermittent claudication just gets worse when you walk and do exercises. So then in that cases, this is not that something rips off or if thrombosis happens, it's just that it's actually narrowed. Whatever. Pretty sure both versions exist. Symptoms caused by blocking of the artery. No. We're having a bit more. That means we're going to make a split here. We're going to continue in the second part. Now, if you are here for medicine, then you can directly to the next part. If you are here for short impingement training and you participate in the short impingement training, then it's better at your own risk. We are doing shoulder circuits. We are going back, up, and front, and down. And again, back, up, and front, and down. And backwards. One more round. And now, long arms, down, yes, long arms, strong fist, and we're going as far back as we can with the shoulders. No higher up, and in front, just down, back, up, and in front, and down, and now backwards. Up, back, down, front, up, back, and down. Now, legs wide apart, we go into the knees, ranging forward with a straight back. Let the arms hang and pinch the shoulders together. Do it with effort. Now make strong fists. Lift the arms up and still pinch the scapulars together. Release. And a second time. Pinch the scapulars together with effort. Making in fists. Lift the arms up and still pinch the scapulars together. And release. And a similar exercise into the knees, hinge forward, fish on back, let the arms hang, make fists, turn the arms to the inside, lift the arms high up and bring the fists together. Straighten up, bring the shoulders down, together. Now the arms high up and together, shoulders down, together.
at the same time. Into the knees, hinge forward with the round back, let the arms hang, like fists to the inside, lift the arms high up, bring them together. Straighten up, shoulders down, together. And now we lifting the arms up. We're not doing anything in particular, just lift the arms up. If this exercise causes pain, then don't do it. Again, the arms up just to relax and also to observe what the scapulars are doing. The scapulars should go back and open up so that the humerus, the bone in the upper arm, can just come up. And now the arms to the side, and again just observe what the scapulars are doing. The scapula should go now back together, and now a bit to the outside of the ribcage. And back together, and into the direction of the outsides of the ribcage. And the last time. And now we're doing the third lifter. Again, long arms, strong fists, shoulders down, head together, and now turn the arms to the inside. Now the arms to the outside, shoulders down, head together. Arms to the inside, shoulders down, head together. And the arms to the outside the last time, shoulders down, head together. And release. Now the arms to the outside, a bit in front. Bring the arms at front, so the pronation, and shoulders down, together. And change. Arms back, shoulders up, and a front. And change. Arms in front, shoulders back, together. And change. Arms back, shoulders up, and in front. And release. Now shrug. Lift again the arms up. Shrug, shoulders up. And release it all down. Again the arms up. Shoulders up. All down. Again the arms up. Shoulders up. And all down. Now press the core, arms together, a bit down and to the outside. Again, just to relax, but also to observe what the scapulars are doing. And the last round. Now with Tiger. You can also use something else. Have it with a long arm at the outside, or let it fall down, and try to catch it again. And on the other side. And now, stretching. I bring one arm in front, shoulders back, and down. Pull the arm in, have flat fingers, try to relax the arm. Go it back with the shoulder, and turn the palm a bit up to the sky. And the arm in front, shoulders back, down, pull the arm in, have flat fingers, try to relax the arm, go it back with the shoulder, turn the palm up to the sky a bit. That was the short attention training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine, today Roma, and after we started we're going to do wrist training, and if you participate in wrist training then it's at your own risk. This is already part 2 to the Roma, and to Roma. And this is no medical advice, we're just learning about it, and we're talking about a disease and internal anatomy and the blood system. Now, apheroma, in short, as much as we understood, that is that fat deposits are getting to the walls of a blood vessels, and then there's also plaque coming. These are more raised circular areas, enlarged deposits, and it all narrows the pipeline, the blood vessel, and less blood can flow. And that can cause at the heart chest pain, angina, and at the brain it can cause also balance and vision and speech impairment, and of arms and leg, worsened movement, and something like transient ischemia also. And when it relaxes, it can make intermittent claudication, pain after walking in the cars. Now, let's read on. Symptoms caused by blocking of the artery. When the heart is affected, sudden onset of severe pains in the chest which persists. Okay, if an artery of the heart is blocked, then there's sudden severe pain. But it can be also here narrowed when it is just chest pain, so both possible. The pain may occur during rest. See coronary thrombosis. Okay, coronary thrombosis is then if there's pain directly at the heart. But it can also be a heart attack that has something to do with it. This is no medical advice, we're just learning about it only. And when the brain is affected, then there can be weakness or loss of use in arms and legs. Okay, whatever, weakness. Speech difficulties and sometimes unconsciousness. See stroke. And when the legs are affected, usually sudden onset of severe pain in the affected limb, which goes cold and turns pale. Okay, sudden severe pain and it goes cold and pale. But that is when arterial thrombosis. Cause of apheroma. The cause is not definitely known. Again, this book is 40 years old. But we know already something. Diet is believed to be largely responsible. When to consult a doctor? If any of the described symptoms occur, if there is doubt about whether exercise to help prevent apheroma can be taken. If there is doubt about whether exercise to help prevent apheroma, I don't get that part. What do I mean? Okay, the first part, if the symptoms are there. So if there's chest pain, if there is the brain affected with balance, vision, speech, use of arms and legs, and also pain in the calves after walking, or sudden pain in the chest of the heart, or also rest, weakness, speech difficulties, unconsciousness, and also pain in the leg and turning of the leg in pale and blue. What the doctor might do? He or she will examine you to discover which artery is causing symptoms and whether it is narrowed or completely blocked. We're going to look at the arteries, if they are narrowed or blocked. Then also the doctor might perform a number of examinations, blood tests and x-rays to assess the severity of apheroma in other arteries. Okay, blood tests and x-rays, and also looking at the other arteries also. Here was written that almost anybody has it, more or less, to some degree. And it starts already in early adult life, and increases with age. Now, why are there then other arteries just affected with it? Because that gives an indicator to what the causes are. But I don't want to talk that long about that part. If an artery is completely blocked, an operation may be necessary to remove the blocked portion and replace it with part of a healthy artery from elsewhere in the body. This book is 40 years old, there are also many other options. But I never thought about it. No, but but the other case, there are healthy arteries oftentimes somewhere else in the body. To the cause again, does anyone develop it, and so on. Arteries other than those treated are likely to be diseased. though they may not yet be causing symptoms. To prevent their condition worsening, the doctor will suggest the general preventive measures which are described below. Okay, oftentimes all arteries are more or less affected, and just general preventive measures are then prescribed. Prescribed. Whatever. He or she may test the blood in order to estimate the level of fats it contains. Is there a way to get rid of it if it's at the walls once it's efferent? Because if it's just about fat there, fatty deposits and plaque stays there for decades, is there a possibility to get rid of it again? Okay, the blood can be tested on the level of fat. Prevention. Stop smoking, they say. This is the most important of all preventive measures. Yes, I want to say again here, this book is written in 1983 and revised in 1986, so during the 80s. The things written always here, it's already noticeable by the prevention are always smoking and drinking to stop. This is true, as far as I know, but this is a bit the focus on what it was in the 80s, but I would just want to say it becomes obvious that these are the things which were then in the 80s seen as the most problematic thing. It is still wrong, it's still a big thing, but it's noticeable that it are the things which were that much talked in the 80s. And I think there are at least new things to it. It's still true, the thing of smoking and drinking. Prevention. Stop smoking. This is the most important of all preventive measures. Yes, because they're saying then about this is the most important thing and so on. This is a bit the worldview of the 80s. But it's still true that it is very, very largely advised to stop the smoke. Exercise regularly throughout life, at least twice a week. Exercise should be strenuous enough to leave you out of breath and quicken your pulse. Again, this is no medical advice, but it's not for everyone to do this now. But if exercise is resumed in middle age after years of inactivity, there should be several months gradual build up to strenuous activity. In any event, you should consult your doctor before undertaking any exercise. Avoid overeating. Part of any excess food that is eaten is deposited as fat in the arteries. Now I have a general question. They said already 2-3 times with overeating. Do they mean overeating in the sense of getting fatty deposits and getting obese and adipositas? More adipose tissue, or do they mean taking hearty meals? Avoid overeating. Part of any excess food that is eaten is deposited as fat in the arteries. A person can be certain of not overeating only if he or she maintains an ideal weight for height and sex. There are also other things. See weight. A person can be certain of not overeating only. So they're saying now with overeating, do they mean to get more adipose tissue as it is advised? So they don't mean hearty meals. Maybe they mean it also at some places. But that is, at one place was said with regurgitation, acid regurgitation, that was said that people should take smaller meals. A person can be certain of not overeating only if they are maintaining ideal body weight for them. Next thing, keep to a good diet by following the recommendations below. Yeah, we know. Outlook. The prospects for those with a specific disorder caused by apheroma, see symptoms, are given in the entry on the disorder. Circulatory system, page 40? Page 81, or whatever we wrote there. Okay, whatever. It is not good, maybe the main symptoms here, with heart effect and brain stroke, and so these were the most severe ones. Heart effect. Okay. Do we go over it now? Do and don'ts about apheroma for the overweight. Do keep a strict record of everything that is... I just want to go fast through it. Do keep a strict record of everything that is eaten and drunk for 7 days. Only water is non-fattening. Do include in your diet reasonable amounts of whole mean bread, 2 to 4 slices a day. Potatoes not cooked in fat, fruit and vegetables. Always eat other foods in moderation. Don't eat sugar, confectionery, puddings, biscuits, cakes, ice cream or other sweet foods. Don't eat foods cooked in fat. Use corn oil or maize oil instead. Don't drink alcohol or sweetened drinks. If you must eat something sweet, try eating a few grapes, raisins or dates, which are all rich in natural sugar. Most people will lose weight on this diet. Those who do not should see the doctor. For those of ideal weight, do, wherever possible, eat meat from animals that have fat-free range. For example, white rabbits, hares, pigeons, fish. I'm wondering a bit what pigeons are. Pigeons, these are these birds in the cities. They're saying people should eat white rabbits, hares, pigeons and fish. I just wanted to read through it and not to go on through it. Do eat plenty of potatoes, wholemeal flour, beans, peas and lentils. These provide the same amount of protein as moderate quantities of meat. Do include some of the following in the diet. Fish, liver, kidney, brain, green vegetables, nuts, berries. What are they writing here? Berries. Don't eat more than modest amounts of meat from chickens, cows, sheep, pigs and other animals. Reared? But man, even the lean meat of these contain a large amount of fat. Now here's a little question in the middle. But if the people stay on their optimal weight, is it then a problem to eat fat? Don't eat foods cooked in fat. Use corn oil or maize oil instead. Don't eat food cooked with white flour. Including white bread. Instead eat whole grain bread, oats, unpolished rice and food cooked with wholemeal flour. I don't know if medicine is a point for doing some funny jokes. No, not really jokes, but some conclusions which will sound a bit over the top. No, anyway, you heard what I said. If you were able to understand what I said. Whatever I said, F-aroma is the thing we're concentrating on. If you were here for medicine, take whatever you want from it. This is not medical advice. We will continue with medicine in the next part. If you were here for medicine, you can go directly to the next part of medicine. We will do now the wrist training in 2 minutes. If you participate in the wrist training, then it's at your own risk. Go to stable stance, arms next to us, hands from the fists, and we're bringing. Are we doing wrist training? Yes, we're doing wrist training. So fists next to us, and we bring the fists down. And again up. And if you participate in this, then it's your own risk. I don't know if it's a point to talk about these things. Arms next to us and we bring them up. There we go. This is a counterfeit money check and doing it actually in the ECO10 training, not in the wrist training, but it's okay. Next exercise. Fists and to be inside. Extra flashlight and to be outside. And now a pancake flipper, flat hands, open them, close them. Quadrangular castle architects, both hands with fists out and we're going to the inside. And up. To the outside. Again down to the outside. Up. Now we're going with moderate pressure over the middle part of the lower arm. And on the outside. it was a short wrist training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, atrial fibrillation. And after we've done it, we're going to do backstretching. And if you participate in the backstretching, then it's better at your own risk. And this is no medical advice, we're just learning about it. And this is about illness and internal anatomy and the blood system. Atrial fibrillation. That is an irregular beating of a heart. The atrium is the chamber of a heart from which rhythmical contractions spread to the rest of the heart. In atrial fibrillation, the contractions lose their rhythm and the heart beats irregularly. Atrial fibrillation may occur in sudden intermittent attacks, but more usually it persists once it has developed. Older people are most affected. Okay, the heart is beating, normally pretty regular. It has a little thing in the middle, but it's more or less like that. An irregular beating of the heart. No, atrial fibrillation is the problem. And there the atrium, these are the two chambers at the top. The atrium is the chamber of the heart from which rhythmical contraction spread to the rest of the heart. Okay, it seems to start in the top two chambers, the atria, and then through the whole heart, through the ventricle also. And when there is atrial fibrillation, when this contraction of the atrium, and on the top, the two atria, they're losing their rhythm and the heart beats irregularly. Now I don't have here what it is, but it's not as it should be, but I don't know. It's not as it should be. And that can happen in sudden intermittent attacks. Okay, that is atrial fibrillation. The symptoms are palpitations. I don't know what palpitations are. Shortness of breath, vague feeling of tiredness or being unwell. Sometimes there are no symptoms. Okay, it can be symptomless, but it is palpitation, shortness of breath, and a feeling of tiredness and unwellness. Duration. Intermittent attacks may last minutes or hours, and they may recur over many years before becoming established. Persistent atrial fibrillation lasts forever without treatment. Okay, it seems if there's no treatment happening, then this atrial fibrillation becomes permanent. It is in the beginning over minutes and hours, with symptoms of shortness of breath, palpitation, feeling of tiredness and unwellness, but it can be also symptomless. The irregular beating of the atrium from which the heartbeat goes over through the heart. Causes. Very often no underlying cause can be found. Congenital deformity of the heart is also possible, and phyrotoxicosis. We're going to do it by T probably. Okay, phyrotoxicosis, whatever it is, can it be? It can be born in, congenital, but there's oftentimes no cause found. Complications. Heart failure with congestion of lungs and swelling of ankles. This will cause shortness of breath, palpitations, and an irregular pulse. Okay, it can lead to heart failure and a congestion of the lungs. I don't know what congestion means. And swelling of the ankles. And the whole thing can cause shortness of breath and again palpitations and an irregular pulse. And also pulmonary embolism is a frequent condition. Treatment in the home. Sit down and rest. When to consult a doctor? As soon as possible, if an irregularity of the heart rhythm is suspected. So if you suspect a irregular beating of the heart, then you should consult a doctor, do they right here, but again, this is not medical advice, we're just learning about it. What a doctor might do. If the heart is still beating irregularly at the time of examination, the doctor will usually be able to diagnose atrial fibrillation, which he or she will often confirm with an ECG, a tracing of the heart rhythm. I think it's electrocardiogram, that's what I mean. Okay, with such an ECG, an electrocardiogram, they are tracking when the heart beats. They're writing it down. I think that it is a thing which writes it down. So they're checking how often the heart is beating. And if this period where it is having atrial fibrillation happens still while this ECG is measuring it, then it will be detected. If the attack has stopped, he or she will be unable to say for certain what caused it and will look for an underlying cause. Okay, if it's no longer going on, it's not so hard to detect anymore. And then he or she may prescribe treatment to help the heart beat more slowly and efficiently. How is it possible? It would be interesting if there's a medication to make the heart beat more efficiently, as United did. And maybe it's possible to send the person who has it to a hospital for electric shock treatment to the heart to stop the irregularity. No, I don't know what we mean. As there is a danger of blood clots developing in the heart, anticoagulant drugs may be prescribed. In this case, it will then be necessary for the patient to have regular blood checks. Okay, if people have atrial fibrillation, they have an increased chance to get blood clots, so blood which gets sticky, basically, and when it doesn't flow anymore, it can obstruct an artery, and then no blood and oxygen is delivered anymore to the person. It doesn't get blood supply as it should. And then anticoagulant drugs can be taken. I think these are anticoagulant means, I think, drugs to make the blood more thin. Or make this blood clotting. I'm again looking forward to it. Less likely. Prevention. Little is known about preventing atrial fibrillation. This book is 40 years old, maybe there's more now. Outlook. With medical treatment, atrial fibrillation can continue indefinitely without ill effect. That is interesting. That means what we're saying is that if anticoagulant drugs are taken so that the blood keeps thin, it doesn't form blood clots. And if maybe through electric shocks the heart is made in the right way, I don't mean they mean electroshock, I think they mean just specifically than the heart itself. Then they can just continue these atrial fibrillations and no ill effect happens, do they say here. Okay, that was atrial fibrillation, that was the medical part. If you were here for medicine, you can go directly to the next part. We will do now backstretching. If you participate in the backstretching, then it's better the arm is good in step stance. You're breathing in left in the arms up. And breathe out and we go to the side. And breathe in and out middle cage. And breathe out into the middle. Again in. And out over to the other side. Breathe in and out middle cage. And breathe out back into the middle and bring the arms down. And breathe in. And out, one hand slides down the leg, and the other shoulder sits down. Breathe again in. And out, and we're taking one arm over. Breathe in and out the rib cage. And breathe out into the middle. Breathe again in. And out, one hand slides down the leg, the other shoulder sits down. Breathe again in. And out, and we take one arm over. Breathe in and out, rib cage. And breathe again out and bring the arm down. And we go into the middle. We come over to the next exercise, the aeronautic aerobatic aeroplane. Feet are standing together and we're breathing in and lifting the arms up. And now breathe out and bring one hand down. And breathe in and reach. And breathe out the hand again up. Breathe again in. And out we bring one hand down. Breathe in and reach. And breathe out one hand up again. And we're going to do it another time. Breathe in. And out and one hand comes down. Breathe in and reach. And out one hand up. Again in. Out one hand down. Breathe in and reach. Out, hands down. And now we're doing the macro. Breathe in the arms up. And breathe out the arms back, out the chest to the sky. Breathe in and the arms up. And breathe out the arms down. Breathe in and the arms up. Now over cross your arms to the 20 fingers reach high. And breathe out. And stretch in front and hold up the back. Breathe in and the arms up. Out again back to the shoulder blades together. Breathe in now across the arms and reach high. Breathe out, reach in front, hold up the back. Breathe in, reach high. And we're ending with a sky hugger, open arms wide to the sky. Breathe in, open up. And breathe out, lean back, open the arms wide up. Breathe in into the middle. Out and down, and we're closing with the cactus, connecting its stings. Breathe in the arms up. Bring your hands to touch and lower hands down to heart center. Now, it was Backstretching. It was more short stretching. But thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, atrial flutter. And after we've done that, we're going to do Neckstretching. If you participate in the Neckstretching, then it's at your own risk. And we're talking about illness and also internal anatomy and the blood system. And this is no medical advice, we're just learning about it. Atrial flutter. That is an uncommon disturbance of a normal heart rhythm in which heart muscle contractions are stimulated at a very fast, regular rate. Only a proportion of stimulations cause contractions of a heart muscle. The ratio of stimulations to contractions may be 2 to 1 or every 3 or 4 to 1. Atrial flutter is linked with degenerative heart conditions and is consequently seen most frequently in older people. Okay, I think I know what it is. The heart is sending out to make the beating, the contraction, but it doesn't happen. It has to be started like a car, starting at 2, 3, 4 times. Symptoms. The onset of symptoms is sudden. That is interesting. Medical. Awareness of rapid heartbeat. Breathlessness, chest pain and exertion, angina pectoris. Okay, the onset is sudden. There can be a rapid heartbeat and breathlessness and angina, so pain in the chest. Duration. Though atrial flutter may occur in spells, it usually continues until treated. I don't know what spells are. Apart from what they are in magic. So spells. They continue until treated, basically, the way they say. Causes. Myocardial infarction. The death of part of the heart muscle. See coronary thrombosis. Okay, the cause of it can be a myocardial infarction, so heart attack. And also congenital abnormalities of the heart. But the onset is sudden and it's most frequently in older people. Okay. Ischemic heart disease in which the blood supply is restricted. Okay, there can be a ischemic heart disease when the blood supply is restricted, and also rheumatic fever, which is characterized by scarring and inflammation of the heart. Okay, it can happen through rheumatic fever when the heart is inflamed and scarred. Through ischemic heart diseases where there's not enough blood coming to the heart. It can come through genetic defects, congenital abnormalities, and also through coronary thrombosis or through a myocardial infarction, heart attack. Treatment in the home, remain at rest in bed or chair until seen by doctor. So rest and call a doctor. When to consult a doctor? If you are aware of a disturbance in the heartbeat. So if you notice a disturbance, then call the doctor. If there is undue breathlessness or chest pain. Undue breathlessness, so I think if you don't do sport and are out of breath. Or if there's chest pain. What the doctor might do, try to slow the heartbeat if it is too fast. The pressure on one of the 2 carotid arteries in the neck. As I was thinking about it, I once mentioned what they're called. I had carotid in the study. I said in Juggler, it must be somewhere else. Where as well. Carotid arteries. I don't know exactly where you are, but I think where you also. Okay, the doctor might try to slow the heartbeat down by pressing on the carotid arteries in the neck. And that works. Just I wouldn't get also how to say fascinating, but interesting, it's not strong enough. There is a treatment method to press on the carotid arteries to slow down the heartbeat. Well, the circulation is just shortened. Maybe that's the reason. Arrange for an ECG, an electrocardiogram, to reveal the nature of the disturbance. So they're checking how the heart is beating also, to find out what it is. Send the patient to hospital for treatment by drugs or electric shock to the heart to convert the abnormal rhythm to normal.
Okay, there is some drug treatment, and also can the heart be shocked electrically to make this abnormal beating again normal. Prevention. This depends on the disease causing the condition. See causes above. No, rheumatic or rheumatic fever didn't be had so far, so maybe that could be something maybe done. One moment. And then it can be coronary thrombosis, so maybe what we had here with emphysema, things like that. Another moment. And okay, outlook. When an attack has stopped, drugs may be given to prevent another attack. How could a drug do that? Long-term outlook will be related to the disease causing the condition. Okay, there are diseases when it's not that good. Now, that was the atrial flutter. Okay, what did we have? Atrial flutter, that was too often this inclination of the heartbeat, but it doesn't happen. But there's still a rapid heartbeat. Let's do it again. An uncommon disturbance of a normal heart rhythm in which heart muscle contractions are stimulated at a very fast, regular rate. Only a proportion of stimulations cause contractions of a heart muscle. And atrial fibrillation, that was an irregular beating of a heart. The atrium is the chamber of the heart from which rhythmical contractions spread to the rest of the heart. And atrial fibrillation, the contractions lose their rhythm and the heart beats irregularly. How does that come about? Okay. Causes very often no underlying cause can be found. Congenital deformity for hearts. Physiotoxicosis. Thyrotoxicosis. Okay. Atrial fibrillation, that is irregular, whatever. And atrial flutter, that is too often. Maybe we should find out what the word fibrillation means itself, because in a way flutter and fibrillation, I don't know the difference. Okay, flutter, that is too often, it's flashing, but it's not really helpful if you have no fibrillation. And fibrillation, that is fibrillation. Doesn't really work either. But it's like driving about whatever it's called, a road with a lot of bumps. Now, that was the medical part. If you were here for medicine, you can get related to the next part of medicine. We will do now the Neckstretching. If you participate in the Neckstretching, that is very honest. We're starting with a hydrotowel. The legs shoulder wide apart, and we're breathing in. We're stretching with the fingertips as far away as we can. And breathe in and stretch high with the fingertips, and again down. And stretch is still to the outside. Breathe again in, again. Reach with the fingertips as far away as you can. Breathe in. Reach with the fingertips high up, and again down. Reach to the outside. Next exercise. Again, reach with the fingertips as far as you can with the fingertips. Reach high up, and not just to the sides, but also back. Reach far with the fingertips. Again down, and another round. Reach as far as you can with the fingertips. Back. And it seems a bit ridiculous, but maybe it actually works. To the push again. Feet together, arms up, and now basically let fly. And we go on with the next exercise. The police officer, feet standing still together, breathing and lifting the arms up. And breathe out, open the arms to the side. Breathe again in the arms up. And out, open the arms to the other side. Breathe in the arms in the middle. And out and down. Now the legs are shoulders wide apart. Breathe in. Tall up, shoulders back. And out, turn the head over to one side. Breathe again in. And breathe out, bring the chin down to the clavicle. Breathe again in. And out, lift the gaze and turn the head over to the other side. Breathe again in. And out, bring the chin down to the clavicle. Breathe again in. Out, lift the gaze and turn the head over to the first side again. And breathe again in. And breathe halfway out.
And then bring the head in one circle over the other side. Breathe again in. And breathe halfway out. And then go in a circle movement over to the first side. And head back into the middle. Now we're doing the crabs in the morning. Keep the legs standing shoulder wide apart. Breathe in, lift the arms up. And breathe out, lean back. Draw the shoulder blades together, up the chest to the sky. Breathe in the arms up. And breathe out again, the shoulder blades together, up the chest to the sky. Again in. Out the arms down. Now have the feet standing together. Breathe in and lift the arms up. And breathe out, lean back, verried in the wind. Again in. And breathe out, lean again back. Breathe in. And breathe out, lean to the side, the thigh in the wind. Breathe again in into the middle. And out over to the first side. Again into the middle. Let's try to make the screw and the drill interchange. Or across the arms, intertwine the fingers, reach high, breathe in. And now breathe out, reach in front, hollow the back. Breathe again in the arms up. Change the position of the arms. Intertwine again the fingers and breathe in, reach high. Screw and breathe out, reach in front, hollow the back, the drill. Again in and up the arms. And out and down the arms. And now we're doing the cashew. Feet are standing together, intertwine the fingers behind the back. Shoulders back, tall up, breathe in. And breathe out, bring the head over to one side. And the chin down to the clavicle. Now breathe in. And out and reach with hands down to the floor. Breathe again in, head up. Over to the first side. Breathe again in. Out, bring the chin down to the clavicle. Breathe again in. And out, reach with hands down to the floor. Breathe again in, the head up. Back up to the middle. And now the cashew. No. The head of the cashew. Now the stretch of Venus. Intertwine the fingers behind the back. And bring them over to one side. Now breathe in, turn up the shoulders a bit back. And breathe out, turn the head to the side where the hands are. Breathe again in. And now pull the arm in, have the shoulder down. Chin out again. Again, in, lift the chin. And bring the head out to the first side. The hands out to one side. Head out to the side where the hands are. Chin down to the clavicle. And breathe in. And out, pull the arm in, shoulder down. Breathe again, lift the gaze. Turn the head back into the middle. Next. Let's do it actually. Bring the arm back and pull the elbow a bit down. Just keep normal breathing and try to be tall up. Then again out. Now change the arms. Breathe again in. Out with the arms down. And now we're ending with this Haga almost. Breathe in the arms up. Breathe out on the arms wide to the sky. Breathe again in, tall up. And out, lean again back. Breathe in, up again. And out and down. Last time. Again in the arms up. Out the arms down. We're doing a few eagle swings. Breathe in. And out. Again in. And out. And one more of eagle swings. Out and down, and we're ending with the cactus collecting its stings and weaving. And breathe in with the arms up, bring the hands to touch, and bring the heads down to heart side. That was the next stretching. I thank you very much, and until next time. Hi and welcome. I'm trying to learn Addison. Today, Bell's palsy. After we've done it, we're going to do shoulder and pin training. And if you participate in the shoulder and pin training, then it's at your own risk. And we're talking about a disease, pretty severe disease, and this is no medical advice, we're just learning about it. Bell's palsy. That is inflammation of the facial nerve causing one side of the face to droop. It affects less than 1 person 1,000 each year, but can occur at any age. Okay, there are nerves at the face, and one of them can be inflamed, and then the whole face or half of the face droops down, so it sinks down. 1 in 1,000 person has it in a year, can occur at any age. Symptoms. Sudden paralysis of one side of the face, including weakness of the muscles of the forehead and eyebrows. The patient is unable to close the affected eyelids. The eye may roll up under the paralyzed lid from time to time to moisten and protect it. Okay, one side of the face is what is it called? Paralyzed. The corner of the mouth on the affected side droops. The skin creases flatten out and the eye will not close properly. Food collects between the teeth and lips, and saliva may drip from the corner of the mouth. There is no paralysis elsewhere in the body. The sense of taste on the affected side of the tongue may be impaired. That is interesting. There may be some pain or discomfort around the ear. Duration. 80% of patients recover within a few weeks. Causes. The cause of the inflammation of the facial nerve is unknown. This book is 40 years old, maybe that's not known. Complications. Damage to the cornea of the eye. Permanent facial paralysis. So it usually goes away within a few weeks, but it can make also permanent facial paralysis. Treatment in the home. Gently close the affected eye with a finger from time to time to prevent from becoming too dry. Do not rub the eye. When you consult the doctor, within 24 hours to confirm the diagnosis, immediately call the doctor. What the doctor might do, prescribe a course of steroid tablets or injections, although the effectiveness of this treatment has not yet been proven. Now and again, this is 40 years old, maybe that is all also no. Arrange also for tests and physiotherapy for the affected facial muscles. Prevention, none known. Outlook. Recovery is usually complete after a period of weeks. Occasionally, muscle power on the affected side of the face does not return completely. Why? That would be interesting. Why? And the patient is left with some permanent weakness, particularly of the eyelids and side of the mouth. Okay. Now the most interesting thing is two. One, that the tongue can be partly affected with taste. And the second thing, that it seems to be normally completely to recover, and by some people not completely. Now, and if you find out why by some people not, maybe that gives some clues why the whole thing happens and how to prevent it. And then what it is, now we had Bell's palsy. Was it Bell's palsy? And that is inflammation of the facial nerve, and the half of the face basically is paralyzed, affecting the eye, mouth, ear, tongue, and so on. Call the doctor, they said, and usually it goes away within a few weeks completely. No, it was a medical part. If you will here for medicine, you can go directly to the next part of medicine. We will do now the short impingement training. If you participated in the short impingement training, then it's better to hear on this. Good and stable stand, and go forward shoulder circles. Then back, up, and front, and down with the shoulders. And now backwards. Now, long arms with strong fists. Go as far back as you can with the shoulders. Now high up and in front, down and back, up and in front and down, and now backwards. Up, back, down, front, up, back, and down. Next exercise, legs wide apart, into the knees, hinge forward with a straight back, let the arms hang, and pinch the shoulders together with effort. Make fists, lift the arms up and still pinch the scapulars together. Lift the arms and shoulders down. And again, pinch the scapulars together with effort. Make fists, lift the arms up and still pinch the scapulars together. And lift the arms up, shoulders up. We could call this exercise motorcycles. And the next exercise, legs wide apart, back down in the knees, hinge forward with a round back this time, lift the arms hang, make fists, lift the arms to the inside, lift the arms high up and bring it together, and bring the shoulders down and together. So, the arms high up and together, shoulders back and down. And another time, into the knees, hinge forward with a round back, lift the arms hang, make fists, the arms to the inside, lift the arms high up and bring them together, straighten up, bring the shoulders down and together. Next exercise, we are lifting the arms up. If this exercise causes pain or any other one, then don't do it. And the arms up. Just observe what the scapulars are doing. Just look whether they are opening up and giving room for the humerus to come up or not. And now the arms to the side. And bring them in front. And get back. Next exercise, world lifter, go to step ascent, long arms, strong fists, bring the shoulders down and together. Now turn the arms to the inside. The arms to the outside, the shoulders are staying down and together. The arms again to the inside, shoulders down, together. And release. Not release. Change to the outside, Arms to the outside, shoulders stay down. And release. The arms to the side, hands on the fist, with in front of the arms. Turn the arms in front and bring the shoulders down and together. Arms back, shoulders up and in front. And arms in front, shoulders back and together. And change the last time, arms back, shoulders up and in front. Next exercise, lift the arms up and shrug the shoulders up and release it all down. Again the arms up, shoulders up and release all down. Again the arms up, shoulders up and release all down. And the next exercise, sundial. Have a sock, tennis ball, whatever, have a long arm at the outside. Let it fall down and try to catch it again. And on the other side. And now we're stretching. One arm in front. The shoulder is back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go it back with the shoulder and turn the palm up to the sky a bit. Change. The other arm in front. The shoulder is back, down. Pull the arm in. Have flat fingers. Try to relax the arm. Go it back with the shoulder and turn the palm a bit up to the sky. And that was the shoulder pain training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, Blackwater fever, and after we've done that, we're going to do standing leg yoga. And if you participate in the standing leg yoga, then it's better at your own risk. And this is here no medical advice. We're just learning about it, and this is an illness, and it's not the most pretty one to talk about it. Blackwater fever is a serious complication of malignant tertian malaria, in which the red blood cells are destroyed. No, I just read the beginning to give a warning. And it seems actually that malaria can cause further complications, and this specific complication of malaria is Blackwater fever. Okay, and by that the red blood cells are destroyed. In your body there are the red blood cells, and I think these are the ones delivering the oxygen, and they are destroyed. The disease gets its name from the color of a patient's urine, which turns dark. Symptoms: jaundice. I don't know what it is. I would almost order it maybe on the menu. Okay, jaundice, whatever it is. And then also black or very dark urine. And there may be severe kidney failure. Is that the reason for the color changing of the urine? Severe kidney failure. Duration: a day or two if the attack is mild. Causes: the exact cause is unknown, but Blackwater fever may be due to quinine, used in treating malaria since it occurs in people taking the drug. That is interesting. Okay, there seem to be people who have to treat malaria. I don't know enough about it to talk about it, and it's pretty broadly known, and I can't really add a lot. It's some form of illness people can catch, I think, from flies in Middle European regions, in Southern European regions. I don't really get it. It's the disease. Now, and some people were treated with quinine, and this medication maybe caused it, but the exact cause is unknown. To say it is maybe through quinine is a pretty exact suspicion, and also something pretty easy to find out. Treatment: absolute rest and careful nursing are essential to ensure recovery. If there is kidney failure, the patient may need treatment with a kidney machine. Does the kidney recover? Plenty of alkaline fluids should be given, and the patient may need an intravenous drip of glucose and sometimes bicarbonate of soda. A blood transfusion may be necessary. Treatment with quinine should be stopped. And that's the end. Here's not more written to it. I wanted to know at least if the kidney is getting better, so if the health goes up again. Okay, so people can have malaria, that is the disease called for something, and then we get the complication Blackwater fever. That is maybe because malaria was treated with quinine, but the exact causes are, although they just mean we don't understand how quinine it is. And the people should do absolute rest, and they should drink plenty alkali fluids. Again, this is not medical advice, I'm just reading what is in here. Alkaline fluids. and maybe intravenous drip of glucose and bicarbonate of soda, and maybe also a blood transfusion, and the treatment with quinine should be stopped. Now, if it would not be a little coincidental, I would say no, but I don't know what intravenous is, but we just heard it, and I just want to say it here. It seems to be intravenous. It goes into the vein. Intravenous is the thing into the arm. No, I didn't know it until very recently, so if it would not be coincidental that I heard it there, I would say no, but I don't know that I would say it then when I hear it, so I don't say it now. Intravenous, it is just intra-vein, into the vein. Intravenous, and it is the thing into the arm, into the vein. Plenty of alkaline fluid should be given, and the patient may need an intravenous drip of glucose and sometimes bicarbonate of soda. Okay, that was black water fever. If you were here for medicine, then you can go directly to the next part. We will try to do now the standing leg yoga. If you participate in the standing leg yoga, and it's better here on the screen, we're having the feet standing together, and we're starting with a police officer. We're breathing in and lifting the arms up, and breathe out and open the arms to the side. Lift the arms up, and breathe out, open the arms to the other side. Now breathe in and lift the arms up and make an inch space between the feet. And breathe out, open the arms to the side. Breathe in the arms up. And out and sinking down for hide and seek playing palm tree. Again, in and up. And out, open the arms to the side. Breathe in the arms up. And breathe out and we're going down again. Now breathe in and come up. And breathe out and we're leaning onto our knees and we're doing standing cat and cow. So breathe in and out and make a hill with the back, the cat. Breathe in into the middle. And out, make a belly with the back, the cow. Again in. And out, bring it lower back. Again in into the middle. Out, round back. In into the middle. And out we're coming up with a round back, making it a little bit backwards short. And the next exercise. Still an inch space between the feet. Breathe in the arms up. And breathe out, open the arms again to one side. Breathe in the arms up. And out and bring the arms up on the sides, down we're going down into the chair. Breathe in, come halfway up. Higher up. And out and we're coming up again. Breathe in, reach high. And breathe out, open arms to the side. Breathe in, lift the arms up. And out and we're going again down. Breathe in, come halfway up. Come higher up. And out and we're coming up again. And now we're doing the chair. So breathe in and come up onto tiptoes. And now breathe out and we're sinking down. Breathe in, come up again. And breathe out and go down. And in and up again. And out, bring the arms down, the feet together. We're going down over the down diagonal breath and down. Now we're doing the marmot. Breathe in and bend the right leg. Then breathe out and stretch the left leg. Breathe in and change. Then breathe out and stretch your right leg. Breathe in and change. And out and stretch your left leg. Breathe in and change. And out and stretch your right leg. Now we're doing the penguin. Breathe in and lift your right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathe in, bring the arm again down. And out and down. Now breathe in and lift the left hand up to the sky. And breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in, the arm again down. And out and down. And we're doing the pelican. Make a hand lift space between the feet. Shift the weight to the heels. And breathe in and go down. And out and up again. Breathe in. And out and up.
And last time, breathe in, go down. And out and up. And return with trapezius counterweight. Take hold on the elbows and gently rock from side to side. And again down with hands, close with feet. We then come halfway up into monkey half lift. Without it, go down. Breathe in, come halfway up. And out and down. And now in and becoming with a up diving swan upwards and bring the hands down. Now the garden pose for torso pointing to the outside, having an unaligned space between the heels. We then lift the arms up. And breathe out and sink down and place the elbows against the inside of the knees. Breathe in and straighten up. And breathe out and come with the back up. Breathing in and down. And out and up again. Again in. And now out and we're coming up in one straight line slowly upwards. And now down. Now we're going to the end of the mat, so it's not completely standing. And we're going down into hard plank. And we're going into the downward facing dog. Walk a bit in. And now bring left leg up on the first leg. Bring it in front. Come a bit up and place your elbow against the outside of the first leg. Turn over to one side. And we're going down again. Bring the leg again back and we're going again into the downward facing dog. Now bring the other leg up. And bring it in front. And now turn it to the other side. And we're going down again. And we're doing the bobslide. So breathe in. And we come back. And out in front. Again and back. And out. Again and back. Out. And now back into the downward facing dog. Now we're doing the stretching dog. Come up on the tiptoes. And do a crevasse climb up with the knees in. Again, stretching dog. Downward facing dog. Walk in. And we come slowly with the round back up. Back at the top. Back pajama. And now a modified garden pose. Torso pointing to the outside, ulnar space between the heels, breathe in with the arms up. Then breathe out and sinking down and placing the elbows against the inside of the knees. And now breathe in and straighten up the back. And breathe out, tuck the pelvis in, and come with the crown of the head first up. Bring the arms again down, and breathe in, lift the arms up. And breathe out again down. Elbows against the inside of the knees, breathe in, straighten up. And breathe out, tuck the pelvis in, and come with the crown of the head first up. Arms to the outside, and breathe again in. And one more time, out and down. Elbows against the inside of the knees, breathe in, straighten up. And out, tuck the pelvis in, and come with the crown of the head first up. And the arms down. And we're ending with the eagle's wings. Feet are standing together. Breathe in, arms up. And out, arms down. Again, in, arms up. And out and down. And in, arms up. And down. And we're ending with a cactus collecting its stings. Breathe in. Bring the hands to touch and lower the hands down to heart center. That was for standing. Leg yoga, I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, Bornholm disease, and after we're done with it, we're gonna do neck stretching, and if you participate in the neck stretching, then it's better the honors. Bornholm, yes, we're talking here about diseases, and this is no medical advice, we're just learning about diseases.
Bornholm disease. A painful virus infection that may occur in epidemic form and which mainly affects children and young adults. It gets its name from Bornholm, a Danish island in the Baltic Sea where it was first identified. It is also known as devil's grip, epidemic Regurgitation, and pleurodynia. Okay, first the Baltic Sea, there's Europe, and then in the middle there's France, and there's Germany, and north of Germany there's Denmark, and west of Denmark there's the North Sea, and east of Denmark there's the Baltic Sea. And then the Baltic Sea there is an island called Bornholm. And that was first discovered, identified. Okay, that is a painful virus infection affecting mostly children and young adults. It has also the name devil's grip, epidemic Regurgitation, and pleurodynia. Symptoms. Sudden attacks of severe pain in the upper abdomen or chest. So sudden attacks of severe pain in the upper abdomen or chest. Rapid shallow breathing with increased pain or deep breathing, laughing or yawning. High temperature. Profuse sweating. I don't know what profuse. I heard it a lot of times, but I don't know what it means. Profuse sweating. There may be a slight cough, but there will be no vomiting. That's nice. Just let me point that out. So these things are excluded. What if people have two diseases? What if the only reason why someone says you do not have Bornholm disease is because this person has puked up in the last time? But maybe they have just two diseases at the same time. I don't know. Incubation period, 3 to 5 days. So after, no, I'm not completely sure what the incubation is. That is the period until it breaks out. 3 to 5 days from the infection until it breaks out. Duration, 3 to 7 days. Causes, a virus spread by direct contact, especially coughing and sneezing. So for the air, mostly. Complications. As with many virus diseases, infections of the pleura, I don't know if the pleura is or what it is, actually never heard of it before. Infection of the pleura, lungs, heart, brain or liver occasionally occur. Okay, it can infect the pleura, the lungs, the heart, the brain and liver. Treatment in the home, rest. Take pain-killing tablets in doses recommended on the container. And again, this is no medical advice, this is a shit in here. How the hot water bottle wrapped so as to prevent burning the skin. Yeah. If you take a hot water bottle, you should not handle it in the way that you burn yourself with hot water. Against the most painful area to ease the pain, do they also advise? And when to consult a doctor? Immediately, if there is severe chest pain or abdominal pain. What the doctor might do? Examine the patient to make sure he or she is not suffering from another illness with similar symptoms, such as pneumonia or appendicitis. We had appendicitis, that is inflammation of the appendix at the beginning of large intestine. I don't really remember what causes it. I think we didn't really know the cause. So the doctor tries to rule pneumonia or appendicitis. Prescribe strong painkillers once the diagnosis is certain. Prevention. Avoid contact with affected individuals. Outlook. Recovery is complete within a few days. And relapses may occur soon after apparent recovery. What type of disease is it? So people recover when they get it again. How does that happen? That's really an interesting question. Probably more for biology. Why do some diseases come back? Imagine if we find the answer to that, even if it are very simple diseases. It doesn't have to be Bornholm disease, just any. Maybe it would explain why many other things are coming chronic, or why things like multiple sclerosis come in steps and stages. Okay, Bornholm disease. It seems to actually. I think that's so dramatically. I mean, at the end, recovery is complete within a few days. But maybe there's more to it that they just don't write it down. Now, that was bone harm disease. If you were here for medicine, when you come already to the next part of medicine, we will do now the Neckstretching. You should do some arm stretching. Neckstretching, we are making the hydrotower. If you participate in the Neckstretching, then it's better the arm muscle. Go and stay with that, and they are doing the hydrotower. Breathe in and reach the fingertips as far as you can. Reach high up with the fingertips and reach far. Bring it up. And again, and reach as far as you can with the fingertips. And down again. Reach as far as you can. Next exercise. Reach again with the fingertips as far as you can. As you're doing a big arm circle. Reach as far as you can. Not only to the sides, also back and reach with the fingertips. Reach as far down as you can. And another round. Reach as much in front as you can with the fingertips. And reach high with the fingertips. And not just to the side, but also back. Reach as far as you can. And down. I said we're going to do a both side. So let's do a both side. Arms up to the T. And we're pretending to fly like both side. And next exercise, we put these arms up. Let's see, arms up. And breathe out. Open the arms to the side. Breathe again in. And out, open the arms to the other side. Again in, the arms up. And out and down. Now with the legs around shoulder width wide apart. And we turn up, shoulders back, breathe in. And out and turn the head over to one side. And your chin down to the plank. And breathing in. And out, lift the gaze. Turn the head over to the other side. Breathing it in. And out, bring the chin down to the plank. If you can lift the gaze. And over to the first side. Again, chin down to the, no, not down. Breathe again in. And now breathe halfway out and circle the head over to the other side. Breathe again in. Breathe halfway out and bring the head and circle over to the first side. Again out. Now have the feet standing together. Breathe and lift the arms up. And breathe out, doing the crab in the morning. Draw the shoulder blades together and open the chest to the sky. Breathe again in. And out again back. Draw the shoulder blades together, open the chest to the sky. Again in. Bring the hands together and lean back, the sheet in the wind. Again in. And out and back. Again in and turn the and breathe out, lean over to one side, firm the wind. Again in. And out over to the other side. In. And over across the arms, the 20 fingers that reach high with screw. And breathe out, reach the front and hold the back with drill. Again in the arms up. Over across the arms, the 20 fingers reach high. And out. Reach in front, hold the back. Breathe out. Again in up. And out and down. Now the catching. The feet are standing together, intertwine the fingers behind the neck. Hold up, shoulders back, breathe in. And now turn the head over to one side. And bring your chin down to the cloud. Now breathe in. And out and reach with the hands down to the floor. Breathe again in, lift the gaze and turn the head over to the other side. Breathe again in. And out, bring the chin down to the clavicle. Breathe again in. And out, reach with the hands down to the ground. Again in, lift the gaze and turn the head back into the middle. And now we stretch your Venus. Intertwine again the fingers behind the leg and bring them over to one side. Turn up, shoulders a bit back. Breathe in. And out turn the head to the side where the hands are, and the chin down to the clavicle. Now breathe in. And out and pull the arm and the shoulder down. Again, head up, turn the head out to the other side, the arms also out to the other side. And breathe, just breathe in first. And breathe out the chin down to the clavicle. And breathe in, pull the arm and the shoulder down. If you can lift the gaze and then head back and above. Now the sky hugger, feet are standing together, breathe in, lift the arms up. And breathe out, open the long arms up. Again in. And out, lean the second time back. Again in. Out the arms down, and we do the eagle's wings, coming to the end. Breathe in, lift the arms slowly up. And breathe out the arms in down. Again in, yes. And out the arms down. And last movement, the cactus collecting its stings in the evening. Breathe in, lift the arms up. Bring the hands to touch. And lower the hands slowly down to heart center. That was the Neckstretching. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine today, bronchiectasis, and after we've done it, we're going to do stretching. And if you participate in the stretching, then it's at your own risk. And this is no medical advice, we're just learning and talking about an illness and internal anatomy. Bronchiectasis, that is an increase in size of a bronchi and bronchioles. These are the airways of the lungs. So they are the lungs, and through them they are going these bronchioles. I don't really understand it really. These are the airways of the lungs, if you can understand it with these words, which all people use when you have it. And I even know some pictures of the anatomy. I don't really understand it still. Maybe I'm going to show you this picture on the left, which is red. The lung resembles a tree, of which the yellow trachea windpipe is the trunk. This trunk divides into the branches of the main bronchi, which in turn subdivide into the twig-like bronchioles. These continue to branch until they end in clusters of minute air sacs called alveoli, which give up oxygen to tiny blood vessels and absorb carbon dioxide from them. Here a picture. Bronchiectasis, when that is an increase in size of these bronchi and bronchioles. So first where comes the trachea, for that comes the air, and then it goes into the branching bronchi, and they becoming then the finer bronchioles, and they become then the very fine alveoli. The condition may be congenital, present at birth, bronchiectasis, but is more commonly the byproduct of a disease or infection in bronchitis. For example, the area of lung tissue is reduced. What is normal lung tissue? And the bronchi become weakened and widen as a result. What of that is the area of lung tissue? And why does that cause the bronchi to become weakened and widen as a result? Whatever, that is bronchiectasis. Any infection in which the amount of air that reaches the lung is reduced is likely to cause bronchiectasis. Let's read it again. Any infection in which the amount of air that reaches the lungs is reduced is likely to cause bronchiectasis. For example, whooping cough, pneumonia, tuberculosis, as well as bronchitis are all associated with a condition called bronchiectasis. And that is that the lung tissue is reduced. What does it mean? And the bronchi become weakened and widen as a result. Sometimes the direct cause of a reduction of it's just what I heard quite a lot of times about bronchiectasis and all that already. And I still don't get an answer. And I'm reading again an article which doesn't use any more words, just the same words. So that's the reason why. I'm asking why, because I have these questions all ready to say since a long time, and now I have them again. Sometimes the direct cause of the reduction of air is physical. A growth may impinge on the airway, or more commonly the airway may become blocked by a foreign body, such as an inhaled peanut. A growth may impinge on the airway. Okay, but it can be if the cause is physical, but most of the times it is bronchitis, pneumonia, whooping cough, tuberculosis. But it can be also that there is a peanut stuck, so nut, which someone has eaten. Commonly, the infection of a bronchi is bronchiectasis. Commonly, the infection of a bronchi in bronchiectasis leads to the formation of infected pus in airways and a severe cough. The bacterial infection is normally treated by antibiotics, and the pus drained through physiotherapy. Okay, pus forms and a severe cough, and there exists when treatment with antibiotics and also physiotherapy for the pus. Now that was a part of bronchiectasis. Now I want to go a bit back and look if we find where it was written that it were the carotid arteries which are delivering the blood to the brain, and I think the jugular vein transports the vein. Now let's look if we can find that one part where it was written. Now, if you were here for bronchiectasis, you can go directly to the next part. Okay, that was Bell's palsy, that was the thing with the facial nerve. Was it not? Atrial fibrillation, irregular beating of the heart. Atrial flutter, that was too often times ignited that's beating of the heart, but it wasn't executed every time. What the doctor might do, try to slow the heartbeat if it is too fast by pressure on one of the carotid arteries in the neck. I don't say that these are the arteries delivering the blood to the neck. Okay, that means we're going to wait for better naming of it. Now, I think we do the thing with intravenous. I think we're going to do it. I'm going to start the second camera. And I'm going to save it shortly. I don't know, not more, but just a little thing. That's not the content of the book. Intravenous is injection into the blood vessels of your arm like that. Just a little. It's not the biggest video in the world, but I wanted to have it. I'm going to stop the second camera. Just so you have the information fast. We're going to do a later better one where we explain what it is actually, how it actually works and what it is. But just a little bit. So, that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We were going to do a little stretching. If you stay here and participate in the stretching, then it's medical congress. Legs standing on a shoulder wide apart. If you're breathing in, lifting the arms up. Then breathe out and go over to one side. Now breathe in and out the rib cage. And breathe out back into the middle. Breathe again in. And out over to the other side. Breathe in and out the rib cage. Out back into the middle. And the arms down. Now breathe in. Out, one hand slides down the leg. Now one sees the Rupture exercises that the other shoulder stays down. Breathe again in. And out, and we're taking the arm over. Breathe in and out the rib cage. And breathe out back into the middle. Breathe again in. And out, and one hand slides down the leg, and the other shoulder stays down. Breathe again in. And out, we're taking one arm over. Breathe again in over the rib cage. And breathe out back into the middle. Next exercise, the aortic iopathic aeroplane. The feet are standing together, and breathe in and lift the arms up. And breathe out, one hand down. Breathe in and reach. And breathe out, one hand up. Back and in. And out, one hand down. Breathe in and reach. Out, one hand up. And out, one hands down. And now, our legs standing shoulder wide apart, and we're doing forward shoulder circles. Go back, up, and front, and down. Last time. And now backwards. The last time. And now breathe in, lift the shoulders up. And breathe out, let them fall down. Again, in the arms up. And out the shoulders down. Again, in the arms up. And out the shoulders down. Now we have a pucker. Breathe in, lift the arms up. And reach all this high. Pretend to take an apple, hanging high on the apple branch. To turn it a bit around. And then to pluck it. Last two. And now we shift up. Arms up to a T, breathe in. And out, shifting over to one side. Breathe again in into the middle. Out over to the other side. Again in. And out. And again in. Out over to one side. Again in. And out, we're leaning onto our knees. We're doing the buffalo fighting and saying over. Again in. And out, we bring one shoulder in front. Breathe in and shoulder back. And out the other one in front. In. Out. And in. Out. In. And out, and we're hanging down. And we're doing nothing else when breathing in. And out. Again in. And out over to one leg. Breathe it in. Out over to the other leg. Breathe it in. Out into the middle. Breathe it in. And out, coming slowly forward, back up, making it to the backwards, shoulder. Normal garland pose. The toes opening to the outside, having an ulnar limb space between the heels, we're breathing in the arms up. And now breathe out and sink down and place the elbows against the inside of the knees. And breathe in and straighten up the back. And breathe out and cover the back up. Breathe in. And out again. Again. And out again up. Again. And again out. And now breathe in. And breathe out and come slowly up in one straight line. And afterward we're going to continue with the next exercise, which will be the seahorse pose. And at that time I'm going to look for the bronchiectasis. And here what we had an anatomy of the lung with the trunk, with the trachea and the bronchi and the bronchioles and then the alveoli, because I want to do it in another course and anatomy. Here's for example a picture of it. And anatomy is of a seahorse pose for first. Place the heel of standing of a normal leg on top of the knee of a standing leg. Breathe again in and out and sink down. I'm going to work on the page where it's actually. So we had here bronchiectasis. And another course in anatomy, which I'm going to start in a moment. we're gonna go over it. There's not much to say, but I wanna have at least what we have sorted down. Now what was written here. The lung resembles a tree, of which the yellow trachea is the trunk, so there's the trachea, and then this trunk divides into the branches of the main bronchi, which in turn subdivide into the twig-like bronchioles. These continue to branch, and we're changing the leg. These continue to branch until they enter in clusters of minute air sacs called alveoli, which give up oxygen to tiny blood vessels that absorb carbon dioxide from them. And that was the exercise, and we're closing with the trunk igniter. Legs wide apart, we're breathing in, going down. And breathe again out. Again in. Out. And the last strong breathing. Out. And now we've intercrossed the legs. And out. That was stretching. Thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, acute bronchitis, and after we've done it, we're going to do a bit standing yoga. And if you participate in the standing yoga, then it's at your own risk, and this is no medical advice, we're just reading about it, and we're talking about internal anatomy and an illness. Bronchitis. That is inflammation of the larger air passages at bronchi, leading to the lung. There are two categories, acute and chronic. Okay, the large airways to the lungs are inflamed. Okay, we had here in the last part, there's the trachea, for that comes the air down, and then the trachea branch into the bronchi. These are thicker, but they are already a bit smaller, but thicker airways in the lungs. And they can be inflamed, and that is bronchitis. Now, the last thing was bronchitis, and that is an increase in size of the bronchi and bronchioles. Now we're having inflammation. Acute bronchitis. Symptoms. Wheezy breathing. I still don't really know what it means, but I think I read out the sound. Persistent call. Some people are calling persistently. And phlegm, which may contain pus, giving it a yellow or greenish tinge. I don't know. Do people have them all listed down one day? All these secretes with phlegm and pus, and have a picture to it so that we learn what we are. Are we learning that one day? I don't know. Many people are just using them as if it would be the normal thing of the day to know what pus is and phlegm and so. I don't know. This is something which is in the lungs, and maybe phlegm is a normal thing, but the pus is the abnormal thing, and the pus makes it yellow or greenish. General upset, loss of appetite, headache, fever. Okay, the symptoms of acute bronchitis is a wheezy breathing sound, a persistent coughing, and phlegm to have, which contains pus, which can make it yellow or greenish. And also a general upset. And loss of appetite, headache, and fever. Duration, usually 7 to 21 days. The condition is mild and self-limiting in otherwise healthy adults. Okay, around 1 to 3 weeks. And overall, the condition is mild and self-limiting in otherwise healthy adults. Causes. A number of different germs, viruses, and bacteria which invade the lining of tubes leading to the lungs and set up inflammation. It are the bronchi are inflamed. They said by bronchitis also the bronchioles. Now, it would be interesting to know specifically what part of the lungs gets affected by a viral infection or bacterial or germ infection. Because it almost sounds as if it would be, at least mostly, separated. That would be interesting and maybe very important to know, and something very easy to know. Okay, a number of different germs, viruses, and bacteria which invade the lining of the tubes leading to the lungs and set up inflammation is the cause. The lining swells. The lining of the tubes leading to the lungs. Inflammation of the bronchi. Okay, the lining swells, narrowing the tubes. Okay, by bronchitis, the bronchi are increased in size. And here, the tubes are narrowed. And the condition is made worse by the outpouring of mucus and other secretions. Does it make the the illness itself worse if phlegm is poured out, or is it just if it is stronger when phlegm is poured out? No, imagine if the phlegm has a reason there. Now imagine it comes out like with what's it called? That after one time it leads to dehydration. That where people are giving so much water from them, that then gives the problem that they're dehydrated. Now, what if it is a problem itself of bronchitis that the people are pouring out phlegm? Or is it just when the disease is worse if that happens? The lesion swells, narrowing the tubes, and the condition is made worse by the outpouring of mucus, phlegm, and other secretions. Yes, again, mucus, phlegm, pus, other secretions. It is there like a book in a rhyme where everyone sits down and everyone sings them down, phlegm, pus, mucus, and so on. Is there something happening? Or how do all the people know it, or do they not know it but don't admit it? The irritation causes the cause of the irritation of narrowing, and maybe also that mucus is put out. And the poisons cause the general upset. I don't understand the part of general upset. So I can't really assume now what is happening here with what poison. Acute bronchitis is often encountered as part of measles. Okay, people can have measles. Again, this book is written in the 80s. So maybe we have advanced and measles don't happen that much anymore. Complications. Bronchitis is more serious in babies and in the elderly because there is a greater risk of pneumonia. Okay, if people are young or an elderly, and I would add probably also people who have, because they said also healthy adults, if there are some problems, then it is not so good to get it, because it then can result in pneumonia, so more serious inflammation of the lungs. Treatment and how? Stay in bed for 2 or 3 days in a warm atmosphere, day or night. And again, this book is 40 years old, and this is no medical advice. Take plenty of hot drinks and painkillers. This is nothing you should write down in a sentence, I think. In recommended doses. Okay, they say rest. Take care of yourself and rest. Give your body a holiday. When to consult the doctor? It's working, as if it would be working. When to consult the doctor? If the illness is severe, or if a breathing becomes labor, whatever, some word, or associated with pain in the chest. Okay, if it gets worse, if the breathing becomes labor, whatever, and if there's pain in the chest. If the patient is elderly or a baby, then also consult the doctor. What the doctor might do: advise limitation of physical activity. Advice to rest. This decreases the possibility of infection being drawn down into the lungs and causing pneumonia. That is interesting. Now here I would like to know if it is a presumption, is that the right word? That can happen then, or if it's like a proven, scientifically, mathematically proven fact that it gets when actually, if people do then activities, that it gets drawn down into the further lungs. I said at the beginning, but it would be nice to know exactly, is actually bronchitis inflammation of the bronchis and not of the rest of the lungs? This would be very interesting. Now if it is, this decreases, now advice limiting of physical activity, this decreases the possibility of infection being drawn down into the lungs and causing pneumonia. If it is actually something, because it sounds like something mechanical, like something which could be measured. Like it is in the bronchis and now it gets drawn down into the bronchioles. It seems to sound like something which can be measured. Now if it is something which is measured, mathematically measured, or if it's just increased chance of it, like we have a feeling that it happens then. I would like to have extra facts on that, because it could be something important. Prescribe antibiotics if there is a risk of pneumonia, and prescribe core medicine. That differences? Whatever, some type of medicine is prescribed, and also to rest. Because they say that the possibility is otherwise increased, that the infection is being drawn down. I would like to know if it is just metaphorically written or actually drawn down into the lungs, into the bronchioles and into the alveoli and causing pneumonia. I would like to know what of these are facts and what are words. Not that I have anything to criticize about what is a word to think that it's not right. It's just I would like to know it really. Prevention. Avoid smoking and smoky atmospheres. What is the prevention of bronchitis? What is the prevention of making it worse? Because it's an infection of germs, viruses, and bacteria. Those at special risks, such as the elderly or small babies, should not sleep in cold bedrooms and should avoid contact with people with colds or chest infections. Okay, people who have chest infections and people with cold maybe should also not be visited so much by healthy people, so should be avoided, and also not to sleep in cold bedrooms. Outlook: acute bronchitis usually leaves now after effects. So the outlook is good after 1 to 3 weeks and it should go away. Now, that was the medical part. If you were here for medicine, then you can go directly to the next part of medicine, to chronic bronchitis. We will do now, I know it again, standing yoga. If you participate in the standing yoga, then it's better if you are on risk. The feet are standing together and we're breathing in and lifting the arms up. And breathe out the arms again down. Eagle swings. Again in the arms up. And out the arms down. Let's make power yoga out of it. Breathe again in. And out the arms down. Again in the arms up. Now move to the side for police officer. Breathe again in the arms up. And out move to the other side. Breathe in the arms up. Make an inch space between the toes, between the feet, and breathe out on the arms to the side. Breathe again in the arms up. And out and we're sinking down. Breathe again and come halfway up. Higher up. And come up again. And out of the arms to the side. Breathe again in the arms up. And out and down. Breathe in, come halfway up. Higher up. And up. And the arms down. We're doing a crab in the morning. Legs wide apart. Breathe in, lift the arms up. And breathe out. Shoulder blades together, open the chest to the sky. Breathe in the arms up. And out again down. Breathe in the arms up. Close the feet. Bring the hands together. Breathe in. And out, lean back, read in the wind. Breathe again in into the middle. And out, and lean again back. Again into the middle. And out over to one side to follow the wind. Breathe in into the middle. And out over to the other side. Breathe in into the middle. Make an in space between the feet and breathe out and out the arms to one side. Breathe in the arms up. And out to bring the arms over the side down, be going down into the chair. Breathe in, come up again. And out on the arms to one side. Breathe in and up again. And out again down into the chair. Breathe in, come up again. Breathe in, come hard up. And now breathe out and come down into the full chair. Breathe in, come up again. All on tiptoes. And out and down. Again in and up. Now the arms over the sides down, we're hanging down. You're doing mama. Breathe in, bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. In and change. And out and stretch the left leg. In and change. And out and stretch the right leg. Breathe again in and the middle. And out. Just stretch down. Breathe in the penguin. Lift the right hand up to the sky. Bend the left knee and look over the right shoulder to the right hand. Breathe in and bring the arm in. And out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in the arm down. And out and down. You're doing the penguin. Make a the space between the toes. Between the feet. Just the way to the heels and breathe in and go down. And out and come up again. Again in and down. And out and up. And the last time down. And out and up. Breathe again in. And out. Just keep normal breathing. Whichever she's comfortable. Take hold on the elbows and gently rock from side to side. Hands again down, feet together. And breathe in, come halfway up into monkey half lift with a straight back. Out and down. In and halfway up. Out and down. Now in the up dying swan, arms up, and the arms again down. Let's do something. The toes are pointing to the outside. If you have something in the knees, this exercise a bit more for the knees. And also for the back, breathe in the arms up. And breathe out, go down, place the elbows against the inside of the knees, and breathe in and straight up and upper back. Now breathe out, tuck the pelvis in, come with the crown of the head first upwards. The arms down, and breathe in and the arms up. And out and down. Elbows against the inside of the knees, breathe in and straighten up. And out, tuck the pelvis in and come with the crown of the head first up, and one more round, breathe out. And again in. And out. Elbows against the inside of the knees, breathe in. And out, come with the crown of the head first upwards, and the arms down. Stretch your fingers, legs shoulder wide apart, intertwine the fingers behind the back, over to one side, breathe in, shoulders back, turn up. And out over to one side, and the chin down to the clavicle. Breathe again in. And out, pull the arm in and the shoulder down. Breathe and lift the gaze and turn the head over to the first side, arms over to one side, bring the chin down to the clavicle, breathe again in. And out, pull the arm in and the shoulder down. Breathe and lift the gaze and turn the head back into the middle. The sky hugger, legs are standing together, breathe and lift the arms up. And out, lean back, open the arms wide. And in the middle. Out, lean back. Breathe in, arms together and down, and we're doing the cactus collecting its sticks in the evening. Breathe in, lift the arms up, bring the hands to touch, now the hands down to heart center. That was the power you. I thank you very much, and next time. Hi and welcome. I'm trying to learn medicine. Today bronchitis, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's the Augenrisk. And this is no medical advice, we're just learning about it, and this is about an illness and about internal anatomy. Yes, and this is part 2. And now we're trying to learn it in a presentable manner, so you can just say, what is bronchitis? Now bronchitis is inflammation of the bronchi. After the trachea goes down, they become bronchi. And they are inflamed. We haven't done chronic bronchitis. But we're staying by, so this is now called bronchitis. Okay. It has a wheezing, breathing, persistent core. People can have wheezy breathing sound and cawing, and phlegm which can contain pus, giving it a yellow or greenish tinge or color. Also to have people loss of appetite, headache and fever oftentimes. 1 to 3 weeks. If the people are overall healthy, the course of a disease or illness is mild. It can be caused through a number of different germs, viruses and bacteria, which invade the lining of the tubes, leading to the lungs and set up inflammation. And by bronchitis, this lining of the tubes of the bronchi are swelling, and that narrows the tubes. And then outpouring, that doesn't mean to call it out, that is meant inside of the tubes, there's the phlegm poured out. And now it gets more stuck. And this is made worse by outpouring of mucus, of phlegm. The irritation causes the core. A general upset. It can be serious for babies, older people, and probably also for people with an issue with health or whatever. Treatment in the home. Generally, it isn't. We don't want to get so much into treatment. We don't really want to give people medical advice. A little overall, just to give a better broad overview of the disease. So basically, rest is advised. But also to contact the doctor if there is art. We don't want to give medical advice. But it would be that also to conduct the doctor if it is more severe or breathing becomes labor, or breathing becomes difficult. I don't know what labor means. And also pain in the chest. When is it wise to rest? And when the thing which the actual video, the actual thing what we want to do, but we want to do a video saying this one thing, because to do not physical activities decreases the possibility of drawing the infection deeper down into the lungs and causing pneumonia. As prevention, it is advised not to smoke and not to be in smoky atmospheres. Not to sleep in cold bedrooms and avoid contact with people with colds and chest infections. Do we name something of that? We are more here for the disease itself. Okay, I think we have it. Let's look if I can do it. Wheezy breathing and cawing, persistent cawing. Wheezy breathing, persistent cawing, and phlegm may containing pus. Wheezy breathing, cawing, and maybe phlegm, which can be then, because of the pus and the phlegm, yellow or greenish. It is caused through a number of germs and bacteria and viruses, and they can cause inflammation of the lumen. Is that right? Yes, inflammation of the lumen. Lumen swell, and they will swell of a bronchi, after the trachea comes the bronchi, and they will swell, and that narrows the air path. And then there's also a lot of mucus. Phlegm, there's not a difference. I think mucus is always there, and phlegm is not always there. Is that the thing? And mucus and phlegm, I think I can say it like that, is produced and also eventually pus. And this all these irritations cause when the cawing. If for most people, for healthy people, it lasts for around 1 to 3 weeks. If people have health issues, I don't find the proper words, but it is the proper description. Having other diseases which affect the general health. If for people who have a burden for another disease, it is more problematic, and for babies and for elder people. Generally, it goes away with rest after 1 to 3 weeks. But again, there's no medical advice, and that is according to Keith Hodgkins' family medical advisor. And not to do physical activities, because then it could be drawn down deeper into the lungs and causing pneumonia. Wheezy breathing, persistent caw, and phlegm containing maybe pus, which gives us the yellow. Do we try it? It's just these 3 things. Yes, and then also appetite, headache, fever. When description, it is inflammation of the lumen of the bronchi, and outpouring of mucus, phlegm, and other secretions. And then it can be problematic for babies, elderly, and people having other health issues. Generally, it goes away after 1 to 3 weeks of rest. I think Impingement is started now. That is a wise idea. bronchitis, that is an illness oftentimes being brought about. Is it an illness? I think it's an illness. Bronchitis is an illness often caused through germs, viruses, or bacteria, and it causes the bronchi, after the trachea come the bronchi in the lung, to be inflamed. They swell a bit, and then also secretions, mucus and phlegm are produced overly, and that causes the cawing. Symptoms are wheezy breathing and persistent cawing, and also phlegm, maybe containing pus, which gives them a yellow or greenish tint, and also headache, fever, and loss of appetite. And normally, by healthy people, it goes after a mild course after 1 to 3 weeks away. It can be problematic for people who have other health issues and for babies and for elder people. If physical activities are done while people have bronchitis, then it can be drawn down deeper into the lungs and cause pneumonia. And that's not good. And that is according to Keith Hodgkin's Family Medical Advisor, page 103. And this is no medical advice. It wasn't the most. Let's see. Maybe we should do it just in the next one, because I wanted to do the other video the other time. Let's just do it. I'll start the camera. I don't know. Did I set it all right? I don't know. Now, why not to do physical activities? That's the question. The answer is this decreases the possibility of the infection being drawn down into the lungs and causing pneumonia. Okay, what was it now? Keith Hodgkin's. Hodgkin. Keith Hodgkin. To limit physical activity by bronchitis is advised because this decreases the possibility of the infection being drawn down into the lungs and causing pneumonia. After the trachea come the bronchi, and these bronchi are inflamed by bronchitis because of a germ, a virus, or bacteria, and when they swell, the lumen of the bronchi swell, and that narrows the air path, and also phlegm is produced, and that is bronchitis. And now by bronchitis it is advised not to do physical activities because this decreases the possibility of the infection being drawn down into the lungs and causing pneumonia. And that is according to Keith Hodgkin's Family Medical Advisor, page 103, and this is no medical advice. Now we have it. I'm going to stop the camera. And we're going to do the short impingement training. If you were here for medicine, you can go directly to the next part. We will do now the short impingement training. If you participate in the short impingement training, then it's better that your arm is good in stable stance, and we're doing forward shoulder circuits. Up and front, down, and back, up, front, and down. Last one. And backwards, front, back, and down, and again. And now long arms, strong fists, and go as far back as you can with the shoulders, as high up as possible, and in front, and down, and back, up, and front, and down, and now again, up, and back, and down, and front, up, and back, and down. Now into the knees, hinge forward with a straight back, let the arms hang, and pinch the scapulars together with effort. Make fists, lift the arms up and stand pinch the scapulars together. The arms again down, and the shoulders. And another time, pinch the scapulars together. Third. Make fists, lift the arms up, and still pinch the scapulars together. Now release, onto the scapulars. Next exercise, into the knees, hinge forward, foot down back, let the arms hang, make fists, turn the arms to the inside, lift the arms up and bring them together. Bring the shoulders back, down. Shoulders down and together, shoulders up and together. And release. And now second round, we are just bringing the arms up and nothing more. Just observe what the scapulars are doing. And now the arms to the side and in front. The scapulars should go now together and now around with it a last time. And in front. And now we are just doing the stretching. One arm in front, the shoulder is back and down. Pull the arm in, have flat fingers, try to relax the arm, go with back with the shoulder and turn the palm up to the sky. Time lift the other arm, shoulder is back and down, pull the arm in, have flat fingers, try to relax the arm, go a bit back with the shoulder, turn the palm a bit up to the sky. This was a short attention today. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine today, Achalasia of Cardia, and after we've done it, we're going to do backstretching, and if you participated in the backstretching, then specifically on risk. And this is part 2 of the Achalasia of Cardia, and this is no medical advice, we're just learning about it, and we're talking about internal anatomy and a disease and an illness. Achalasia of Cardia is a rare disease in which the muscles of the esophagus or gullet fail to work properly. I think it is spoken of the esophagus. Maybe it is not the esophagus, but the esophagus. I think it is the thing through which the food from the mouth comes into the stomach. Normally, when food is swallowed, these muscles automatically set up a wave-like movement. The muscles of the esophagus. A wave-like movement to the esophagus. Achalasia of Cardia is a rare disease in which the muscles of the esophagus fail to work properly. Normally, when food is swallowed, these muscles automatically set up a wave-like movement to the esophagus that pushes the food down towards the stomach. The sphincter, that is a muscle ring, at the lower end of the esophagus relaxes and lets the food through. In achalasia, the esophageal muscles and sphincter do not respond to a swallow, and so food and saliva are retained in the esophagus, which becomes swollen. Okay, the muscles of the esophagus do not start with a peristalsis movement, which pushes in a wave-like movement the food down into the stomach. Now, by Achalasia of Cardia, I'm trying to learn it now and present it now. The swallowing doesn't ignite the peristalsis movement and the relaxing of the sphincter at the end of the esophagus, and the food stays in the esophagus together with the saliva, and that causes the esophagus to get swollen. Symptoms of difficulty in swallowing liquids and solids. We want to concentrate now, we're preparing a little presentation. We want to concentrate on the disease itself, not so much on the treatment. Difficulty in swallowing, food felt to be stick behind the breastbone, chest pain. The symptoms are from chest pain to to a feeling of the food got stuck and to difficulty of swallowing. Regurgitation of undigested food and saliva. And food and saliva may be breathed into the lungs, especially when the patient is lying in. This causes cawing, breathlessness, and chest infection. We're going to do it. We're going to concentrate on these parts mostly. And the food can be breathed in a bit into the lungs, and it can cause cawing, breathlessness, and chest infections. Cawing, breathlessness, and chest infections. Cause now known as no cause is known, but this book is from the 80s. It can lead to pneumonia and bronchiectasis. We had bronchiectasis. What was that? It was an increase in size of a bronchi. Bronchiolitis is inflammation of the bronchioles, and bronchitis is inflammation of the bronchi. Now, what is it now? we have to do one video and where we're going to say what is what. Bronchiectasis, an increase in the size of the lungs. Bronchitis, inflammation of the bronchioles, and bronchitis, inflammation of the bronchi. Bronchioles, bronchiolitis, and bronchitis, bronchies. Bronchies, bronchitis, bronchioles, bronchiolitis. And bronchiectasis, whatever, increase in size. It can cause pneumonia, bronchiectasis. So, bronchiectasis, pneumonia, bronchiectasis, and an increased risk of esophageal cancer. Treatment in the home, do they say eating smaller meals, sitting up, take frequent drinks in small quantities? We're not going to say these treatments. If the symptoms persist longer than a week, then consult a doctor. Exclude more serious causes when done. X-rays. Examination with an endoscope. Maybe treatment may require an operation to cut or stretch the muscles of the lower esophageal sphincter in order to allow food to pass into the stomach. Prevention, none is possible. Outlook, reasonable, good with treatment. So we have one treatment here. Treatment may require an operation to cut or stretch the muscles at the lower esophageal sphincter in order to allow food to pass into the stomach. We're not going to say that. Okay, what we're going to say is, first there is the esophagus, and through that the food comes from the mouth and to the stomach. And normally, and by Achalasia of the Cardia, the swallowing doesn't properly ignite the peristalsis movement, which in a wave-like movement pushes the food down and through the sphincter, we have to name it also, the muscle during the sphincter at the end of the esophagus, into the stomach. And that can lead to a feeling of chest pain, of food getting stuck. Yeah, but it's actually that the food and saliva is retained, and it leads to a feeling of food getting stuck behind the breastbone, chest pain, difficulty swallowing, and regurgitation, and it can be breathed and then through the trachea into the lungs, and that can cause cawing, breathlessness, and chest infections, and complications of that, or Achalasia of the Cardia is. So that would be, let's try it again, that the swallowing doesn't, that's not really the problem. I think the problem is somewhere in the trachea. That's why the operation, the cut of the sphincter. The swallowing doesn't properly ignite the peristalsis movement, of which the food is pressed down, and but the peristalsis movement isn't properly done. Now, what is now actually the problem? Is it just the sphincter? Can't be properly done. The sphincter at the end, and the sphincter at the end is not relaxing. It's not relaxing, and doesn't let the food properly pass through. Causes also for unknown, as well as any prevention measurements. There are treatments like advising to eat smaller meals, sitting up, and possibly surgical operational, to make a cut or stretch at the sphincter at the end of the esophagus. Now we're 7 minutes in. We have just time for one take. We don't want to do it under pressure. So we're going to do it next time. If you're here for medicine, then you can go directly to the next part of medicine. There we will try to say what I just said down in one presentation, record it in a separate video, and publish that separate video separately, and have it for us ourselves, so we have this information here in audio video format with our own words. If you stay here and participate in the backstretching, then it's better at your own risk. Good, and step it stands. And we're bringing the arms up. And breathe out, we're going over to one side. Breathe again in. and out back into the middle. Again in, and out over to the first side. Out my rib cage, and breathe out into the middle and the arms down. Now no one sees back rupture. Breathe in, and out of one hand slides down the leg, and wherever shoulder stays down. Breathe again in, and out, and we're taking one arm over. Breathe again in and out my rib cage, and out back into the middle. Breathe again in. Out one hand slides down the leg, the other shoulder stays down. Breathe again in. And out we take one arm over. Breathe in and out the rib cage. And breathe out back into the middle. Next exercise. The Aortic Aortic feet are standing together. Breathe in the arms up. And breathe out one hand down. Breathe in and reach. And breathe out. Again in. Out the other hand down. Breathe in and reach. And breathe out. Next exercise. The feet are keep standing together. We're breathing in, letting the arms up. And breathe out, arms down over the chest to the sky. The crab in the morning. Breathe in the arms up. And breathe out the arms down. Breathe in the arms up. And now the hands together and breathe out and lean back, very reasonable bend. Breathe in into the middle. And breathe out, leaning it back. Breathe in into the middle. And out, lean to the side, a third movement. Breathe in into the middle. And out over to the other side. And now we're doing screw, intertwine the fingers up across the arms and reach high. Breathe in. Breathe out. Intertwine the fingers the other way around. Breathe in and reach high. And out the arms down. Now for Marco. Legs shoulder width apart. Breathe in with the arms up. Breathe out, go back, crab in the morning. Draw the shoulder blades together. Breathe in the arms up. Over cross the arms, intertwine the fingers to reach high. Breathe in. And breathe out, reach in front and all over back. Again, in the arms up. And out and down. Again, in the arms up. Across the arms, intertwine the fingers reach high. Breathe out, reach in front, all over back. Again, in the arms up. And out and down. Feet are standing together. We're doing a skyhugger. Breathe in with the arms up. And breathe out, lean back, open the arms wide to the sky. Breathe again in. And out and lean again back. Breathe in with the arms up. And breathe out the arms down. And we're ending with the cactus connecting instincts. Breathe in with the arms up. Bring the hands to touch and now the hands down. That was the backstretching. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today, the Achalasia of the Cardia. And after we've done it, we're going to do squat training. And if you participate in the squat training, then it's better your arm risk. And this is part 3 of the Achalasia of the Cardia. And this is no medical advice. We're just trying to learn about it. And we're talking about internal anatomy and a disease or an illness. Okay, we are pretty close to be able to say shortly what Achalasia of the Cardia is. I don't know what a Cardia is and what Achalasia is, but okay, Achalasia of the Cardia. Now there is the oesophagus, and from the oesophagus the food comes from the mouth into the stomach, and at the end of the oesophagus there is the sphincter, muscle ring at the end of the oesophagus. The oesophagus is a pipe and at the end is muscle. Now, now the problem with Achalasia of the Cardia is that the swallowing does not properly. Is it not a problem that the swallowing is not started? I think it's that the muscle ring is. Let me explain how it is normally.
And by achalasia of the cardia, the response to the swallowing of the esophagus to push the food in the peristalsis and the wave-like movement downwards called peristalsis, and the relaxation of the muscle ring, the sphincter at the end of the esophagus doesn't work properly, and the food gets retained through the salvia in the esophagus. That gives a feeling of pain in the breast and also problems of swallowing the food and drink. And the food felt to be sticking, and regurgitation of undigested food and drinks is also possible for food and saliva. Regurgitation, okay, but what do we have? Pain, we have the breastbone, so problems of swallowing of drinks and food, and a feeling of food getting stuck. Chest pain and food felt stuck behind the breastbone. And now it can also happen then that it is a feeling of food getting stuck behind the breastbone, chest pain, and difficulty in swallowing, and also regurgitation of food and saliva. Regurgitation of food and saliva, and also the food and saliva is retained in the esophagus can be breathed in into the lungs, and cause melancholy, breathlessness, and chest infections. And complications of all that is pneumonia and bronchiectasis. And also is then high increased risk of esophageal cancer. And I could say that, right? The cause is unknown, so no prevention is possible. There's a general advice to eat smaller meals, seated, and there are surgical possibilities like making a cut or a stretch into the sphincter at the end of the esophagus, so relax the situation, what do we say, to allow food to pass in the stomach. I have a second camera which I'm going to start now. And let's try to say what we have time for 2-3 takes. Achalasia of the cardia. The food comes normally from the mouth of the esophagus through the muscles, ring the sphincter at the end of the esophagus down into the stomach. But by achalasia of the cardia, that doesn't happen properly. Normally, the swallowing makes the proper peristalsis movement, which pushes the food down in wave-like movement and through the muscle ring, the sphincter down into the stomach, but it doesn't happen properly, and the food and the saliva gets retained in the esophagus. And that causes a feeling of pain and also a feeling of food getting stuck behind the breastbone and also regurgitation of food and saliva. And it can happen that the retained food and saliva gets be inhaled into the lungs and cause then pneumonia, chest infections. And all over these complications are pneumonia, bronchiectasis, and an increased risk of esophageal cancer. The cause is unknown, and so also no treatment, no prevention. As treatment, there are advice to make smaller meals, seated up, eaten, and there are also surgical options like making a cut or a stretch into the sphincter at the end of the esophagus to let the food better pass. And that is according to Keith Hodkins, Family Medical Advisor, page 60, but this is no medical advice. Now I'm going to start the camera. I forgot to mention 2 things. I don't think there's one. Right now, we're going to do one time, maybe an overall, there's a fair more information to all of it. But for now, this is good. We have what achalasia of cardia is quite good. So this was the medical part. If you are here for medicine, you can go directly to the next part of medicine. We will do now the squat training. If you stay and participate in the squat training, then it's better to be honest. We are bringing one leg up, and we're doing the greeting mushroom. Foot up and down, up and down, up and down. Let's continue with the greeting mushroom. Circle the foot, and also in the other direction. And the other leg up, and do the greeting mushroom. Bring the foot up and down. And the greeting mushroom, circle the foot, and the other direction. And now let's do the chain stop over to one side. The foot are pointing forward, the foot are pointing forward, and we're stretching the inner side of the leg. And we're going to the other side. The Toes are pointing forward and we're stretching the inner side of the leg. And we're doing the mantis go from side to side. Now to the squats. We're just doing 10 squats, legs wide apart, and we're going down into foot squat. That was the first one. And the second one, we're doing 12. So it was the third one, and now the fourth one, and the fifth one, and the number 6, and now we're having the half, and the 7, 8, 9, and last 4, 10, 9, so that's 3. And now to the next exercise. It is my 6-back squat squeeze. Leg wide apart. We're going down with the quarter squat. Press against the top of the leg. Only with one arm. Now the other side. Now go down into half squat and press on the middle of the upper leg. On the other side. And down into 3/4 squat and press close to the knee. Other side. And we come up again. And now the fastest giraffe of a water pond. We're going down into 3/4 squat and we're pressing against the knee. And we're going towards the knee. And on the other side. And again. And again. And the last 2. And the last exercise, the propeller. Legs wide apart, down into foot squat, arms to the side, elbow to one side, press against the leg and look up to the hand. Little bend in the elbow. To the middle, out to the other side, press against the leg, look up to the hand, little bend in the elbow. Into the middle. That's also spot training. Now to the stretching. So first the walker. And then let's do the garden gnome. Pull the pelvis in. And move the leg from left to right. Other heel to the ground. Pull the pelvis in. Move the leg from left to right. And the crane. Take the leg at the ankle. Make a straight break and point the knee down to the floor. Other leg, take it at the ankle, straight back, point the knee down to the floor. What was it? No, let's end with a strong ignite. Breathe in. Out. Another round, breathe in. Out. Our last one. Out. Breathe in, close the legs. And out. That was my squat training. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine today, chronic bronchitis, and after we've done that, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, that is better at your own risk. And we're talking about an illness and disease and internal anatomy, and this is no medical advice, we're just learning about it. Chronic bronchitis. This is characterized by disorder of a leaning of the bronchi. Okay, the trachea comes down, so people breathe in from the trachea, and then the trachea comes into the lungs, and there it branches into the bronchi. Now, and chronic bronchitis is characterized by a disorder of a leaning of a bronchi. The normal mechanism that keeps the tubes clear and free from obstruction is destroyed. The tubes become narrowed. Okay. These pipes, these bronchi, have leaning on the inside, and they are kept clear and free normally from getting obstructed, but now this doesn't work anymore, this mechanism, and they become narrowed. Or are narrowed because of there's something in it. The disease is usually slowly progressive, leading to destruction of the delicate air sacs of which the lungs are composed. I came across the word delicate previously.
That seems to be part of the name, but I don't really understand it. So the disease is usually slowly progressive, leading to destruction of the delicate air sacs of which the lungs are composed. Many of the remaining air sacs become distended, emphysema, to fill the destroyed areas. I don't know what distended means. This stops them functioning and oxygenating the blood. These changes cause obstruction to the flow of blood through the lungs, put a strain on the circulation, and may lead to heart failure. A chronic bronchitis can lead to heart failure. Is that what we're saying here? Okay, these air sacs, this alveoli probably get distended or whatever. They don't work properly anymore, and they can't oxygenate the blood anymore, and also they're obstructing the flow of blood through the lungs now. And that puts a strain onto the whole blood circulation up to a heart failure. It is still a common condition, causing a great deal of suffering and death in the United Kingdom. This book's written in the United Kingdom. It mainly strikes those over 40, men more than women, particularly those in dusty jobs. And this book is from the 80s. Chronic bronchitis. Okay, so in the 80s, it was or is still a common condition, and people who work in dusty areas are more likely affected. Symptoms: chronic core with spit, usually white and frothy, wheezy breathing, increasing breathlessness, at first experienced with mild exertion and becoming more and more marked until it is present even at rest. Okay, breathlessness. First only if there's mild activity done, and then even if a person is at rest. Also, a series of attacks of acute bronchitis. Acute bronchitis is inflammation of the bronchi. That happens most of the time through germs, viruses, and bacteria. And chronic bronchitis is an obstruction of the alveoli. Also of the bronchi, but the alveoli also stop to work properly, leading to destruction of the delicate air sacs of which the lungs are composed. A general feeling of illness and ill-defined chest pain. Causes. The causes are not fully understood, but the more readily identifiable factors are air pollution, particularly by sulfur dioxide and waste gases produced by industry, and where open fires are used in the home. Smoking increases the risk of infection and the damage done by it. Air pollution and also sulfur dioxide waste gases, and also open fires in the home, and then smoking. Combinations: emphysema, that is this distending of the alveoli, heart failure, and pneumonia. Treatment in the home: rest in a warm room, avoid moving from a hot to a cold atmosphere. When to consult a doctor: if there is a persistent core over a period of 2 or 3 weeks. If there is recurrence of a winter core. What a doctor might do: prescribe medicines to help the core and steam inhalations or antibiotics. Prevention: keep away from smoky or dusty environments. Do not smoke. Outlook: once the process has started, it cannot be stopped, but stopping smoking slows it down. Okay, again, this book is from the 80s, maybe there were more treatments developed. Okay, with other words, acute bronchitis and chronic bronchitis are two completely different diseases. If that's the case, I suggest they should go by a different name. Okay, chronic bronchitis. The lining of the bronchi are disordered, and now they're not so clear and free anymore, and we're getting obstructed. It's slowly progressive, and also the air sacs are becoming distended. to fill the destroyed areas. And now we don't function anymore so good, and breathing gets harder, and it can lead up to heart failure. Now that was chronic bronchitis. If you were here for medicine, you can go directly to the next part of medicine. We will do now the short impingement training. If you stay and participate in the short impingement training, then it's going to be almost go to step Z, and we do forward shoulder circuits. Come back, up, and front, and down. We had said to acute bronchitis that if a person doesn't rest and does sport, for example, it can become pneumonia. They did not say that it becomes chronic bronchitis. This seems to be actually two separate illnesses. Next exercise. We make long arms, strong fists. We go as far back as we can with the shoulders. High up and in front, and down, and back, up, and in front, and now backwards. And down, front, up, back, and down. Now, next wider part, go a bit into the knees, hinge forward with a straight back, let the arms hang, and pinch the shoulders together, the scapulars together. Now make fists, lift the arms up instead, pinch the scapulars together, with effort. And release. And the same time, pinch the scapulars together, with effort. Make fists, lift the arms up instead, pinch the scapulars together. And release. And next exercise, into the knees, hinge forward, this time with the jump back, let the arms hang, make fists, let the arms to the inside, and let the arms high up and bring them together. Straighten up, bring the shoulders down and together. Okay, the arms high up and together, shoulders down and together. And release. And another time, into the knees, hinge forward, round back, let the arms hang, make fists, the arms to the inside, arms high up and together, straighten up, bring the shoulders down and together. And release. Next exercise. Lift the arms up, and all we're doing is to observe what the scapulars are doing. If this exercise causes pain, then don't do it. The humerus of the upper arm should come just from this upwards. Out, there's the scapulars protruding and causing the impingement. Arm is at the outside, and bring the arms in front, and shoulders back together, and again the arms in front. And that was last time. Now we're weightlifter, put in stable stance, long arms, strong fists, bring the shoulders down and together, now turn the arms to the inside. Arms to the outside, shoulders down and together. And change again, arms to the inside, shoulders down, together. To the outside again, shoulders down, and together. And release. Something similar, arms at the side, hands onto fists, fists in front, arms in front. Bring the arms in front into pronation, the shoulders down, and together. And change. Arms back, and this time also shoulders up and in front. And the arms again in front, shoulders down, just together. Change arms back, shoulders up and in front. Lift the arms up and shoulders and release it down. Again, the arms up and shoulders up and release it. And the last time, arms up, shoulders up and releasing. Now with a pretzel curl, arms together, bit down to the outside, and again down. And it was the last time. And now with sundial, you can also use a tennis ball or something else. Have it with a long arm to the outside, then fall down and try to catch it again. And wander slowly in front. With the other arm. Now stretching. One arm in front. Shoulder is back, down. Pull the arm in and have flat fingers. Try to relax the arm. Go a bit back with the shoulder and then the palm a bit up to the sky. And the other arm in front. Shoulder back and down. Pull the arm in, have flat fingers. Try to relax the arm. Go a bit back with the shoulder, turn the palm up to the sky. And that was a short and training. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine, today brucellosis. And after we're done with it, we call it blue shoulder impingement training. And if you participated in the shoulder impingement training, then it's better at your own risk. And brucellosis is a disease, and we're probably talking about internal anatomy and diseases. And this is no medical advice, we're just learning about it. Brucellosis. This is chiefly a disease of cattle, pigs, and goats, which is sometimes caught by humans. Okay, brucellosis is something which cows, pigs, and goats have, so animals, domesticated animals, but also humans can get it. The disease is not very common in Britain. This is written in a Britain book. The disease is not very common in Britain, where the type found affects cows only. And this book is 40 years old. Affects cows only. I know that there was no case, I think, in the last 20 years, I think. At least not cows. There were 2 cows found, but they were born before. It was a little outbreak around 2000. But whatever. The disease is not very common in Britain, where the type found affects cows only. It is caused by a bacterium called Brucella abortus, which often causes the infected cow to abort. Okay, there is a bacterium, and it can be had by animals, and cows can have it, and the bacterium is called Brucella abortus, and it leads to an abrupt abortion of the calf of a cow. I don't know what it's called when it's still inside of a cow. It is also known as undulant or abortus fever. Brucellosis can be caught by people such as farmers or vets who are in contact with infected animals when they are calving or having a miscarriage, or by people working in slaughterhouses. Okay, people basically working together with cows can get that. But possibly also, that is the British perspective, so in other countries maybe also by other animals. It can also be caught by drinking milk straight from an infected cow without the milk first being pasteurized or sterilized. Okay, if the milk is directly drunk from the cow and not pasteurized or sterilized, I don't know exactly what it means, but it has something to do with cooking the milk. It is not likely to be caught by anyone else. Okay, brucellosis is something which can be caught by people working together with farmers or drinking directly the fresh milk of cows. Symptoms. Fever in recurrent attacks. I think this is now for humans. Fever in recurrent attacks, headache, sweating, fatigue, weakness, and lassitude, joint pains. Okay, fever, headache, sweating, fatigue, weakness, lassitude, joint pains. Incubation period 7 to 21 days. Duration usually 6 weeks or longer without treatment. Causes bacteria. Complications Not usually any, but very rarely the infection may affect the testes, lungs or hair or heart. Testes, lungs or heart. Treatment in the home, none. When to consult a doctor? If any of the symptoms appear in someone who is in contact with cattle or goats. Okay, if someone was in contact with cattle, with cows or goats, they should go to the doctor. Do they say if they have fever, headache, sweating, fatigue, weakness, lassitude, joint pains? I don't know what lassitude is. What the doctor might do? Take blood tests to confirm a diagnosis, prescribe the prolonged course of antibiotic tablets, give a short course of injections. Prevention. This depends upon eliminating the infection from cattle. Female cows can be immunized against brucellosis, but there is no necessity for human beings to be immunized. Immunized? Immunized. To be made immune against it. There's actually something for the female cows. Farmers are obliged by law to slaughter infected cattle. Okay, they can, as long as they didn't have caused that bacterium, Brucella abortus, they can be immunized against it, but if they have it, they have to be killed, according to law. Do not drink milk until it is pasteurized or sterilized, do they advise. Outlook. With treatment, health should return completely to normal. Is there a second disease or is there the one? Outlook. With treatment, health should return completely to normal within a few weeks. Without treatment, the infection may recur over many years and the affected person may feel unwell, weak and depressed over a long period of time. That is very interesting. There's no another disease which I think of or not. It's very interesting. Brucellosis. It can cause the person to be over years unwell, weak and depressed. Okay, that is very interesting. I thought it would kill the person, but maybe that's another disease. And I thought it would happen rather quickly, not really fast, but within a few months. They don't say that. Okay, the outlook they say of brucellosis, with treatment, health should return completely after 6 weeks or something, and without treatment, then the infection may recur over many years and the affected person may feel unwell, weak and depressed over a long period of time. That is interesting. We have to get at some point the difference between bacterium and the virus. What if that's the reason why this bacterium can stay for a long time? But no two other things, I think. I don't know what to say the first thing. But I read something, because I'm going to say it, because we're also after that. That's something with carriers, that is also bacterium, or different types of bacterium living in the mouth, and they causing the carriers, the rotting of the tooth, or eating the tooth away. That's also a bacterium. And now the other thing, we were talking at some place about precipitate? No, what was it? Precipitation? Whatever the word. No, I heard someone using it, and it was someone doing a chemical experiment about carbon chloride, and the person said in the sentence, you can see nice precipitated the copper on the aluminium. So it actually just means precipitate, or whatever the word is. When it goes down, like rain and snow, all what is coming down from the heaven is the precipitation, or whatever the word is. But it can also mean to have an effect upon it. It was in that book, it was used in the book in that sense. It means to come down on that, to have an effect on that, or in the sense of meteorology, to snow and rain. It has an effect on it. It comes down on that. Okay, now we know whatever the word is. That word? No, that was a medical part. If you were here for medicine, you can go directly to the next part of medicine. We will continue now with short and painful training. If you stay and participate in the short and painful training, then it's better the honest. Put in stable stance. I'm doing shorter circuits. Go back, up, and front, and down. And one last time.
and backwards. And last time. And now long arms, strong fists, and we're going as far back as we can with the shoulders. And high up, and in front, and down, and again. Back, up, and front, and down, and not backwards. Up, and back, down, and front, up, back, and down. Next exercise. Go a bit into the knees, hinge forward with a straight back, let the arms hang, and pull the scapulas together with effort. Big fists, and lift the arms up instead. Pinch the shoulder blades together. Again down, and the shoulders down. And another time. Pinch the scapulas together with effort. Big fists, lift the arms up and pinch the scapulas together. Arms down, shoulders up. And now the she's jumper. Into the knees, hinge forward, make a jump back, the arms hang, big fists, the arms to the inside, lift the arms high up and bring them together. Straighten up and bring the shoulders down and together. Okay, the arms high up and together, shoulders down and together. And around into the knees, hinge forward, round back, with the arms hang, make fists, and the arms to the inside. Lift the arms high up and bring them together. Straighten up, bring the shoulders down, together. Nice. Now, lift just the arms up. If this exercise causes pain, then don't do it. We just want to relax the arms a little bit, and also we want to observe what the scapulas are doing. We want to observe we can see the shoulder blade happening or not. Now the arms at the side, and again, just observe what the scapulas are doing. They should go now a bit to the outside of the rib cage, back together. Again a bit in front, and a bit back. Next exercise, word lifter. Good stable stance. Long arms, strong fists, shoulders down together, and now turn the arms to the inside, arms and fists. Shoulders down, touch together, arms to the inside. Now the arms to the outside, shoulders down, together. And change again, arms to the inside, shoulders still down, together. And arms to the outside, shoulders down, together. Now the arms to the side, hands on back into fists, a bit in front, bring the arms into pronation in front, and the shoulders down, just together. And the arms back, and this time also shoulders are changing up and in front. And release, so to the other direction, front again. And the arms with the shoulders down, edge together. And change it last time. Arms back, shoulders up, and in front. And release. Next exercise, a shrug. Lift the arms up, and shrug the shoulders up, and down. Again, the arms up. Shrug the shoulders and down. Again, the arms up. Shoulders and down. And last time, the arms up. Arms up and down. And now the pressing cut. Arms together. Bit to the downside, to the outside, inside, and outside. Just a couple of times. And it was like last time. And now the sundial.
You can use also something else. Have it with a long arm at the outside. Let it fall down and try to catch it again. And we are. And now we're stretching. One arm in front. Shoulder is back, down. Pull the arm in. Have flat fingers. Try to relax the arm. Go a bit back with the shoulder. And turn the palm up to the sky a bit. And the other arm in front. Shoulders back, down. Pull the arm in. Have flat fingers. Try to relax the arm. Go with back of the shoulder. And turn the palm up to the sky. This was the shoulder motion today. I thank you very much. Next time. Hi, welcome. I'm trying to learn medicine today, Buerger's disease, and after we've done it, we're gonna do a bit standing yoga. And if you participate in the standing yoga, then it's very honest. And we're talking here about illnesses and diseases and internal anatomy and blood system. And this is no medical advice, we're just learning about it. Buerger's disease, I don't know, it's written Buerger's disease, Buerger's disease, whatever, Buerger disease. Severe and progressive obliteration of the small arteries. Okay, there are the arteries in the human body, and there are the big ones, and then there are the smaller ones, and they get severely and progressive obliterated. And it is mainly in the legs and feet, where the hands and arms are often involved. Okay, the smaller arteries of, that's interesting, why the smaller one? Okay, the smaller arteries of the leg and feet, and also maybe somewhere else, are getting severely and progressively obliterated. No, I'm not sure what the word obliterated means. It is seen mainly in men under the age of 40 who are heavy smokers. Okay, mostly male people do it have and under the age of 40, and most of them are smoking a lot. Cigarettes. Sections of the arteries and veins become inflamed and blocked. Okay, these small arteries somewhere in the legs and feet are getting inflamed and then blocked. New blood channels develop, but the condition recurs at intervals over several years. Okay, I think they are now obliterated, these arteries, or blocked, inflamed, and they're closed, and the body searches new ways, but they're also becoming then blocked. Symptoms. Pain in the feet and legs, which may occur at rest as well as on exertion. So pain in feet and leg. Cold feet, which may be discolored red or blue. So red or blue feet which are painful. Numbness also. Numbness of the feet. Burning, pins and needles of the feet. Just say discoloration of the feet and toes. So we're getting discolored red and blue and also discoloration of feet and toes. Recurring bouts of inflammation and pain in leg veins. Thrombophlebitis. Okay, pain in feet and leg, cold feet, red and blue feet, numbness of the feet, burning, pins and needles of the feet. Discoloration of feet and toes, recurring bouts of inflammation and pain in leg veins, thrombophlebitis. Duration. The symptoms will persist and will become worse without treatment. Causes. The exact cause is unknown. This book is from the 80s. Maybe more is known. The exact cause is unknown, though the disease is almost always linked with heavy smoking. I understand the sentence, but I think what I mean is that they actually, most of the times, if they have someone who has Buerger's disease, that person is a heavy smoker. That do they mean with linked to it. I try to understand what it actually means now.
complications. Gangrene, which would involve amputation. Whatever gangrene is, it involves amputation. And amputation is cutting off of. I said we're talking about medical amputation. And we're talking about medical things, so I'm talking a bit more loosely. Amputation, that means to cut the body part off. So not the legs or feet or toes. Treatment in the home. Stop smoking, do they say. Reduce weight to normal, so they're saying not be obese. Take particular care of your feet. Cut toenails regularly and carefully, and well-fitting shoes. And how does that help? I mean, maybe people should do it anyway, but whatever. Cut the toenails regularly and carefully, and well-fitting shoes. But also, not be overweight and stop to smoke. When to consult a doctor? If there are any of the above symptoms suggesting poor circulation of the feet and legs. Okay, you should consult the doctor, do they say, if there's pain in the feet and legs, cold feet, red or blue, numbness of the feet, burning pins and needles, discoloration, recurrent bouts of inflammation from both lipides. For those with established disease, for those with established disease, when there is any sudden change in circulation, or if the skin produces ulcers or shows discoloration. Okay, for people who have the disease already, brought forward to the doctor, and it's clear that they have Berger's disease. I don't get the name clear. If it's not Burger, I don't get the name clear. Okay, if there is the disease already registered, I don't remember what name, established, whatever, and there is a change, like getting an ulcer or discoloration. I don't really understand what an ulcer is, but I understand it as a bone which just does not heal. I came across ulcerative, whatever, both, or whatever it was. And I, for the first time I looked properly to the name, I was always focusing on the active because it's not active, it's active. Why is there no C? Why it's not ulcerative colitis? Why is the word of a disease not that there is something wrong and it is active? Like ulcerative colitis. Why is it not active? Why is it active? I was always focusing on that part, and now I saw the first word is ulcer, and I saw a little graphic to it. Is ulcerative colitis actually an ulcer? I don't know where it is exactly, but something in the intestines, in the stomach, maybe it's in the colon, colitis, somewhere in the digestive tract. Is that actually an ulcer? Is ulcerative colitis an ulcer? I thought it would be something completely different. If it actually would be an ulcer. Okay, where were we? If people get an ulcer, they should see the doctor. What the doctor might do? Arrange for an assessment of the circulation by ultrasound and X-rays using dye solutions injected into the circulation to outline the arteries. Okay, they're doing X-rays and ultrasound, and they, professionally in the hospital, are injecting something to see the arteries better. Give general advice, such as stop smoking. We're giving people advice to stop the smoke. And if gangrene has developed, whatever that is that can cause these amputations, or is beginning, he or she will suggest surgery to try to improve the circulation by cutting the nerves controlling the arteries. This is known as sympathectomy. That sounds horrible. And not a word. Cutting the nerves so that the arteries who are getting gangrene do not get this gangrene, which would lead to amputation. Prevention. Stop smoking, as this is the only known factor influencing the disease. But this book is 40 years old. Maybe we found something else. Outlook. Without treatment, the outlook is poor. Ulcers on the toes and feet may occur and lead eventually to gangrene that requires amputation. If smoking is abandoned, treatment usually improves the condition considerably. Actually,
Yes, but we said that they are blocked and then new ones form, which will get again obstructed or obliterated or whatever the word now is. Okay, if a person keeps smoking, at least with medicine for Adenitis, that person actually, it gets worse, it gets gangrene, ulcers, and they get amputations. But if they stop to smoke, the condition gets considerably better. Now, that was now this Burger's disease. If you were here for medicine, Burger's disease, you can go directly to the next part. We have now 6 minutes for standing yoga. If you participate in standing yoga, that is with your own feet are standing together and do the heel swings, prevent the arms down. And out the arms down. Again, in the arms up. And out the arms down. Again, in the arms up. And out the arms down. Now again the arms up. And out open to the side of the police office. Again in the arms up. And out open to the other side. And in the arms up. Make an inch space between the toes and breathe out to one side. Breathe in into the middle. And out and sink a bit down. Hide and seat plank, palm tree. Breathe again in and up. And out open to one side. Again in into the middle. And out and down. Again in and up. And out on the arms down. Let's do the crab in the morning. Leg shoulder before the part. Breathe in the arms up. And breathe out and draw the shoulder blades together. Again in the arms up. And out and draw the shoulder blades together. Breathe in the arms up. Bring the feet together. Hands together and breathe out and lean back, rigid in the bend. Breathe in into the middle. And out and again back. Breathe in into the middle. And out, lean onto the knees, make almost 2 inches. An inch space between the feet. Breathe in. And out, make a round back. Breathe again into the middle. And out, out back. A little back. Again in. And out, head, a little back. Again in. And out, round back. Again in. Now we can round back up, making effort to the back with the shoulder. Let's make one more exercise like that. Feet are staying 1 inch space apart, the arms up, without all the arms to one side. Breathing in into the middle. And out we're going down into the chair. Breathe in, come halfway up. Higher up and out and we're coming up. Breathe in a G-chai. Breathe out, open to the side. Again in. And out we go again down into the chair. Breathe in, come halfway up. Higher up. And out and again up. Now breathe in and come up onto tiptoes. And stay on tiptoes, breathe out and sink slowly down into the full chair. Breathe in and come up. And out and down. Let's do it one more time. And out and down. Again in. And now with the down diving dolphin, bring the arms over the sides down, the feet together, and again down. Another moment. Breathe in and the right leg. And breathe out and stretch the left leg. Breathe in and change. And breathe out and stretch the right leg. Breathe in and change. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Breathe again in. And out and both legs straight. Another penguin. Breathe in and lift the right hand up to the sky. Breathe out and bend the left knee. Look up the right shoulder to the right hand. Breathe in and hand again down. And out and down. Breathe in and lift the left hand up to the sky. Breathe out, bend the right knee. Look up the left shoulder to the left hand. Breathe in and hand in. And out and down. Now we're doing the pelican. Make a hand lift space between the toes. Shift the weight to the heels and breathe in and go down. And out and up. Take it in and down. And out and down. Make it in and down. And out and up. Now with trebuchet's counterweight. Take hold on the elbows and gently swing from side to side.
Hands again down, close to feet, and breathe in and come halfway up with a straight back on halfway. And out and down. Again, in halfway up, straight back, and out and down. Now breathe in, come up, way up, down this one. Hands together and hands down. Let's do the stretch of Venus. Leg shoulder before the body, define the fingers behind the neck, bring them over to one side, breathe in, shoulders back, turn up. And breathe out, turn the head slowly over to the side of the hands and the chin down to the clavicle. Breathe in. And out and pull the arm in and the shoulder down. Breathe again and lift the arm, the head. Bring it over to the other side and out the hands over to the side. Breathe again in. And out, head down to the clavicle. And pull the arm in and the shoulder down. Breathe again in, lift the gaze, back and down. And we're doing the sky hugger. Breathe in, lift the arms up. Breathe out, the arms back up the chest of the sky. Breathe again in, the arms up. And out and down. Again in. And out and down. Let's do the eagle swings, one of them. Breathe in, the arms up. And out and down. And last movement, the cactus collecting its stings in the evening. Breathe in, the arms up. Bring the hands to touch, lower the hands down to heart set. That was the standing yoga. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine, today bunion, and after we've done that, we're going to do shoulder and pin training. And if you participate in the shoulder and pin training, that is when at your own risk. And we're talking about a disease and an illness and internal anatomy. And this is no medical advice, we're just learning about it. Bunion. Bunion is a harmless swelling of a joint of a big toe. It is particularly common in middle-aged women and usually affects both feet. I'm right now thinking, do we have the teeth, the toes, one or two joints? The big toe has just one, like the thumb. I'm right now thinking, do we have, we must have. That's interesting. Okay, the big toe has its joint a swelling, but it's harmless. At least it's not cancerous, so I wondered already just a moment ago when I read it. It will be harmless. Okay, it's a swelling of a joint of a big toe. Symptoms. The joint gradually swells and the skin over it becomes hard, red and tender. Okay, it's swelling. Pressure from a shoe makes the bunion more painful, so it is not that harmless. It has consequences. The big toe becomes displaced towards the other toes of the foot. So it's more to the outside, this way. Duration. A bunion will be permanent unless treated. Okay, and will be permanent if not treated. Causes. Almost always badly fitting shoes. The feet of children, teenagers and young adults are especially at risk from such shoes because the bones of the feet are more easily deformed than those of adults and they feel less pain from the displacement. Why do they feel less pain? Okay, maybe because they are more easily to deform. Maybe this is okay. Okay, it comes from unfitting shoe work, is it shoe work called? From unfitting shoes. And it's specifically easy to get if the people are younger, because when the bones are easier to deform, and because they are easier to deform, there is less pain felt, so it has to pay more attention to it than the tennis. Treatment in the home. Wear loose-fitting shoes and protect the bunion with felt pads obtainable from a chemist. I don't know what it is. Wear well-fitting shoes, and then also maybe felt pads obtainable by a chemist. I don't know what it is. When to consult the doctor. If self-treatment fails to ease the discomfort. Okay, if the discomfort stays on and if the bunion becomes more inflamed and painful. Basically, if there is a bunion. What the doctor might do. Refer the patient to a hospital for an operation. Organize treatment by a chiropractor. Whatever. by a specialist
which is then necessary. Surgery, do we say? It would be interesting if there would be a way with exercise going back. All these things which happen through mechanical stress on them, why should they not go back? Especially if it's just in the one direction. Yes, it is a swelling. A swelling of a joint, this is interesting. I haven't thought about it. It is a swelling of a joint because the shoe does not fit. It is not that the shoe does not fit and there comes blister or something. It is that the joint becomes swollen because it does not fit. It could be actually really problematic, so it's not harmless. Preventions. Always wear well-fitting shoes. This is especially important in the case of young people, so wear well-fitting shoes. If any swelling or inflammation begins to appear on the big toe joint, protect it immediately with felt pads, then take extra care that those shoes fit. I still don't know what felt pads are. Felt pads, take care that the shoes fit. And if there's a swelling, then act immediately with not wearing these too loose, too tight shoes, and consult the doctor. Outlook. Self-treatment, surgery, or chiropody will nearly always considerably relieve or clear up the trouble. Okay, stopping to wear shoes which are too tight, if it acts early enough, that might help already. Surgery might help also, and chiropody might also help. Okay, bunion. If people wear too tight shoes, that can lead their joint to inflame and swell, and that is, if not acted against this, permanent. Now, that was the medicine. If you go here for medicine, you can go directly to the next part of medicine. If you are here for short and pinch training, then you can stay here. But if you participate, there's better the arm risk. What is it? Stance, and we're doing forward shoulder circles. We're going back with shoulders, up and front and down. And back. I just remembered when I know the name Bunyan from John Bunyan. The poet. In front, up, back, and down. And next exercise. Long arms, strong fists, and we're going as far back as we can with shoulders. Up and front and down. Again, back, up and front and down. And now up and back and down. Front and up and back and down. Next exercise. Legs wide apart, into the knees, hinge forward, have straight back, let the arms hang, and pinch the scapulars together with effort. Now make fists, lift the arms up, still pinch the scapulars together. And relax. And another time. Pinch the scapulars together with effort. Now make fists, lift the arms up, and still pinch the scapulars together. Now, relax. And a sheet jumper. Into the knees. Pinch forward. This time with the round leg. The arms hang. Make fists. Turn the arms to the inside. Lift the arms high up. Bring them together. Straighten up and bring the shoulders down. Hands together. Arms high up. Hands together. Shoulders down. Hands together. Release and then round into the knees, hinge forward, with the round leg, let the arms hang, make fists, turn the arms to the inside, lift the arms high up and bring them together, bring the shoulders down, hands together. And it sounds like hospital bounce. Okay, next exercise. We are lifting the arms up. And again down. Just the arms up. If this exercise causes pain, then don't do it. And to the outside. And in front. Just observe what the scapulars are doing. We should go now a bit to the outside. And a bit back together. Next exercise, we will lift up. Long arms, strong fists, shoulders down, together. Turn the arms to the inside.
And bring the shoulders down to the other side. Arms to the outside, shoulders down, hands together. Arms to the inside, shoulders still down a bit together. And arms to the outside, shoulders down. And ladies, similar exercise. Arms to the outside, hands onto fists, right in front. Turn the arms down in front, shoulders down, hands together. And switch, arms back, shoulders up and in front. Change, arms in front, shoulders down, and together. Change last time, arms back, shoulders up and in front. Now shrug, lift the arms up, and shrug the shoulders up, and release it all down. Again, the arms up, shrug the shoulders up, and down. And again, breathe in and lift the arms up. You can breathe in, shrug the shoulders up, and release it all down. Next exercise, pretzel curl. Arms together, a bit down to one side, again down and together. And the last exercise before stretching, the sun angle. Have something like a sock or tennis ball with a long arm at the outside, and then fall down and catch it again. Repeat it and hold it slowly. And on the other side. Now we mentioned stretching. One arm in front. Shoulders back, down. Pull the arm in, have flat fingers, try to relax the arm and go back with the shoulder and turn the palm a bit up to the sky. And the other arm in front. Shoulders back, down. Pull the arm in, have flat fingers, try to relax the arm, turn the palm a bit up to the sky. Let's position on today. I thank you very much and next time. Hi and welcome. I'm trying to learn medicine today, colors, and after we've done that, we're gonna do standing yoga. And if you participate in the standing yoga, then it's very honest. And we're talking about Independence disease, and medical thing, and about anatomy and things. And this is no medical advice, we're just learning about it. Colors. That is when an abnormal pressure or friction is continually exerted on an area of skin. The skin thickens to form a callus or callosity. I still don't know what a callus or callosity is, but it is a problem. The most common site is the sole of a foot beneath a prominent bone. In nearly all cases, there is an existing disorder of the foot. For example, the toes do not take the proper share of the weight borne by the foot, or the foot is turned inwards when walking. Okay, let's do it again where we know it happens most of the side at the other side of the foot. Callus is when abnormal pressure or friction is continually exerted on an area of skin. The skin thickens to form a callus or callosity. The most common site is the sole of the foot beneath a prominent bone. In nearly all cases, there is an existing disorder of the foot. For example, the toes do not take the proper share of the weight borne by the foot, or the foot is turned inwards when walking. Symptoms. The skin of the affected area becomes hard, thick, slightly raised and insensitive. duration. The callus remains for so long as the pressure continues to be exerted. Causes. Pressure from badly fitting shoes. That's the second time we have something with shoes. We had previously bunion. Bunion, that was swelling of a joint of a big toe because the shoes are too small. Treatment in the home. Wear well-fitting shoes. Padding in a shoe may help to reduce pressure and pain. I don't know what padding is. I think I know it. But I don't know what it's about. When to consult with doctor. If the callus are caused considerably discomfort, what the doctor may do, refer the patient for possible treatment of any underlying disorder of the foot. Yes, because we said in most of the cases there's another disorder of the foot. For example, that the toes are not taking the proper share of weight borne on the foot, or the foot is turned inward when walking. Prevention, well-fitting shoes, especially when young, because they said that by bunion, when people are young, the feet or the toes are easier to be deformed. Outlook, callus almost always clear when properly fitting shoes are worn. That was callus. If you were here for medicine, then you can go directly to the next part of medicine. We will do now the standing yoga. If you stay and participate in the standing yoga, then it's with the arms. The feet are standing together and we're doing the heel swings. Breathe in, lift the arms up. And breathe out, lift the arms down. Again, in the arms up. Again, in the arms up. And out on to one side, the body's off side. Again, in the arms up. And out to one side. Again, in. And out and down. Now breathe in the cup in the morning. And breathe out, draw the shoulder blades together and open chest to the sky. Again, in the arms up. And out and again down, draw the shoulder blades together. Again, in the arms up. Hands together. Breathe in and out, lean back, read in the morning. Read in the wind, in the arms up. And out, lean back. Again, in the middle. And out, and lean over to one side. Again, in. And out, over to one side. In. And out and down with the arms. Now make an inner space between the feet. Breathe in with the arms up. We're doing the hide and seek playing palm tree. Breathe out, open the arms to one side. Breathe in into the middle. And breathe out and sink down. Again in and out. And out, open the arms to the other side. Again in. And out and down. Again in and up. Out and down, we're leaning onto our knees. We're doing standing cat and cow. Breathe again in. And out, we're making a little of a back for cat. In, out, and in the back of the cow. Again. And out, again. Again in. And out of the cow. One last round, again in. Out. Again in. Out. And out, come slowly with the back up, back to the top of the shoulder. Next exercise. Let's do this. Breathe in, lift the arms up. Feet together. Now cross the arms, intertwine the fingers, reach high. Breathe out, reach to the front out of the back of the and again in. Now cross the arms differently. Breathe in, reach high. Breathe out, reach in front out of the back. Again in. And out and down. Now again in space between the feet. Breathe in, lift the arms up. And breathe out and open to one side. Breathe in the arms up. And breathe out, we're going down into the chair. Breathe in, come out for you. Come on out. And breathe again in, come up. And out, open the arms to the side. And in, up. And out and sink down into the chair. Breathe again in, come out for you. Come on out. And breathe out and come up. Now bring the arms down, but don't dive into it. Feet together, and we hang down. Now we do the moment. Breathe in and lift the right leg. Then breathe out and stretch the left leg. Breathe in and change. Then out and stretch the right leg. Again, in and change. Out and stretch the left leg. Again, in and change. Then out and stretch the right leg. In and change. Stretch the left leg. In and change. Out and stretch the right leg. Again, in and just down. Another penguin. Breathe in and lift the right hand up to the sky. Breathe out, bend the left knee, look over the right shoulder to the right hand. Again, in and the arm down. And breathe out and just down. And now breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in, hand again down. And out and down. And now we're doing the pelican. Make half the space between the feet. Shift the weight to the heels. And breathe in and come down. And breathe out and out. In and down. And out and up. And again. And out and up. And one last time, in and down. And out and up. Another trigger says counter back. Take hold on the elbows and gently rock from side to side. And hands again down, feet together. You can come halfway up to monkey half with a straight back. Breathe out and down. Again in, halfway up, straight back. Out and down. And now breathe in the upturning swan. Bring your arms up and bring the hands slowly down. Now the hands together and also the elbows. And now lift the arms slowly up. As high as it goes with a little bit of it. And release again. And again, the arms up. And down. Now the cashew intertwine the fingers behind the back. Have the feet joining this together. Breathe in, straight back, shoulders back. Breathe out, head over to one side, shoulder down to the clavicle. Breathe again in. And out and pull the hands down to the ground. Again in, lift the gaze. Turn the head over to the other side, shoulders back, breathe in. And out, chin down to the clavicle. Pull the hands down to the ground. Again, lift the gaze back into the middle. And now we stretch the Venus. Feet shoulder the wide apart, and turn the fingers behind the back. Bring them out to one side. Breathe in, strong up, tall up, and out. Head over to one side, and chin down to the clavicle. Breathe again in. And out, pull the arm and the shoulder down. Again in the lift the gaze, head up over to the other side. Also the hands over to the other side. Tall up, chin down to the clavicle, breathe again in. And out, pull the arm and the shoulder down. Again in, lift the head, back into it. And on the side. Good and sit standing. One arm behind the back. Tall up, bring the arm over to the head and carefully only a little bit out one side, just a little bit. No pulling, just a little bit. You can turn the head also a little bit up to the side where the arm is up. And again down back into it. And we're changing the arms, one arm behind the back, toe up, with the arm up, take the head and just go over to the side, no pulling. And we can turn the gaze also up to the side where the hand is at there. And again it's middle and up. And let's do the sky hug. Breathe in with the arms up. Without long arms open. Again in into the middle. Out back. The arms together. Breathe in, come up to the tip. toes, make an inch space between the feet and out and sink down into the chair. Breathe in and come up again. And breathe out and go again down. Let's do it one more time. Come up. And out and down. And again, in and out. And out, bring the hands down, feet together, and we don't eagle swings. Breathe in, lift the arms up. Breathe out the arms down. In the arms up. The arms down, and last movement where cactus collecting its things in the evening. Breathe in the arms up. Bring the hands to touch and lower the hands down to heart center. That was Zen Yoga. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today, cardiomyopathy. And after this done with, we're going to do short impingement training. And if you participate in a short impingement training, then it's very at your own risk. And we're talking here about the blood system, internal anatomy, and Addison. And this is no medical advice, we're just learning about it. Cardiomyopathy. It is a group of disorders of the heart muscle, which leads to progressive weakness of the heart, disturbance of rhythm, and eventual heart failure. The coronary arteries are usually normal. People of all ages, including children, may be affected. Okay, the heart muscle, so they're saying the myocardium. The heart has the coronary arteries where you're delivering the blood to the myocardium. And the myocardium is the contracting one, the cardiac muscle, the heart muscle. You know, the coronary arteries are fine, but all the other diseases, most of the other diseases, there was a problem with these coronary arteries delivering blood to the heart muscle. Now the heart muscle itself gets weaker. Symptoms: shortness of breath, core, angina. Yes, angina. Pectoris, angina, pectoris, so angina. Pectoris is not randomly the name for the chest in Latin. Angina. Duration. Cardiomyopathy is a progressive disease, usually lasting some years. Okay, cardiomyopathy is progressively getting worse over years. Causes. The cause of cardiomyopathy is not usually known, though some types have a heredity bias and some are associated with other diseases. Alcohol is our next one. Okay, cardiomyopathy can be alongside of other diseases, more likely, and it can be also hereditary, so in the family and in the genetic a bit. And another reason to have it known is drinking alcohol. When to consult a doctor, if there is unexplained shortness of breath, a core, or a physician so if there's shortness of breath or a single cord or if physical exertion brings on angina. So by angina, so by chest pain, by shortness of breath, which isn't explained through physical exercises, and one little tiny core. Do I say? No, I don't know really what I mean. I think I mean coring. I don't know what I mean. What the doctor might do. The doctor will treat the symptoms with a variety of drugs. He will also, or she will also send you for special tests to determine the precise nature of disorder. Okay? There are drugs to treat it for some people and making special tests to firstly know what it is. These may include giving an anesthetic, to take a specimen of heart muscle for microscopic examination, whatever, some type of test. A heart operation may sometimes be necessary to alleviate the symptoms. A heart operation. Prevention. When there is family history of heart muscle disease, or when there is an abnormal known to have a hereditary bias, an abnormality known to have a hereditary bias, the risk should be understood by those contemplating parenthood. Okay, but they are telling that the people should should know that cardiomyopathy has an increased chance to be by the children if they get children if they have themselves. Outlook. Once symptoms have developed, the disease is likely to be well advanced, but with treatment it may be controlled for many years. The outlook depends on the type of cardiomyopathy. And again, this book is 40 years old, so maybe there was more than. Okay, there is maybe some option of surgery, was there somewhere written? A heart operation, prevention, but this is 40 years old, so I don't know if it's still the case. But people should know that it is more likely to be with their children if they have it themselves. And the outlook is, when it's found, it's already well advanced, but with treatment, the person can oftentimes live on for many years. Now again, this is 40 years old, maybe there was many done. The things which treated drugs and surgery and so on, but all sounds, and already for many years treatable, maybe there was even a lot done. Okay, that was cardiomyopathy. That is a weakness of the heart muscle itself getting progressively worse over years, for whatever reason. It doesn't really make sense. Okay, for whatever reason. Now, that was the medical part. If you participate now in the short impingement training, then it's better to So if you're here for medicine, you can go directly to the next part of medicine. We will do now the short impingement training. If you're staying participate in the short impingement training, it is better to own risk. Go to step stand, and we don't shoulder circles, we come back, up, front, and down. And backwards. And now, long arms, strong fists, and we go as far back as we can with the shoulders, high up, and then front, and down, again back, up, front, and down, and again backwards, up, back, down, front, up, back, down. Legs wide apart, a bit into the knees, hinge forward with a straight back, with the arms hang, and pinch the scapulars together. The accelerating motorcycles. Pinch the scapulars with effort together. Make fists, lift the arms up and still pinch the scapulars together. Lift the arms down and the shoulders. Another time. Arms down. Shoulders together. Make fists, lift the arms up and still pinch the scapulars. Get the arms down. And now the sheet jump into the knees, pinch forward, round back, with the arms hang, big fists, turn the arms to the inside, arms back and together, straighten up, bring the shoulders down, together. And the second round into the knees, hinge forward, with the round back, let the arms hang, back fists, turn the arms to the inside, let the arms right up, bring them together, straighten up, bring the shoulders down and together. Release. Next exercise. Go to step stance, still. And just lift the arms up. If this exercise causes pain, then don't do it. But if any other one causes pain, then don't do it. Again, the arms up. Last time. Arms together and to the other side. And it was the last time. Now we will lift the good and stable stance, long arms, strong fists, the shoulders down and together, and now turn the arms to the inside. And change. Arms to the outside, shoulders still down, together. Arms to the inside, Shoulders down, together. And last time, arms outside, shoulders down, together. Next exercise. It's so stark. Arms up, and shrug the shoulders up, and go down. Again, the arms up, shoulders up, and go down. Last time, arms up, shoulders up, and go down. Another press circle, arms together, bit down to the outside. And together, and now the sunlight. You can use also a tennis ball or something else, have it with a long arm at the outside, let it fall down, and try to catch it again. And on the other side. And now stretching one arm in front, shoulders back, down, the arm in. First explain that the shoulders back and down, pull the arm in, have flat fingers, try to relax the arm, go it back with the shoulder, and then the palm a bit up to the sky. The big muscle in the chest is the pectoralis muscle. It must mean something. Pectoris, like chest in that. The arms back and forth. Shoulders back and down. The arm, flat fingers. Relax the arm, go it back with the shoulder, turn the palm up to the sky. And the other arm in front. Shoulder back and down. Pull the arm in, have flat fingers. Try to relax the arm. Go it back with the shoulder and turn the palm up to the sky. That was the shoulder intervention training. I thank you very much and until the next time. Hi and welcome. I'm trying to learn medicine. Today, torn knee cartilage. And after we've done it, we're going to do Neckstretching. And if you participate in the Neckstretching, then it's at your own risk. And we're talking about internal anatomy, injuries, illness. And this is also no medical advice, we're just learning about it. Torn cartilage, but it's all the time about the knee. A knee, but I have just the first words. A knee injury in which a sudden twisting movement tears one of the cartilages. And the cartilages are two firm elastic shock absorbers that lie between the ends of the bones in the knee joint. Okay, there is the knee joint, and there are the bones, and the other bone, and at the top of them there are the cartilages. And they are there to absorb the pressure. Okay, and now through two sudden twisting movement, these cartilages can get a break, get a tear. The tear is commonly sustained by sportsmen or sportspeople, sportswomen, particularly footballers, people who work in a squatting position, for example, miners. I don't know if I've seen coal miners working in squatting position. Whatever, people who do a lot of work with the knees can get it. Symptoms: pain in the knee following an abrupt twist of a joint. Okay, it's pretty easy to recognize. But maybe not. Maybe the patients don't have. Okay, after a sudden movement there's pain in the knee, swelling of the knee, sometimes locking of the knee so that it cannot straighten fully. Causes twisting of the knee when the joint is bent and the lower leg is flexible. Twisting of the knee when the joint is bent and the lower leg is fixed firmly on the ground. And then turning. So the leg is twisted, is firmly on the ground. The joint is bent and then the leg is turned. Yeah, maybe if I would do it now, a lot of pressure. It's not a nice thing. Duration. Unless the torn cartilage is removed, the knee is susceptible to further disabling injuries. It gets worse on. The torn cartilage has to be removed, and the cartilage doesn't really grow back. The knee is susceptible to further disabling injuries if it is not removed. Treatment in the home. Keep weight off the affected knee, so don't walk anymore and don't stand anymore. When to consult the doctor? Immediately. Symptoms develop. I have to have some real cases. Because this sounds really serious. And now if it is that serious, I want to know how easy it happens. So I want to have some real cases. When to consult the doctor immediately, if it's a loser. What the doctor might do: advise resting the knee, yes. Refer the patient to hospital for an operation to remove the top. Yeah, what happens when the cartilage can't be just removed? Okay, but this is advised to hospital to remove the torn cartilage. Outlook: the knee generally recovers satisfactorily. Why? If the cartilage is removed, how does it heal again? Okay, whatever. They're saying it's not that bad. It goes back, but if a sportsman, woman, people, person, ability may be affected by it. Okay, it's not clear from that how serious of an injury that is now. If it is a little affected, or it is, you can't run with it anymore. With it. You can walk again, but not running. Or is it just, yes, you can even run really, no, but just 100% professional athletic sport is a bit problematic. There's a big margin between not completely 100% athletic sport and you can walk a little. There's a big difference. Outlook: 10 to 20 years after the injury, osteoarthritis may develop in the knee. Why? This is basically the follow-up question to why does it heal at all? Okay. Torn cartilage. I think the useful information of them actually to use, but this is not medical advice. If there is a sudden movement on the knee, then the cartilage can tear, and that is pretty problematic. Don't move it anymore, consult the doctor, maybe surgery. It should go satisfactorily back the ability to walk, run, but it can make further problems, and also osteoarthritis is more likely. Now that was the torn knee cartilage part. If we were here for medicine, you can go directly to the next part of medicine. We will do now the Neckstretching. If you participate in the Neckstretching management at the arm risk, go to 7%, and we're doing the Hydro Tower. Breathe in, let the arms up, and reach the fingertips as far away as you can. Reach as high as you can, and again back down. Reach as far as you can with the fingertips, and another round. Reach as far as you can with the fingertips. Again down. Reach it, stay. And now a circle. Reach again and from as far as you can with the fingertips. And reach high with the fingertips, and not just to the sides but also back. Reach as far as you can. Reach down as far as you can. And another circle. Reach as far as you can with the fingertips. Now the buzzer. Feet are standing together, arms up to a T, and pretend to fly. And next exercise for police officer. Feet are standing together, pretend to the arms up. And breathe out, open the arms to one side. Breathe in the arms up. And out over to the other side. Again in the arms up. And out and down. Now, legs are standing shoulders wide apart, torn up, shoulders back. Breathe in. And out, bring the head over to one side. Breathe in. And out the head down to the clavicle, so chin down to the clavicle. Breathe again in. And out, lift the gaze and turn the head over to the other side. Still tall up, shoulders back, breathe out. And bring the chin down to the clavicle. Breathe again in. And out, lift the gaze and turn the head back into the middle. And out the way upside directly. And the chin down to the clavicle. Breathe again in. And breathe halfway out. And bring the head over to the other side in a circular movement. Breathe again in. Breathe halfway out. And bring the head in a circulatory movement to the other side. And back in the middle. Now with feet standing together. Breathe in, lift the arms up, the crab in the morning. And breathe out, lean back, open the chest to the sky, draw the shoulder blades together. Again, in the arms up. Out the arms down and draw the shoulder blades together. Again, in the arms up. Hands together, breathe out, lean back, lead in the wind. In. And out and again back. Again, in into the middle. And out on the other side. The final wind. Again in. And out to the other side. Again in. Now across the arms, intertwine the fingers and reach high. The screw. And breathe out, reach the front, all over back. The drill. Again in the arms up. And out and down again, we grip in the morning, draw the shoulder blades together. Again in. Lift the arms, intertwine the fingers, reach high, the screw. Breathe out in front of the drill, all over back. Again in and up. And out and down. And now, bring the hands together and also the elbows. Pull up. And bring the hands up. As far as you can come with moderate effort. And again down. And another time. And again down. And now, the pressure-based Layla machine exercise. We are taking fingers together. Yes, this is also possible. Together. And now reach in front as far as you can. Bend your head down and reach as far in front as you can. Breathe out. Again, in, come up. And breathe out. Again, in front. Head down, straight in front. Again, in and up. And up. And now the cashew. The feet are standing together. And turn the fingers behind the back. Turn up, shoulders back. Breathe in. And out, bring the head over to one side and the chin down to the clavicle. Breathe again in. And out and stretch with the hands down to the floor. Again in, lift the gaze and turn the head over to the other side. Breathe again in. And out, bring the chin onto the clavicle and pull the hands down to the ground. Again in, up. Back into the middle. And last full proper exercise, a stretch of Venus. Intertwine the fingers, bring the hands over to one side. Pull up, breathe in. Shoulders back and turn the head over to the side where the hands are. Breathe again in. And out, chin down to the clavicle and pull the arm in and the shoulder down. Again in, lift the gaze, turn the head over to the other side, arms also over to the other side. Tall up, breathe in. And out, chin down to the clavicle, pull the arm in and the shoulder down. Breathe again in, lift the gaze, and bring the head back into the middle. And now sky hugger, feet are standing together, breathe and lift the arms up. Breathe out, lean back, hop the chest to the sky, long arms, again in the arms up. And out and down, again up. Out and down. And now the eagle's wings, breathe and lift the arms up. Breathe out the arms down. In the arms up. Now the arms down. And the last movement, the cactus connecting its stings, breathe into the arms up. Bring the hands to touch and lower the hands slowly down to heart center. That was the next stretching. Thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today, acid regurgitation. And after we've done it, we're gonna do shoulder impingement training. If you participate in the shoulder impingement training, then it's better than ask. This is part 2 already. Now we try to take the information we have here and make them as a little presentation video. Now I forgot to say that we are talking about internal anatomy and illness. and this is no medical advice, we're just learning about it. Acid regurgitation. That is a condition in which the contents of the stomach flow back into the esophagus and cause inflammation. Okay, acid regurgitation, the content of the stomach are coming up into the esophagus and causing inflammation. The symptoms are a burning sensation behind the breastbone, which may spread up to the back of the mouth as wind is brought up, opened, giving a taste of acid and food. Burning sensation behind the breastbone, I still don't know where the breastbone is. A burning sensation behind the breastbone and a taste of acid and food, and maybe a taste of acid and food. The symptoms persist unless treated. Okay, we don't have to save it, I think, but it's too vague. Causes: lacks muscles at the lower end of the esophagus, food pipe where it joins the stomach. They allow acid to flow back up to the stomach, up from the stomach. Overindulgence, wearing tight corsets, belts, seatbelts, bending down or lying flat tends to force food from the stomach backwards into the esophagus, which consequently aggravated of symptoms. Okay, lacks muscles at the lower end of the esophagus, overindulgence, tight clothes, belts, seatbelts, and lying onto the tummy of his stomach, bending down or lying flat. Lying flat also. Down bending or lying flat. Legs muscle, then tight clothes, mechanical stress, overindulgence, legs muscle, overindulgence, tight clothes, seatbelt, whatever, and lying flat. Complications: peptic or reflux esophagitis. The lining of the esophagus becomes inflamed when ulcerated by the action of stomach juices. I don't know, it's not the explanation of inflamed and ulcerated esophagitis. Let's take a little exception. Let's look if we have esophagitis. Okay. Esophagus stricture, esophagitis. Inflammation of the esophagus and food pipe. The burning symptoms, duration, causes, complications. It's basically the same. It's just inflammation. Peptic or reflux esophagitis can it cause. Acid regurgitation. Very weird. Peptic or reflux esophagitis. The ligament of the esophagus becomes inflamed and then ulcerated. Let's say that. Peptic or reflux esophagitis. The ligament of the esophagus becomes inflamed and ulcerated. Stricture, narrowing of the esophagus may eventually result in narrowing of the esophagus. Inflammation, ulcerated, stricture, is that called? Stricture or narrowing, esophagitis, peptic or reflux esophagitis. Bleeding, usually a stenosis resulting in anemia. A reduction in the quantity of oxygen carrying hemoglobin in the blood. Anemia is the most common of all the blood diseases and occurs in various forms: iron deficiency, pernicious, sickle cell, and megaloblastic. Anemia, a reduction in the quantity of oxygen carrying hemoglobin. Let's not save it. Treatment in the home, not wearing tight clothes, small meals, or not. What the doctor might do: antacids, X-ray, investigate the cause. Overeating, overdrinking, overindulgence, and overweightness. Overweightness? They didn't list this as cause. Okay, we want to concentrate on the acid regurgitation. Content of the stomach flows back into the esophagus, and that can cause, so we say it here, and that can cause peptide or reflux.
Peptic reflux esophagitis, and that is inflammation and ulceration of the lining of the esophagus, and it can also cause stricture, narrowing of the esophagus. It can feel as a burning sensation behind the breastbone, can spread up to the mouth, and can taste like acid in food. The causes are lax muscles at the lower end of the esophagus. Lax muscles of the esophagus, but also overindulgence, wearing tight clothes belts or seat belts, or bending down can make it worse. There is the advice of eating smaller meals, to not wear tight clothes, and to not be overweight. And there are possible some treatments with medications. That is according to Keith Hodgkin's Family Medical Advisor, page 61. No, I can't say that all, no. Let's try it again. It is backflow, can you see it? Flow back. It is backflow of stomach content into the Achalasia of the cardia. That was the other thing. The food doesn't come properly into the stomach. That is Achalasia of the cardia. That's the big difference. Maybe we're going to do a video about it. No, that's the difference. I was wondering. The content of the stomach flows up, and the reason are lax muscles at the end of the esophagus, the food pipe, and it can give a burning sensation behind the breastbone. It can spread up to the mouth, and it can taste like acid in the food. The causes are part of lax muscles at the lower end of the esophagus, maybe overweightness and overindulgence in food and drinking, and bending forward or lying down, and wearing tight clothes, belts or seat belts. Was it all a part of the symptoms of the treatment? Yes, complication. It can lead to peptic reflux esophagitis, that is inflammation and ulceration of the esophagus, and also to stricture, narrowing of the esophagus. Probably also some other things. Here we had that Achalasia of the cardia can make esophageal cancer more likely. I would guess acid regurgitation does it too, but it's not written here, so maybe not. And it is advised to take smaller meals, not to be overweight, not to wear tight clothes. There is also medication against it. And that was it. Okay. But we're over time, and I have no time to do it now. So in the next part of medicine, we try to do the presentation of that what we learned here. Now we're gonna do the short training. If you were here for medicine, you can go right to the next part of medicine. We will do now the short training, and you participate in your home risk according to the sense, and we do forward shoulder circles. And backwards. Last time. And now, long arms, strong fists, and go as far back as you can with the shoulders. High up, and front, down, back, up, front, down, and again back. Now we're accelerating motorcycles, legs wide apart into the knees, hinge forward with a straight back, that's the arm thing, and pinch your scapulars together with effort. Make fists, lift the arms up instead, pinch your scapulars. And release. And another time, pinch your scapulars together. Make fists, lift the arms up instead, pinch your scapulars together.
And the sheet jump up into the knees, hinge forward, put it on back, let the arms hang, make fists, turn the arms to the inside, lift the arms high up and bring them together. Straighten up, bring the shoulders down, together. Arms high up, together, shoulders down, together. Relax. And then around into the knees, hinge forward, with the round back, let the arms hang, make fists, turn the arms to the side, lift the arms high up, bring them together. Straighten up, bring the shoulders down, together. And now, just lift the arms up. And again up. If this or any other exercise causes pain, then don't do it. Arms to the side and out front. Now the world lift up, long arms, strong fists, shoulders back, hands together. Bring the arms to the inside, shoulders down, hands together. Arms to the outside, shoulders down, hands together. To the inside with the arms, shoulders down, hands together. Arms to the outside, shoulders down, hands together. And release. Now arms to the side, a bit in front, arms to the front, shoulders down, hands together. Arms back, shoulders up, and in front. And arms in front, shoulders back, together. Arms back, shoulders up, and in front. And release. Now shrug. Lift the arms up, and shrug, shoulders up, and again down. Again the arms up, shrug, shoulders up, and go down. Again the arms up, and shoulders up, and down. Now pencil curl, arms together, a bit down to the sides, again down, and together. And to the next exercise, the sunlight. You can also use a tennis ball or whatever. Here is the long arm with the outside. And fall down. Try to catch it here. And on the other side. Now we're stretching. One arm in front, pull it in. The shoulders back and down with the arm. Pull the arm in and have flat fingers. Try to relax the arm. Go a bit back with the shoulder and turn the palm up to the sky. A bit. And the other arm in front. Shoulders back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go it back with the shoulder. Turn the palm up to the sky. That was the shoulder pitch training. Thank you very much. And until next time. Hi and welcome. I'm trying to learn medicine. Today acid regurgitation. And after we've done that, we're going to do standing yoga. And if you're participating in standing yoga, then it's at your own risk. And we're talking about illness, disease, internal anatomy. And this is no medical advice, we're just learning about it. Okay, acid regurgitation. That is that the content of the stomach flows back into the esophagus. That happens because the muscles at the lower end of the esophagus are too lax. It gives pain behind the breastbone, and also it can spread up to the mouth, and it gives a taste of, it can give a taste of acid in food, because there's two legs muscles at the lower end of the esophagus, and it gets worse through bending down, lying down, overindulgence, and wearing tight clothes, seatbelts, belts, and complications. It can lead to peptic or reflux esophagitis. You should say just esophagitis, because we don't know that much about it. I don't know what peptic means, or reflux esophagitis. It can result in esophagitis, and where the ligament of the esophagus become inflamed and ulcerated. And it can also cause stricture of the esophagus. Esophagitis, where the ligament of the esophagus become inflamed and ulcerated, and it can cause also stricture, snaring. It's like that, yeah, stricture, then brackets snaring of the esophagus. I don't know what it means. Now, and when we're having a treatment in the home, and that is advised, it maybe gets better. It is when advised, it is when here advised, maybe to take smaller meals, not to wear tight clothes, to eat seated, and avoid being overweight. Try to bend only at the knees. Many people are not able to. There are also antibiotic prescribed antacids, antacids, antacids. Is it ant like the end of the end? Antacids? Whatever. There's also medication, and that is it. Let's just try to look how far we come. I'm going to start the camera. Second one, let's just look how far we come. Acid regurgitation. That is when food comes from the stomach back into the esophagus, because the muscles at the lower end of the esophagus are too lax. It can cause a burning behind the breastbone, and that can spread up to the mouth and can give a taste of food and acid. And it gets worse through bending forward, lying down, wearing tight clothes, belts, seat belts. And the main reason is that I want to know what exactly now. What I want to say here, bending down, wearing tight clothes. Overindulgence was the thing. I'm not going to say that again if I make it good the first time. That is as lax muscle at the lower end. Then it can lead to esophagitis, and maybe also stricture. It is advised in general not to wear tight clothes, to eat small meals, seated, and not to be overweight and to overindulge. There are also medications, and that is very needed. Acid regurgitation is when the food of the stomach comes back into the esophagus, because the muscles at the lower end of the esophagus are too lax. It can cause a burning behind the breastbone, which can spread up to the mouth, and that can taste like food or acid then. And it gets worse through bending forward, lying down, or wearing tight clothes, belts or seat belts. And it can result in peptic and reflux esophagitis, that is inflammation of the ligament and ulceration of the ligament of the esophagus, and also to stricture, narrowing of the esophagus. It is here advised to eat smaller meals, to avoid overindulgence, to be overweight, and also to eat seated up, not to wear too tight clothes. There are also medications. And that is according to Keith Hodkins, Family Medical Advisor, on the page 60 and 61, and this is no medical advice. I think it was quite good. I'm going to stop the camera. And let's spend a minute or thought. If you make a video, which is called the difference between acid regurgitation and Achalasia of the Cardia. I think we're going to do Lava Yoga now, but we're going to do the video, I think, in the next video. So, if you were here for medicine, you can go directly to the next part of medicine. We will do now the standing yoga. If you stay and participate in the standing yoga, please visit the arms. The feet are standing together. We do the heel swings. Breathe in at the arms up. And breathe out the arms down. Again in the arms up. And out the arms down. Now the police officer. Breathe in the arms up. And out to the side. Breathe in the arms up. And out over to the other side. Again, the arms up. Make an inch space between the toes. Open to the side for the hide and seek plank palm. Reposition the arms up. And breathe out with sinking down to half chair. Again, in and up. And out, open the arms to the side. Again, in and up. And out and down. Again, in and up. Out the arms down, onto the knees. And we're doing standing cat and cow. Breathe in. And out, back around, back and heel of back the cat. Breathe in into the middle. And breathe out around the back. And into the middle. And out the cat. In. Out the cow. In into the neck. Out come around, back up, make it top and backwards. Shoulder, shoulder. Now, still the legs standing with an inch apart. Breathe in the arms up. Breathe out, open them to the side. Breathe again in, arms up. And out, arms on the side down. We're going down into full chair. Breathe in, come halfway up. Come higher. Out, down and up. Breathe in and reach high. Breathe out, open to the side. Breathe in the arms. And out the arms on the sides down into the full chair. Breathing in, come halfway up. Higher. And out and up again. Now, open ankle feet together, breathe in. And out, arms down, draw the shoulder blades together, open the chest to the sky, the crab in the morning. Breathe in the arms up. And out again, lean back. Again, in and up. Bring the hands to touch and lean back, the reach in the wind. Breathe in the middle. And out and lean again back. In into the middle. Out, lean over to one side with burn the wind. Breathe in into the middle. Out over to the other side. In into the middle. And out and down. Now we're doing the markhor. Breathe in. Lift the arms up. Out and lean back, draw the shoulder blades together. Breathe in, over cross the arms, intertwine the fingers, reach high. Breathe out, reach to the front, out the back. Again in the arms up. Out and down, draw the shoulder blades together. Again in, over cross the arms, intertwine the fingers, reach high. Breathe out, reach to the front, out the back. Again in and out. And out and lean back, over cross. Out, across. Again in, arms up, and now breathe in, come on up onto tiptoes. Make an inch space between the toes, breathe out and sink down into the chair. Breathing in, come up. And out and down. Again in and out. And now out with the arms over the sides down, the down diving dolphin, we are down with straight legs. Lower down the marmot, breathe in, and the right leg. And breathe out and stretch only the left leg. Breathe in and change. And out and stretch right leg. Breathe in and change. Out and stretch left leg. Again in. And out. Now breathe in both legs straight. And out just. Now we're doing the penguin. Breathe in, lift your right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. And bring the arm again down. And out and down. Breathe in the other hand up to the sky. Breathe out, bend the right knee, look over the left shoulder to the left hand. Breathe again in the hand down. And out and down. Now the pelican. Make a hand of space between the toes. Shift the weight to the heels.
And breathe in and go down. And breathe out again. Again in, up and down. And out and up. The last time in and down. And again out and up. Now take hold on the elbows and gently swing from side the ricochets counter. Arms again down, bring the feet together. Breathe in, come halfway up with a straight back into monkey arm. Breathe out and down. And again in, halfway up, straight back. Out and down. Now breathe in the up diving swan, bring the arms on the sides up. And bring them down. Now we're doing the garden pose. The toes are pointing to the outside, having an ulnar space between the toes. And breathe in, lift the arms up. And breathe out and sink down and place the elbows against the inside of the knees. Now breathe in, straighten up the back. And breathe out and cover the back up. Breathe in, back into the garden pose. Now you can repeat this movement, or you breathe in and out, and you come with a straight back up, tuck the pelvis and crown of head first up. Breathe out, the arms up again, and out and down. Now you can breathe in, straighten up. Either come over the back up or straight up. And breathe out, tuck the pelvis and come up. And down with the arms. Breathe in, the arms up. Out and down. And one last time, breathe in, straighten up. And out, tuck the pelvis and come up or come with the back up. Arms down. And out and down, breathe again in, straighten up. And now we're just coming up again and we're ending the garden pose. And we're doing one more exercise. First we're doing a screw. Feet are standing together, breathe in, lift the arms up. Over cross the arms, intertwine the fingers and reach high, breathe in. Breathe out, lift the arms down, over cross the arms, intertwine the fingers and reach high. Out and down. You can now do the screw again, or you do an exercise which goes onto the back maybe. Arms up to the side, breathe in, and out, bend with a straight back forward, the diver which goes maybe onto the back, down, make a round back. Now come with the crown of the head first up. Another time the diver, or you can do the screw again, breathe in. Out, lean with a straight back forward, this can go onto the back, make a round back. Crown of the head first up and the arms down. Now we're doing the cashew. Feet are sitting together, intertwine the fingers behind the back, breathe in, tall up, shoulders back. Breathe out, head over to one side. Breathe again in. And out, bring the chin down to the clavicle and pull with the hands down to the floor. Again in, lift the gaze. And out, turn the head over to the other side. Breathe again in. And out, chin down to the clavicle. And pull the hands down to the floor. Again in, lift the gaze. Turn it back into the middle. And the stretch of Venus. Intertwine the fingers behind the back. Bring the hands over to one side. Breathe in, tall up, shoulders back. And now bring the head over to one side and the chin down to the clavicle. Breathe again in. And out, pull the arms and the shoulder down. Again in, the head up. Over to the other side, also the hands over to the other side. Hand over to the side with the hands up. Chin down to the clavicle. Breathe again in. And out, pull the arm and the shoulder down. Breathe again in, lift the gaze, turn it back into the middle. And we're doing the sky hugger. Breathe in, lift the arms up, feet are standing together. Breathe in and out, lean back, arms wide. Again in and out, lean again back. Again in into the middle. And out with the arms down. And we're doing now eagle swing. Breathe in. The cactus characteristics in the evening. Bring the hands to touch and lower the hands slowly down to heart side. That goes for standing yoga. Thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today
cataplexy, and after we've done it, we do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And we're talking here about a medical condition, psychological medical condition, and this is no medical advice, we're just learning about it. Cataplexy, it is a sudden collapse of posture provoked by excitement. Symptoms: the head slumps forward, the jaw drops, and the knees buckle. The patient may fall to the ground but remains conscious throughout. Okay, I don't know what the word buckle means. Okay, the head slumps forward, the jaw drops, and the knees back down or whatever, and the patient may fall to the ground but remains conscious throughout. Duration: attacks may last up to 2 minutes. Cause: an attack may be provoked by any strong emotion, such as gaiety, sadness, or anger. Okay, strong emotion. A disturbance occurs in the part of the brain which controls the muscles. The condition occurs most often in people who suffer from narcolepsy. Okay, some people have it, and the people who have it have most of the times narcolepsy. And if they have a strong emotion like gaiety, so very much felicitous, sadness and anger, then they can have this attack, cataplexy, and for up to 2 minutes their head slumps forward, the jaw drops, the knees buckle, and they fall to the ground, but they stay conscious. Complications: none, unless an accident should occur as a result of a collapse. Okay, the problems are that the person falls, but not else. Treatment in the home: none advised. When to consult the doctor if an attack occurs. What the doctor might do: arrange hospital tests to check diagnosis. Prescribe drugs to reduce the frequency of attacks. I cannot think differently when these drugs have a lot of effects on other things also. And if not, then there's a question: how is it possible to make a drug which has an effect on not having cataplexy, oftentimes together with narcolepsy, that the person, if a person has a strong emotion, gets this attack and falls to the ground? How is it possible to suppress that or to make it less frequent without that the drug has a severe impact on many other emotions and the things that make humans humans? So basically the question is, how is it possible to do that? No, first the question is the drug doing that. Outlook. Cataplexy is Cataplexy is a minor disorder. There is no complete cure. A sufferer usually experiences his or her first attacks during adolescence, and they are likely to persist throughout life. Okay, this book is from the 80s, so maybe there is a complete cure. Okay, I think that's very interesting. Okay, cataplexy, I find it very interesting. It is that the person oftentimes has the person also narcolepsy, whatever now makes the other one more likely. And this person then has strong emotion, joy, gaiety, sadness, anger, and just breaks down, but stays conscious. The problems are resulting from the fall. There are maybe medications to reduce the frequency. It was cataplexy. There is a medical part. If you're here for medicine, you can go directly to the next part of medicine. We will do our shoulder impingement training. If you stay and participate in the shoulder impingement training, and that's what you ask. Good and step sense, and we're doing forward shoulder circuits. Come back, up, front, down. And backwards. And now, the long arms, strong fists, and we're going with the shoulders as far back as we can. And high up, as far in front as possible, and down, hand again, back, and into front, and down, and up backwards, high up, back,
down, and in front, up, back, and down. Now the accelerating motorcyclists. Legs wide apart, into the knees, hinge forward, with a straight back, let the arms hang, and pinch back, scapula together. Make fists, lift the arms up, and pinch the scapulas with effort together. And release. And the second round, pinch the scapulas together with effort. Make fists, lift the arms up, and step, pinch the scapulas together. Release the scapulas. And the next exercise, where she jump into the knees, hinge forward. This time with the arms back, let the arms hang, make fists, and the arms to the inside. Let the arms high up and bring the fists together. Straighten up and bring the shoulders down together. And release. And another time. Into the knees, forward. The arms back, lift your arms hang, make fists, turn the arms to the inside, arms high up, edge together. Straight up, your shoulders down, edges together. And now, bring the arms up. And again down. Just up. If this exercise or any other one causes pain, then don't do it. And last time. Arms to the side, and arms in front, and again back. And in front, and back. And now for bird lifter. Go to the same stance, arms, legs wide apart, long arms, strong fists, shoulders down, together. Now turn the arms to the inside. Arms to the outside, shoulders still down, together. Arms to the inside, shoulders down, together. Arms to the outside, shoulders down. Release. And now the arms to the side, a bit in front, hands on the fists. Bring the arms into pronation, so in front, shoulders down, together. Arms back, shoulders up, down in front. Another time the arms in front, shoulders down, together. Last time arms back, shoulders up, down in front. Now shrug, arms up, shoulders up, and roll down. Again the arms up. And now with the pretzel, arms together, a bit down and to the outside. That was the last time. And now something up. You could also use a tennis ball or something else. Have it with long arm to the outside, let it fall down, try to catch it again. And on the other side. And now stepping. Take one arm in front. Pull the arm in. The shoulder is back and down. Pull the arm in, have flat fingers and try to relax the arm. Go a bit back for the shoulder. Turn the palm up to the sky a bit. The other arm in front. Shoulders back and down.
Pull the arm in, have flat fingers, try to relax the arm. Go with back, shoulder, and turn the partner to the sky. That was a short video training. I thank you very much, and until the next time. Hi and welcome. I'm trying to learn medicine. Today, Achalasia of the Cardia and acid regurgitation. And after we've done that, we're gonna do standing yoga. And if you participate in the standing yoga, then it's at your own risk. I'm talking about internal anatomy and illness and diseases, and this is no medical advice, we're just learning about it. Now, the objective of this video is basically to find for us the difference between Achalasia of the Cardia and acid regurgitation, basically out of curiosity, because it's pretty similar, but just the other way around, as far as we have it. We have them done individually, both, but now let's look at the similarities and differences. Achalasia of the Cardia. That is a rare disease in which the muscles of the esophagus fail to work properly. Normally, when food is swallowed, these muscles automatically set up wave-like movement to the esophagus that pushes the food down towards the stomach. The sphincter at the lower end of the esophagus relaxes and lets the food through. In Achalasia of the Cardia, the esophageal muscles and sphincter do not respond to a swallow, and so food and salvia are retained in the esophagus, which becomes swollen. Okay, the swallowing doesn't properly ignite, or it doesn't happen properly with peristalsis, or the sphincter at the end is too tight, or whatever, and the food does not pass through, the food gets stuck in the esophagus. Acid regurgitation, a condition in which the contents of the stomach flow back into the esophagus and cause inflammation. And the cause is lax muscles at the lower end of the esophagus. Achalasia of the Cardia, the food gets stuck because the end is doesn't relax. The sphincter and the food goes not to the stomach but gets stuck. Acid regurgitation of the end of the esophagus is to lax and food flows back. Symptoms: we have symptoms: difficulty in swallowing, food felt stick, chest pain, and food and saliva can be breathed into the lungs. Acid regurgitation, a burning sensation behind the breastbone, which may spread to the back of the mouth. I don't think we are precise enough with the symptoms that you can make a difference or distinction, a difference or similarity. The one is burning sensation behind the breastbone, acid regurgitation. The other one is food felt stuck behind the breastbone, chest pain, difficulty swallowing, food and saliva, maybe breathed into the lungs. Causes not known, Achalasia of the Cardia, so why no reason is that happens. Causes of the other one, do we say lower, next muscles at the lower end of the esophagus? They use different things to say about caused it. So the causes are that the sphincter muscle ring at the lower end of the esophagus relaxes and lets the food through. Normally, like Achalasia, the esophageal muscles of the sphincter do not respond to a swallow, and so food and saliva are retained in the esophagus, which becomes swollen. Complications: we have Achalasia, pneumonia, bronchiectasis, high risk of esophageal cancer. You have one, peptic and reflux esophagitis, and stricture of the esophagus. Esophagitis by acid regurgitation. The ligament of the esophagus becomes inflamed and then ulcerated through the actions of stomach juice. Yes, because it was in the stomach and it got the acids of the stomach. The Achalasia of the Cardia was not in the stomach. It does not have the acids. Achalasia of the Cardia is not coming into it. It does not have the acids. Complication: pneumonia, bronchiectasis, high risk of esophageal cancer. So there's also something affecting the esophagus itself, and we still haven't found the difference between esophagus and esophagus. Maybe it's just a different writing. We haven't found it out. We wanted to do it in anatomy one time. But it's pneumonia and bronchiectasis, and that is because food can be breathed into the lungs. Why? Because it gets higher stuck. Food felt stuck behind the breastbone. They still don't know where the breastbone is. By the other one, peptic and reflux esophagitis. Inflammation because of the stomach juices, the acid. Treatment in the home, smaller meals and so on by acid regurgitation. The Achalasia of the Cardia. Small meals also. Seated, both advised to be seated. Frequent drinks in quantity. They say take milky drinks and antacids which coat the lower end of the esophagus. Antacids can be bought at the chemist, we say. Treatment of achalasia may be also with surgery with cutting or stretching the esophagus sphincter. By the other one, antacids. Let's try to gather together the information we have. Achalasia of the cardia is that after swallowing, the peristalsis movement doesn't properly work and pushes the food down into the stomach. The muscle ring, the sphincter at the end of the esophagus is too tight and the food doesn't get passed and the food gets stuck more or less in the esophagus. As regurgitation is that the muscle at the lower end at the esophagus are too lax and the stomach contents flow back into the esophagus. So that's the broad prescriptions, and what do they know? It gets a bit more complicated. What do we want to say in our little presentation, our personal, private, publicly published presentation? So the symptoms. Both give a feeling of burning sensation? No. The one gives a feeling of burning sensation because it had the acid in it. Now we're going to say it like that. Now, the one was in the stomach, so it has the acid and the acid juices and the stomach juices of the stomach in it, so it gives more a burning sensation behind the breastbone spreading up to the mouth. The other one, more like food is stuck with chest pain and then also the possibility because it gets higher stuck. What is the explanation of why it can be when breathed into the lungs and caused by bronchiectasis or pneumonia? And the other one, and that is why acid regurgitation can cause esophagitis, where the lignin of the esophagus through the stomach juices and the acid become inflamed and ulcerated. By achalasia of the cardia, independent of it. The risks are more that why is nowhere that it is when breathed into the lungs? Because it gets higher stuck? It would make sense, but if it comes by acid regurgitation out of the stomach, it is more at the lower end and there's no risk to breathe it in, but I don't know the exact anatomy to breathe it in into the lungs. If the other one is actually more stuck, more at the top, it makes more sense that it get then more breath into the lungs. Esophagitis, inflammation and ulceration of the lignin of the esophagus. By achalasia of the cardia, it is when because the food can be breathed into the lungs, pneumonia and bronchiectasis, and also an increased risk of esophageal cancer. But we want more into the differences. So maybe we're going to say not that much of a part of pneumonia and bronchiectasis, but maybe it makes sense. Both have been advised more or less to eat small and frequent meals seated up. There can be treatment to, if there's treatment, I think I said when you did the acid regurgitation, to cut the sphincter to make it more lax, to get the food pass into the stomach. There must be possibilities to make the sphincter tighter with sewing and situing it, making it more tighter. Maybe we're going to say, whatever we're going to do, we've at least 2 minutes in our yoga time. So that was the medical part. If you were here for medicine, and you can come directly to the next part of medicine, we're going to do standing yoga. If you participate in the standing yoga, let's put the arm. The feet are standing together, you're breathing in and lifting the arm, the eagle space. And breathe out the arms down. Again, in the arms up. And out the arms down. In the arms up. Out the arms down. Now in the arms up. And out open to the side of the police officer. Again, in the arms up. Out open to the other side. Again, in up. And make an inch space between the toes, open again to one side, into the middle, And out, we're sinking down into half chair. Breathe in, come up again. Out, open to one side. Breathe in, come up. And out, we're going down. In and up. Out and down, we're leaning onto our knees. Everything standing and count. Breathe in. And out, make a hell of a backward cat. Breathe into the middle. And out, make a hell of a backward cow. In. And out, cat. Again in. Out the cow. Again in into the middle. Now we come slowly around, back up and make a little top. And backwards, shoulder, shoulder. Now, breathe in, lift the arms up. Out, open to the side. Breathe in again up. Out, bring the arms on the side down, we're going down into the chair. Breathe in, come halfway up. Come higher up and breathe out and come up again. Breathe in and reach high. Breathe out onto the side. Breathe again in, reach high. Out, arms over the sides, we're going down into the chair. Breathe in, come halfway up. Higher up and breathe out into recovering up. Now feet again together, breathe in. And out, lean back, draw shoulder blades together, which is to the sky. Verkrab in the morning. Breathe in, arms again up. Out, again the arms together, shoulders together. In. Now across the arms, the 20 fingers, reach high with screw. Breathe and reach in front, out of the back, the dread. Again in. Out and back, the crab in the morning, draw the shoulder blades together. Breathe in, now across the arms, the 20 fingers, reach high. Forward reach, and hollow the back. Again in. And out to bring the arms over the sides down.
Down diving dolphin. Now down with marmot. Breathe in and bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Again in and change. And out and stretch the left leg. In and change. Out and stretch. In and change. Out. Now in the both legs straight. And out and down. Now the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee, look over the right shoulder to the right hand. Breathe in ahead and down. And out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee, look over the left shoulder to the left hand. Breathe in and down. Out and down. Now we're doing the pelican. Make a hand of space between the feet. Shift the weight of the heels. Breathe in and go down. And out and up again. And then in and down. And out and up. And the last time in and down. And out and up. Take the elbows with the hands and gently swing from side to side. Ricochets counterweight. Both hands again down, bring the feet together. And breathe in. Come halfway up with straight back, monkey half lift. Out and down. Breathe in, monkey half lift. Out and down. Now breathe in the up diving swan, arms up. And again down. Now stretch of Venus, legs shoulders wide apart. And find the fingers behind the leg, bring them over to one side, turn up, shoulders back, breathe in. And out, head over to one side. And the chin down to the clavicle. Breathe again in. And out, pull the arm in and the shoulder down. Again in and up. Out, turn the head over to the other side. Hands over to the other side. Breathe in. And out, head down to the clavicle. Pull the arm in and the shoulder down. Again in, lift the gaze. Turn the head back into the
Sky hugger the feet are together. Breathe in with the arms up. Breathe out, lean back with long arms. Out and lean back. Again in. Out the arms down. Doing the eagle swings. Breathe in with the arms up. Out the arms down. Again in the arms up. Out the arms down. Now the cactus collecting its stinks in the evening. Breathe in. Bring the hands to touch and now the hands slowly down to heart center. Right, force standing over. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today, cataract. And after we start next week, we're going to do shoulder impingement training. If you participate in shoulder impingement training, then it's at your own risk. And we're talking about internal anatomy and diseases of the eye. And this is no medical advice, we're just learning about it. Cataract. A cataract is a painless misting of the lens of the eye. Cataract often affects both eyes, or usually one more than the other. Most people over the age of 65 have some degree of cataract, but in the majority of cases it causes little or no inconvenience. Okay, there is some misting, so not good visibility, somewhere at the eye through the lens. It is painless, and by most people who have it, and by most of them over the age of 60, it causes only a little or no inconvenience, no problems. Symptoms. The vision, especially distant vision, becomes hazy or foggy, usually in one eye more than the other. Is it now for the people who have problems with it, or for everyone? Just if it's not that severe. The vision, especially distant vision, becomes hazy or foggy, usually in one eye more than the other. Close work, such as reading or sewing, is usually at first little affected. Okay, reading and close things doing are at the beginning not affected, but looking further away can appear a bit foggy, hazy foggy. Duration. Cataracts will last until they are surgically removed. They cannot be cured by drops, tablets or spectacles, and they will not disappear naturally. Again, this book's from the 80s. I don't think here something's changed, but again. Some develop so slowly that they cause a little visual difficulty until the patient reaches the age of 80 or 90. Others develop steadily but slowly. And a few, for no known reason, get rapidly worse over a period of a few months. Okay, the only option to remove them is surgically, so to cut it off. Maybe there's something with a laser possible. So. But oftentimes it develops only slowly over 20-30 years. It can also happen within a few months. Causes. The commonest cause is they say here that the commonest cause is advancing years. I would say that is not a cause. The blood supply which nourishes the lens becomes less efficient and the lens loses its transparency and becomes opaque. That's the cause. So the blood supply which nourishes, so which delivers to the lens, becomes less efficient, so it doesn't work so good anymore, the blood supply, and the lens loses its transparency and becomes opaque. I don't know what opaque is, but I think that is the color. Whatever, it loses its transparency. So the lens gets worse because over the time the supply of blood gets worse. Other causes of cataract are diabetes and, rarely, the secondary effects of some eye diseases, for example, iritis, glaucoma, or detached retina. We still need to look at some place to oesophagus and esophagus, but it's another story. We don't know the difference, maybe it's just spelling. But I think it was in this book, that there is somewhere in the beginning an anatomy part about the eye, so that you have clear what is no lens and retina and so on. Okay, it can be a part of other diseases, diabetes, iritis, glaucoma, detached retina. Treatment in the home. There are no simple treatments for cataract other than surgery, and this is better carried out late than early. This is because, while it is possible to retain useful and comfortable vision, even if one eye has a lens which is quite blind of cataract, it is uncomfortable and difficult to use the two eyes together when one has a lens in and the other does not.
The time for treatment comes when the vision in the better eye deteriorates to the extent that normal activities in enjoyment are interfered with. This is because while it is possible to retain useful and comfortable vision, even if one eye has a lens which is quite blind of cataract. Okay, vision is quite good even if one eye is affected, pretty strong. It is uncomfortable and difficult to use the two eyes together when one has a lens in and the other does not. We're talking of a lens which is naturally the lens of the eye. If surgery removes the lens, can the eye then see? Comes the lens back? Is it transplanted again in? I don't understand the treatment. The time for treatment comes when the vision in the eye deteriorates to the extent that normal activity, okay, whatever. We're saying rather late than earlier, but this is no medical advice. This book is 40 years old, whatever. When to consult a doctor? If you have any difficulty in seeing, what the doctor might do, test your vision by asking you to look with each eye in turn at a card with lines or letters or figures of different sizes to find out how small a line of print you can read with each eye, with or without spectacles. Examine your eyes with an ophthalmoscope. If you have cataracts but the vision with one eye is still quite good, the doctor might say that nothing needs to be done and ask you to return if you notice the vision in the good eye getting worse, or arrange a check in 6 months or a year. He or she may refer you to an eye specialist who may also advise you to wait or return from time to time to review the situation. If the vision in the better eye is bad enough to interfere with your way of life, the eye specialist will probably suggest an operation to remove the cataract. After an operation, special spectacles or contact lenses need to be worn, and it may take a month or two to adjust fully. Prevention. Generally, cataracts cannot be prevented, but if diabetic patients allow their diabetes to get out of control, they may hasten to develop of eye complications. Okay, if a person has diabetes and they don't control the diabetes through insulin injections or something, then these cataracts develop very harshly. Outlook. Although cataracts usually occur as you or the person, human, gets older, only 15 patients out of every 1,000 over the age of 75 need to see a doctor about them, and only a few of these need an operation. When an operation is performed, the results are generally excellent. I don't get it. Is now the lens gone? Is now the eind? Do we mean now with a lens to, like Lagasus, to run over the lens? Are the people now blind after the operation if they don't set the lens in? Or comes the lens in and after 1 or 2 runs, it is ground firm and it stays in there and the people have adjusted to it? Or is it just, I don't get it. Maybe it's just a vocabulary missing. Are the people now blind with their eye? No, we're telling it differently. But what happens now? Do we need no lens? Do we put the... Okay, but only 15, so only 1 promille, so 1 in 1,000 people, no, 10 in 1,000, 1%. 1% of people has a cataract which is more severe. Around 1%, and only of them a fraction, so around 1% of people has it more severe. And around 0.5% needs operation. The good question would be, why it is by some people then more? If almost everyone, let's say 80%, has it with the age of 70, why is it then only by 1% necessary to operate? If the cause is insufficient blood supply to the lens. Why is it then by some people necessary? And is there nothing possible to do about it? Just by the way, is there any way to bring to a targeted point oxygen? So basically, if there is insufficient blood supply to the eye, is there any second way to bring oxygen to the lens? I don't know, just there's a thing at the side, maybe it's not true, so maybe it's just a myth, but I once heard that people can also breathe a bit through the skin. I don't know if it's true.
But just even if it's just 1%, is basically the idea is it somehow possible to target to injection, whatever, to very specifically bring oxygen to one place? Very broadly, any way at all. Is it in any way at all possible? Maybe it is possible directly to inject blood. Okay, that was the medical part. Now, if you were here for medicine, go directly to the next part of medicine. We will do now shoulder impingement training. If you participate in staying with shoulder impingement training, then it's very how good is the and we know forward shoulder circuits. Back, up, front, and down. And now backwards. Is it possible maybe to enlarge one blood vessel supplying blood to the lens? Because what is the difference between the 1% who need an operation and the 99% who don't need it? And the only obvious known reason is the insufficient blood supply. Next exercise, we're having long arms, strong fists, and we're going back up shoulders, high up, and in front, and down. Again, back, up, front, and down. Again, up. No, we are going out. Back, down, front, back, down. How many people might wear glasses because they have cataract, but they are actually thinking they have other types of eye diseases? Okay, next exercise. Let's see the exercise. We're behind time. I don't know what the next exercise. I know the accelerating motorcyclists. In the knees, legs wide apart, hinge forward with a straight back, let your arms hang, and pinch the scapulars together. Now make fists, let the arms up still, pinch the scapulars together. Knees, let the arms down, and again, shoulders together. Make fists, lift the arms up and still, pinch the scapulars together. Lift the arms down, shoulders. And now the sheet jumper into the knees, hinge forward, with the round back, lift the arms in, make fists, turn the arms to the inside, lift the arms up and bring it together. Straighten up, bring the shoulders down, together. Release, and the second round into the knees, hinge forward, with the round back, let the arms hang, make fists, bring the arms to the inside, lift the arms up, and bring it together. Straighten up, bring the shoulders down, together. And releasing. In the next exercise, we are having long arms, not we're doing this, but the arms up and again down. If this exercise or any other one causes pain, then down to it. And now the arms at the side, then front, and front, and back. And the third is down. Long arms, strong fists, shoulders down and together. Turn the arms to the inside, shoulders down and together. Arms to the outside, shoulders down, together. Arms together, shoulders down, together. Arms to the outside, shoulders down, together. Arms at the outside, arms at front, in front of the arms, in pronation, shoulders down, together. Arms to the outside, shoulders up and in front. And arms in front, shoulders down, together. Arms back, shoulders up. And release. Now, arms together, a bit down to the outside. And together. And we shrug. Lift the arms up, hug the shoulders up, and release all down. Again, up, shoulders up, and down.
Last time up. Then down. And now, sunlight. I have the arm of the lower arm to the outside. Let something fall. Stop, go to your tennis ball, whatever. Try to catch it again. And one last leg trip on the other side. And the stretching. Take one arm, bring it in front, the shoulders back and down. Pull the arm in, have flat fingers. Try to relax the arm, cup it back with the shoulder, then the palm of it up to the sky. The other arm in front, pull the arm and shoulders back and down, pull the arm and have flat fingers. Try to relax the arm, cover it back with the shoulder and turn the palm of it up to the sky. In the first parts of medicine, we did interventional cardiology, and one technique there is to revascularizate, I think this is called the vessels again, start to make them free again. Is there any type of treatment which does this? I thank you very much, and until next time.